Good morning and welcome back to day two of the 2020 Oregon Housing Conference, virtual and online for the whole month of December. I'm Jason Renaud, coordinator of the conference. This is the first year the Oregon Housing Conference has been entirely online and virtual, and our subject, COVID and homelessness, makes us acutely aware of how important it is for us to both not meet together as a conventional conference about public housing, and also to maintain the quality and verity of our professional knowledge about these important subjects. In the design of these 2 days, I wanted to both capture a snapshot of how the pandemic is affecting people who are homeless and unsheltered, both today and back in February and March, as public health officials around the country began to watch the virus migrate from China to hometown America. And I wanted to capture a frank and self-critical analysis here in December on how 4 sample Western cities did, what they did, what their assets were, what they chose to invest in, what closed and failed, and what infrastructure was already available, and what endured throughout the pandemic. As you watch these sessions, please recognize that hindsight is 2020. Our public health leaders, both here and across the country, deserve our confidence and benefit of the doubt. We rely on their expertise, on their professional relationships, on their experience, on their resilience, and on their leadership. It's easy here at the end of 2020 to quickly look back and find fault, but that's the job of history and not our intention today. We won't learn from focusing on shortcomings. I selected 4 cities within the Ninth Circuit Court and their decision on Martin versus Boise. These are Las Vegas, Los Angeles, Phoenix, and Portland. We looked at Phoenix and Portland in day one, and today we'll look at Las Vegas and Los Angeles. Martin versus Boise will be discussed further in today's keynote by the legal director of the National Homeless Law Center, Eric Tars. And embedded within that decision is an opinion put forward by the US DOJ Civil Rights Division that cities cannot punish people for sleeping on the sidewalk or in a public place. This is their euphemism for being homeless, in the absence of an alternative space or a sanctioned sleeping area. This puts these Western cities and all, I think 10 states in a very different position than the Midwest and East Coast cities. City administrators, police chiefs, shelter operators, alcohol and drug, mental health service providers, neighborhoods, they've all built additional structures and programs, which all have withstood COVID differently, maybe a bit better, maybe with different solutions. Now that we're 9 months into it, it'll be interesting to hear from Eric Tars about how he sees the influence of Martin versus Boise in 2020. Now, a little housekeeping. Continuing education credit for the Oregon Housing Conference is available to those who have attended, and it'll come in 2 blocks, either day 1, day 2, or both, third block for 12 hours. The credit comes from the National Association of Social Workers of Oregon, and will certify 1 or both days for you. You do not need to watch the conference in real time. Everything is recorded and is available for you on the day 1, day 2 links throughout the month of December. On about December 5, I will send you a online forum to complete. And this is, again, only if you need continuing education credit. The form will be available to return to us until December 31st, but no longer. That is the cutoff for continuing education credit. On completion of that form, you'll receive a PDF document which shows you attended the conference, and you can take that to your licensing body in your state. I'd like to take a minute to thank the sponsors of this conference, the service and healthcare and governmental organizations which recognize and appreciate the value and potency of an independent and interdisciplinary dialogue on these crucial and timely and complex issues. Those sponsors are New Narrative, formerly Luke-Dorff, the Ganapati Fund, Aetna, Cascadia Behavioral Health Care, the Oregon Public Health Division, Regents Blue Cross Blue Shield of Oregon, the Oregon Health Authority and the Oregon State Hospital, Central City Concern, Care Oregon, Kaiser Permanente, the Oregon Community Foundation, Samaritan Health Services down in the Willamette Valley, Multnomah County, Telecare, and Washington County here in Oregon. I'd also like to thank our partners, people who help promote this conference. They're the Mental Health Addiction Certification Board of Oregon, we call it MACBO, Fourth Dimension Recovery Centers, and the Oregon Council for Behavioral Health. Now today our keynote speaker will be Eric Tarrs. He is the legal director of the National Homelessness Law Center, where he leads their human rights, civil rights, children's rights programs, and its cutting-edge litigation, strategic policy advocacy, and outreach and training at the international, national, and local levels. Eric helped spearhead the Law Center's National Housing Not Handcuffs campaign and has served as counsel on multiple precedent-setting cases, including Martin versus Boise in the Ninth Circuit Court. Now, before coming to the Law Center, Eric was a fellow with the Global Rights U.S. Racial Discrimination Program and consulted with Columbia University Law School's Human Rights Institute and the U.S. Human Rights Network, where he currently serves as the vice chair of the network's board. Eric also teaches human rights as an adjunct professor at Drexel University's Klein School of Law. Eric received his Juris Doctoris magna cum laude at the Global Law Scholar, as a global law scholar at Georgetown University, and he received his bachelor's degree magna cum laude in political science at Haverford College and studied international human rights in Vienna at the Institute for European Studies at the University of Vienna. Now, Eric will speak for about 30 minutes and then be available to take questions today, December 2, during the live cast of the Oregon Housing Conference. If you're seeing this recording after December 2, we're not live, and you're seeing a recording of the conference, and Eric will not be able to take your questions. If you want to ask a question of Eric Tarrs, put it in the chat box, and we'll capture it during or before or during Eric's talk, or email it to me before or during Eric's talk at coordinator.olmhc.org. That's coordinator.olmhc.org. When we're through with the keynote and the questions, our afternoon session will be on Los Angeles. So please stand by and we'll get started shortly.
Hello, I'm Dina Titus from Nevada's 1st Congressional District. I wish we were meeting in person, but with everything this year, we learned to adapt to our ever-changing reality. My district is in the heart of the Las Vegas Valley. It stretches from our international airport up the famous Las Vegas Strip north through the arts and medical districts to downtown Las Vegas and the historic Glitter Gulch. The first district is the most compact and diverse of any in Nevada. We have the Hispanic East Side and the Asian West Side. People from around the globe live here and visit here. My district is home to the largest employer in the state, MGM, and to the smallest, a taco truck on the corner. We've got the world's tallest observation wheel and 6 of the world's top 10 largest hotels. You can even get married at a drive-through wedding chapel where a mechanical arm throws rice on your windshield, so we have it all. It's an interesting district to represent even during normal times, but this year has been especially difficult for Las Vegas. The impacts of COVID-19 have been particularly hard on destination communities that thrive on large crowds, packed planes, and busy restaurants and shops. Conventions, trade shows, and live performances, big and small, are also a huge part of our area economy. In 2019, my district welcomed 43 million visitors from all around the world. And in January of 2020, we hosted 3.5 million visitors in what we expected to be another banner year. 2 months later, however, that number had dropped off to just 106,000. Given the lack of any kind of federal strategy to combat the virus, the states have been left to make their own calls in terms of restrictions. In Nevada, we're fortunate to have a governor who listens to the medical experts and makes decisions based on science rather than politics. I wish the same could be said about the current president. With over 250,000 Americans dead from the virus, over 11.5 million cases and rising, and millions out of work, now is the time for action, not for ignoring reality. Prior to COVID-19, homelessness was decreasing year by year in southern Nevada. But sadly, we know those who will be most adversely affected by the pandemic are the ones who are already the most vulnerable. People experiencing and at risk of homelessness, low-income earners, often on the front lines, seniors, and people with disabilities. In the earliest weeks of the virus, Congress came together to pass some initial programs and relief. When the CARES Act was signed into law back in late March, we were facing 112,000 cases nationwide. The CARES Act was an important step that provided state and local funding, set up programs like the Paycheck Protection Program for small businesses, expanded unemployment assistance, and sent stimulus checks to help keep people in their homes and their families fed. But we knew that more work was necessary as the virus continued to spread. Protective equipment and testing materials were in short supply. Many businesses were unable to access some of these important lifelines, and my constituents called the office desperate for assistance in accessing the funding that was available in those initial bills. That's why the House then passed the HEROES Act to provide comprehensive relief that honors our first responders and health workers, supports testing, tracing, and treatment, delivers additional direct payments, robust rental assistance, and homelessness service grants, strengthens food security, and restores unemployment benefits. We've been willing to negotiate with our colleagues on the other side of the aisle to pass some form of relief, but we've gotten little response. Over 324,000 people in Nevada continue to seek unemployment benefits, and our unemployment rate is nearly double the national rate. Right now, Las Vegas, in fact, has the highest unemployment rate of any metropolitan area in the country. And we know that without the additional federal unemployment benefits from the CARES Act that have expired, many people are also facing tough times making rent and mortgage payments. Yet the White House, Mitch McConnell, and Republicans on the Hill have decided to stick their heads in the sand and pretend the virus is just going to magically disappear. As a result, our states and cities have been left largely to fend for themselves. Here in Nevada, our state has no income tax and relies on sales and gaming tax, mainly from tourism, to fund our annual budgets. This has forced communities, school districts, and state agencies to make deep and drastic cuts, including to K-12, education, Medicare reimbursements, housing support programs, transit workers, and our first responders. In this crisis, as we've heard many people say, I know you all say it, housing is health care. The CARES Act provided state and local funding for Nevada, which helped set up a rental assistance program. But we've already seen huge demand for this, and our local governments have struggled to disperse the money by the federally imposed end of the year deadline. An estimated 30 to 40 million people are at risk of losing their homes when the federal eviction moratorium expires at the end of the year, including more than a third of renter households in Nevada. Evictions increase the likelihood that those people will experience homelessness, face poor mental and physical health outcomes, and have trouble finding employment. And their children will no doubt do poorer in school. The burden on our social service providers and shelter operators is going to become even more severe as resources are stretched thin to accommodate those who have become housing insecure as a result of the pandemic. That's why I supported $100 billion in emergency rental assistance and $75 billion in mortgage assistance, which were included in the HEROES Act. Under the HEROES Act, states would be able to provide rental assistance for up to 24 months or to cover up to 6 months of back rent and late fees. The HEROES Act also provided $1 trillion with special considerations for communities like Las Vegas that have been hit hardest by the economic impacts of the virus. House Democrats even worked on an updated HEROES Act we passed in October that was scaled down in an attempt to reach across the aisle, but still had a responsible level of funding to meet our most urgent needs. It also would have extended the deadline for the Coronavirus Relief Fund so that our state and local governments would have more time to spend the money that's been allocated to housing relief programs, and it isn't taken away at a time when it's needed most. My first priority has always been and continues to be passing a comprehensive coronavirus relief bill. It's far past time for Republican senators to come back to the negotiating table. I'm hopeful that with the next administration, we'll see a dedicated commitment from the federal government to getting the virus under control, with a national testing plan, ensuring effective and equitable distribution of a vaccine, and a commitment to more federal relief funds for our families, small businesses, and schools so they can make it through this. Our constituents' lives and livelihoods depend on us coming together to provide meaningful relief at the federal level. So I am grateful for all the work you are doing to help those who are hurting the most, and for giving a voice to those who are too often unheard in the halls of power. So thank you for inviting me to join you today, and please always consider me a friend and advocate in Congress. Good day.
Whether you are recovering from an injury or illness or looking for support and guidance to live a healthier life, Samaritan Health Services wants to be a part of your journey. Together, we can achieve wellness, strength, hope, and joy. Find inspiration to live your best life in stories of triumph, resilience, and determination at samhealth.org/together. Samaritan Health Services, building healthier communities together.
Jana Erickson with the Review Journal here. And here Our first case in Las Vegas in the homeless community first occurred at Catholic Charities, our largest shelter that serves about 500 men a night, or sleeps about 500 men a night. One employee tested positive on March 18th. By that time, shelters had already kind of started to see a increased demand and a decline in donations and resources. Another shelter in the same vicinity had no bottled water and were waiting for hand sanitizer and other hygiene products. So there is homeless outreach, but at the time, the general public was still kind of struggling with getting the right PPE. Just as such, the service providers were struggling as well in trying to distribute this amongst a population that is more vulnerable and is hard to reach in a lot of cases on a mass scale. On March 25th, we had our first homeless man who tested positive, and through the HMIS system, officials were able to figure out that he had stayed at two shelters. One was Catholic Charities, and the other is the 24-hour open air courtyard that sits across the street. And that is operated by, now it's operated by a nonprofit, but the city owns the property, and at the time they had been operating the property as well. And it was part of the city's plan to combat homelessness. The courtyard started in 2018, and over the last 2 years, it's still been under construction, but it's a work in progress, but they opened it up for the homeless because the need was so great that they wanted to provide a place where people can sleep safely outside with 24-hour security, a one-stop shop where they can access services, and among other basic needs as far as hygienic, using the restroom and washing their hands. At that point, they were able to tell where this man had gone, but they started screening. They started screening all the homeless individuals at each shelter to try to do some contact tracing to see who may have been exposed. After this case, Catholic Charities had to close its doors. That left about 500 people without a place to sleep. Even though the courtyard can sleep about 400 maybe, it's quite cramped, and it usually has several hundred people in there at any given point. Anyway, so the county kind of tried to quickly respond. In this case, they closed Catholic Charities because they wanted to do a deep clean of the facility, and the health district tried to help look for a temporary site. They added some beds at Salvation Army, and they opened up the street outside the courtyard, so people were able to sleep on the sidewalks, so that there would be more room for social distancing. But at the time, I had gone out to the street multiple times, where in Las Vegas, we have a kind of a corridor of hope. That's what the city officials call it, which is a cluster of services, including the Catholic Charities and the Courtyard and the Salvation Army and the Las Vegas Rescue Mission. They're all within walking distance of each other, and it makes it easier for people to get around and get their breakfast and their lunch at the different service centers. And Catholic Charities being closed, they were able to serve about 250 more meals, but all of the meals were becoming bagged lunches, and they were trying to accommodate for social distancing, so people weren't being served in their typical dining rooms. So for that day, that night, it was just the additional space on the street outside. I believe they closed both ends of the street so cars couldn't come in and people could safely sleep on Four Master Lane right there outside of the courtyard. At the courtyard, where I've been able to visit with residents that live there or use it during the day as a safe place. There's about 12 porta potties, and at that time, more people were using them. And the day after the Catholic Charities closed, the organization that services the porta potties and the hand washing sinks and the bring mobile showers to the courtyard did not come that day, and people were using porta potties that had been filled to the brim. And though there was soap at the hand washing stations, the water had run dry. People were still reporting to be sleeping inches away on their mats. We watched people get their mats, and they're rubbing elbows with the person next to them. And this is the conditions that other than some of the hand washing stations and porta potties being inaccessible, these are the conditions that most of the people do sleep in at the courtyard. So it was not socially distant, and a lot of officials were struggling with trying to incorporate those social distance, because it is part of how the people live. I mean, they survive by sharing things with each other, food, water, sometimes congregating in close vicinity. So I think it was a struggle to enforce the social distancing in the open air courtyard. Also, lots of people used to use senior centers or public libraries to feel safe. And that was not an option this time, or during this time. And what I did find very interesting in my reporting is I would go up to a lot of people and ask them how they're feeling about the virus. And, many people responded as, the virus is the least of our worries. We're trying to survive day to day, getting transportation, getting food, getting a job, like struggling to sleep outside in the elements. They weren't as concerned with the virus in their population. And I spoke to a researcher out of California who kind of echoed those same sentiments, that it is kind of survival mode out in the home, out on the streets. So for some, it was just another hurdle in their day-to-day struggle with being homeless. And now there were less services available, obviously. That made it more difficult. But personally, people people experiencing homelessness didn't seem to be as concerned about the virus as they were just living with the day-to-day hurdles of being homeless. So we were told that day that we got confirmation of the homeless patient at Catholic Charities. City officials were already starting to think what they were going to do, because now they had 500 beds that were not available to the community. So the city's emergency operations center was tasked with plans to house up to 1,000 people at Cashman Field, which is a former convention center, but there's also the city also utilizes the field complex right next to it. So they had already zeroed in on that site, but they hadn't known exactly how they were going to utilize it yet. But that was the site that they were probably going to set up a triage area for these, for the need of quarantining people and increasing social distance. It just wasn't working with the Catholic Charities closed. There were 565 people at the open air courtyard. You know, that's the most that the city had seen since it opened in 2018, and nearly double the nightly average of people that stay there. So you can imagine that on normal circumstances, people are sleeping inches apart. With 565, there was no room. I mean, they expanded it into the parking lot behind the courtyard, extra space for people, but there was no social distancing. And at that time, I was looking at what other cities in Nevada were doing. Reno had a temporary overnight homeless shelter and had placed hand sanitizer stations and portable restrooms throughout the county. Those kind of things weren't happening yet by end of March here in Clark County. But they did finally, March 28th, so this was only about 3 days later, they set up the first version of the Cashman Field shelter. And at the beginning, they had talked about setting down some carpet where people could sleep because they could not get mats so quickly, but that didn't pan out, and they ended up kind of spray painting these rectangles on the parking lot of Cashman Field or Cashman Center, excuse me, where they would provide screening for people. They said they were not going to use the inside of the complex because those were going to be prepared for hospital overflow. You know, everything was so unknown during this time that I think officials were trying to do their best in terms of, well, we want to make sure there's an indoor area where we can have people that need ventilators, and you know, how drastic measures could have been, they were preparing for the worst. So at that time, this was just a temporary solution where people could, you know, if they didn't feel comfortable at the Catholic Charities, or not Catholic Charities, excuse me, if they didn't feel comfortable at the courtyard where it was kind of overflowing at this point, the able-bodied people who can walk about a quarter of a mile to this area, they could sleep and be in a more wide open space that was going to be protected with security, and they can get screened. And if they do have the virus, I believe they were then sent to area hospitals. We had volunteers from the medical center coming and screening these individuals. There were portable hand washing stations and bathrooms, but they were not able to make it that they could take showers there. We talked to Michael Hamilton, a homeless individual who, you know, he said he felt unsafe sleeping so close to other people at the courtyard, and he was grateful for the lot. Most people that we spoke to did feel like it was a good alternative to being so close to other people, especially people that may have had diabetes or some other underlying health conditions. And a lot of people do, and that's how they end up homeless in the first place. Sometimes it's just so expensive to deal with their medical needs and provide food and shelter for themselves, and that's how they end up on the streets as well. So this Saturday night, the day after the temporary Cashman site opened, 66 people were there, or packed the shelter area. The courtyard was still overflowing. The next day, about 117 people were using this parking lot shelter. I went to the courtyard to see what people were thinking about the Cashman site, and if they felt why they were still at the courtyard, if they could kind of provide some of their insight. I talked to a man named Johnny Wingo. He said, you know, here, if you move your elbow, you're going to bump someone. But we have mats to sleep on. They're cushions, you know. There, we don't have tents, or what if the rain comes? So some people were concerned about being more exposed to the elements in a parking lot. Kathy Thomas Gibson, you know, she's the woman in charge of community services at the city. She realized that the parking lot shelter was being criticized. But her response was, I mean, we set this up in a matter of days. We really had to respond quickly. Every community is dealing with this, and especially in the West, she was in bidding wars with, or she said she was in bidding wars with communities in California who were trying to set up similar triage areas for homeless. It became a point where there was price gouging for basic homeless services that the courtyard has been receiving for 2 years. Suddenly they were like thousands of dollars more in bulk, and that caused a huge barrier for officials to put things together. This parking lot shelter soon received national attention. And Julian Castro, the former Housing and Urban Development Secretary, you know, he even reacted to the rectangles painted on the pavement, posing the question, Las Vegas has thousands of hotel rooms. Why are we not using this? Why isn't there a public-private cooperation? And this goes back to the main theme that I think kind of sums up covering homelessness, is it's not just one entity to respond. We've got advocates, nonprofits, government officials, and business leaders. And that cooperation with all of them is what makes the best programs. There are other programs in Clark County for people that are medically fragile, and working with private insurance companies, Clark County has been able to save them money and the county money by getting them into housing so that their emergency medical bills aren't through the roof, and that they're getting the medical attention they need for their conditions without overflowing hospitals. And those programs are public-private cooperations. So the question was, why wasn't that happening now? Lost where I was. Okay. But officials were saying, we've been trying to do this. We can't make landlords work with us. We can't strike a deal with private owners to use their hotels. Tim Birch, who oversees the Human Services part of Clark County, has always preached about housing first. And he's been doing that since before COVID, when the county earmarked like $12 million in marijuana fees to go straight to housing people with underlying health conditions, housing families. These are things that are just not available in the shelter system for the families or single fathers with children. So that has been something that Clark County has always talked about. It just, in the time of the pandemic, business leaders were unsure of what it would look like to house thousands of homeless people or hundreds of people in their particular properties. The resorts as well. I spoke to a representative of the resorts. Those were the biggest. Those were the people who were willing to go on the record just saying, well, our giant resorts are closed. It's not easy to open up a portion of our hotel to be utilized without opening up the entire resort. So the logistics weren't being ironed out. Either, as a reporter, I can say I've talked to the people on both sides, and I think it was just a matter of ironing out the logistics in a short period of time, and it resulted in the county and the city kind of just engineering their own approach. In days, they set up the Cashman Field. But then they announced that they were going to build their own site to isolate and quarantine homeless individuals. And in the same Cashman area, just a different part of the parking lot. So as people were still being screened in the parking lot rectangles, they were building this whole complex where it was going to have air conditioning. It was going to have beds, at least 350 beds. They were going to separate people by those who have symptoms but did not test positive, those who have symptoms, or those who test positive and have symptoms, and those who test positive but don't have symptoms. And then another area for those who are exposed and those were exposed to the virus, but they were not yet tested. And this was a joint collaboration between Clark County and the city of Las Vegas. It was about an $8 million investment. After they announced this, Catholic Charities said they're going to reopen. This was just about a week later after they closed. But they could only accommodate for half their capacity. In cooperation with the health district, they just want to make sure that people are going to be screened. Elderly and the disabled go in first, and every bed is going to be six feet apart. If there's anybody that appears to be symptomatic, they have a 10-bed isolation room set up. Sorry about that. They had a 10-bed isolation room set up where they could put those folks until the morning when, after the ISO queue opened up, they could send them to Cashman, where they could get better attention and quarantine. And then they closed the parking lot shelter to make room for this ISOQ facility, is what they called it, isolation quarantine. So 600 people did utilize the parking lot shelter over the course of just that short week that it was open. So this ISOQ was an $8 million investment between Clark County and the city of Las Vegas. This is what it looked like, or this is one of the quarantine rooms here. It is believed to be the first in the nation to approach such a facility like this, and it was erected in about 11 days. It was a huge undertaking with lots of people involved to get it set up and built, and then to get it staffed. And it was enough cots to house 500 patients. There was air conditioning, heating, power, lights, Wi-Fi, I believe. It was like a totally indoor facility that was built outdoors in these tents, but they were insulated. If it got so bad for some patients, they would obviously be taken to the hospital. And these would be emergency funds that FEMA reimbursed, or that's what they're expecting to get reimbursed from FEMA for the effort. The facility closed on June 30th. Though the capacity was for 500, it only served about 245 people. 17 tested positive out of 860 tests, and 22 patients recovered there. That kind of begged the question: was this, investment of $8 million, was it worth it? The city officials, Lisa Morris Hibbler, said, well, we couldn't tell the impact because we didn't have enough testing kits to test everybody. So on top of that, the county was also spending thousands of dollars to quarantine these people in other beds, such as WellCare Living and Crossroads of Southern Nevada. These are mostly rehabilitation, drug and mental health. Crossroads does a lot of drug treatment, and WellCare Living does drug and mental health treatment. But they opened up these additional beds so that they could help people too. So it seems that there were two things going on at once. The ISOQ was to help isolate people, but they could only be referred to by the health district, shelters that screen them, or the hospitals. So I do think that there was a less referrals as well, because they could only be, it wasn't a walk-up facility where the homeless could go if they felt sick and wanted to stay somewhere or something. So these other programs were being utilized a bit more because police officers know to drop people off at these providers for specific treatment or mental health. So I don't know if through my reporting, it was a question of, was there enough tests? Was there enough referrals? And did some of these other programs just make more sense money-wise, But one thing that did come out of it was the county was able to facilitate housing with these people that came into the ISOQ. So about 80% of the people that came to the complex, the county says they were able to put them in some programs to help them. I might stop sharing at this point because I think I don't have many pictures after this, if that's okay. But maybe one more. The ISO-Q ended up costing more than $32,000 per patient for the 11 weeks it was open. Clark County has come up with a much less costly plan since then, funding 161 quarantine and isolation beds valley-wide for a fraction of the cost. To fund the beds at WellCare for 90 days, it costs the county about $1.2 million. That's about, the same amount of days that the complex was open. And it treats about the same amount of patients that ended up needing the ISO-Q. We asked Kathy Thomas Gibson, was the cost of this operation worth it? Did we need to invest upwards of $8 million for a 90-day program that only a small fraction of people ended up utilizing? Her response is, what price tag are we putting on a human life? It was prudent at the time to put these safeguards in place because they weren't sure whether the pandemic would overwhelm hospitals and then they would have to, they would need the complex to the inside of the they would have needed Cashman Field to serve as another triage area for local hospitals. So I guess her response is hindsight is 2020. It could have been a lot worse, had we not had this in place, and then suddenly there were like 500 plus people that needed a place to quarantine, and we don't want the homeless overwhelming hospitals if they have low symptoms and they just need a place to stay. They don't need to be in a hospital bed to take up the place of someone who is critically in need of a ventilator or something like that. This is something that we've never experienced before. 2 years ago, we had a pretty significant outbreak of Hep A in the community or in the homeless community. And, we had our health district respond to that. They did outreach. They gave everybody vaccines. They couldn't give vaccines this time, but by the end of May, they still hadn't really gotten a good picture of what COVID had done to the homeless community. There weren't testings. There was still not a lot of testing sites. And as of May 25th, the health district said, we don't really know what the prevalence is in our homeless population. They were not considered a high priority for testing by public officials. According to emails that we obtained from Las Vegas officials, Kathy Thomas Gibson said in one email that the health district had no solutions nor responses for homelessness whatsoever. In March 9th, that's an email she sent out. And even when they were tested, the city's county and health district were not sharing the information with each other. So we kind of obtained a survey. We interviewed different agencies and we kind of put together that at least 530 were tested. The city, which conducted 442 of those tests, because they started testing at their courtyard as well, 20 came back positive. So that infection rate was much less than what the general public infection rate was. Of course, the sample size is much smaller. But tests were slowly starting to become available into the summer. Yet they still needed a clearinghouse for some type of coordinated data regarding testing of the homeless. And when one county official in a meeting said that, she was quite surprised to find out that the health district wasn't already doing that, you know. I sort of made the assumption that the health district was the one coordinating it, quote unquote, from one county official, director of social services, Kristen Cooper. That matter was not resolved by the end of that meeting. And talking to some experts in the field nationwide, that's not quite unique to just Vegas. This one researcher said this is a national failure. Many places, though that they had the resources, didn't kickstart testing the homeless population until well into the summer, even in San Francisco. So that was an interesting perspective too, because we're discovering that though the county and the cities had coordinated this big effort to isolate, the effort from the health district and these government entities to test was kind of slowed. And it appears from city emails that the city had tried, yet the health district just didn't have any solutions nor responses early on, and that's what caused the delay. You know, not only that, not only with the testing, but also the services were directly impacted. The Clean the World mobile shower trucks who used to come to the courtyard twice a week, they did not come from mid-March until end of May. They couldn't sustain doing their services. So many people, especially women, where there are just less beds for women here, had not showered in 2 or more months because of that. And other service providers were pulling out of the courtyard for fear of contracting the virus or putting their employees at risk. So they had stopped going to services. That was employment and job training, behavioral health and psychiatric counseling, and people that helped register them for government benefits stopped coming to the courtyard. So a lot of people that were seeking services there didn't have any other option than to just congregate there, and they weren't getting the services and they weren't getting showers, and it was definitely something that was quite frustrating for the people we talked to, and the city as well. I mean, those people go there to donate their time at the courtyard and provide the services as outreach, and well, some of them have contracts with Clean the World has a contract with the city, but maybe I'll just rephrase that one part. You know, they can't. Some of those service providers go there, volunteer their time, and the city has no control over whether some of those service providers come. But in other circumstances, it was just it just didn't. Or some people just had to halt operations for the mere explanation of not having enough donations to keep their services running during the pandemic. I think moving forward now, the main picture here is everyone's looking forward. We don't know what the long-term ramifications on our homeless population are going to be until next year, or maybe even, I mean, we still have a eviction moratorium until we still have an eviction moratorium for certain for certain people that fall under COVID-19 related financial issues or health issues. So the trickling effects we will continue to see until next year and beyond. So Clark County is and the city of Las Vegas are working on using those CARES Act dollars to further financial assistance programs and housing first, because if people lose their housing, it's going to be a harder battle to combat as we move forward. So I guess that's how we responded, or that's the reporting coverage that has occurred since March. But there's still so much more story to tell.
If you remember one thing today, remember this: you matter. And because you matter, the world is better when you're healthy. That's why Care Oregon helps our members get the care they need from the Oregon Health Plan, and lots of good things beyond health care. When you're stronger, you make everyone around you stronger too. That's the Care Oregon effect. Learn how to apply at careoregon.org/OHP.
It's very hard for people to take care of their mental health needs, physical needs, if all you're doing every day is trying to find a safe place to sleep. We're all in this together. And the struggles that some people have, that could be anybody. That could be, me in 2 years. I don't know.
The state of mental health in the country right now is very, very challenging. There's enormous need from many individuals, and oftentimes there's limited ability to access or receive those services.
Historically, whole health care has been, you've got your primary care provider, you've got your mental health provider, you've got maybe your addiction specialists, and they're all sort of doing their own thing independently with very little communication amongst them. But whole health care for us now at Cascadia is that we're bringing all these entities together under one roof. And that's really exciting because now I get to work for a team of diverse professionals with various skill sets, knowledge, experiences, and we get to all put our brains together to really work on finding the best solutions for patients and getting the best outcomes.
So if we can address health from the behavioral health perspective first and foremost, and then add on substance use treatment, physical health treatment, housing, employment, social factors, wellness, you put all of those together, and that really wraps around someone creating a sense of whole health. So we've followed 900 individuals who have received behavioral health services who also are enrolled in our primary care as well. We found that over 80% of those individuals had not seen a primary care doctor in over 2.5 years. Over a year and a half time, we found that we reduced their utilization of the emergency department by 18% and their inpatient medical admissions by 23%. I have never seen results like that in my career, and it is a testament to an approach that can work really well to improve people's lives. It would be ideal to have more centers like the Garlington Center, a space where people feel comfortable, both clients and our colleagues, a space that is respectful and safe, and a space that promotes this approach of providing whole health care, where individuals can get a variety of services that they need to improve the quality of their lives. And I could not be more excited for the creation of Garlington, because it creates the first step towards a model of care that hopefully we can deliver here in Portland. We always must have support from our community in order to create these centers that really serve many important goals in our community. So we really rely on the generosity of our donors to achieve that, and we're so grateful that people believe in the work we're doing and stand with us in helping us move that forward and create places like Garlington.
For over 40 years, Central City Concern has helped thousands of people to find homes, to regain health and recovery, and to build economic stability and resilience. Every year, CCC works with over 13,000 people across several domains. We provide health care, inclusive of primary care, addictions care, mental health, that is really person-centered. We provide supportive employment, walking alongside people to help them get meaningful wage jobs. And we work with people to find housing that is safe and supportive and affordable.
I went from homelessness to homeowner in a matter of 10 years. I feel, my story does help others believe that they can do it too, because I did it and I didn't think I could do it. Some people have never had a job, or maybe it's been a very long time. And so we are able to offer more compassion and coaching, getting people ready to get into a more permanent full-time position.
Because of CCC, I was able to get my prison sentence suspended because they see me out here working and cleaning up the town. I'm 36 years old, been in recovery for 19 months and 9 days. Got 5 kids at home. CCC actually helped me change my life because I got a job that I'm able to work with the background that I have, and I'm able to feed my children, and got a nice place to live, roof over my head. The people here at CCC are like family to me, especially my bosses. And yeah, they help me out with my recovery.
CCC has all the resources, the tools to get your life back in order. My name is Ralph Fakoko Tase. I was born and raised in Samoa. I didn't really think about recovery because I tried to get clean on my own. When you're talking to yourself, when you're trying to do it by yourself and you're trying to do it alone, it never works. I would be nowhere where I'm at without the support and the programs that CC has. I'm talking about from Hooper to the recovery program, treatment, the medical field as well. I FaceTime my son every Saturday now. For a very long time, that wasn't an option. I value things today. There's so much value in my life. If I can do this, anybody can.
The impact CCC has is outstanding. The patients and the clients we can reach to, the things we can help provide to them. I think they come in not knowing what we can really do for them, and then when we're able to show them that, I think they're just beyond grateful. Our care teams provide a lot. A patient can come in and just as simple as just have a checkup, but if a patient comes in that's homeless, they need more medications because theirs got stolen or their IDs have been stolen, we definitely go above and beyond and go out of our way to try to find them the resources that they need.
We're each a piece of this puzzle. We're all equal and we all have a place. When we're all in this together, we create one beautiful CCC picture.
Thank you, CCC, for all the advantages that you guys gave me and helped me out. I got integrity in my work just because of that.
Thank you, Central City Concern, and all the mentors that helped me along my way to become a better person.
And thank you to Central City Concern.
Faftay Lava CCC.
Hi, I'm Dan Field, Executive Director of Community Health and External Affairs at Kaiser Permanente Northwest.
Hola, I'm Rocio Acosta and I'm a Bilingual Engagement Specialist with Kaiser Permanente.
Hello, I'm Tracy Dan Grace, Director of Community Health at Kaiser Permanente.
Hi, I'm Aaron Waters and I'm an Equity, Inclusion, and Diversity Consultant for Kaiser Permanente.
Hello there, I'm Ron Scholes, and I manage the Northwest Employee Community Engagement Initiatives.
We're sorry we can't be together in person.
We applaud you in your efforts in working in innovative ways to serve our community members in need of vital services.
Congratulations on your accomplishments.
And thank you for all you're doing to support our most vulnerable community members in this unprecedented time.
We miss being able to gather together
and celebrate the great work you're doing in the communities where we live, work, learn, and play.
But we are navigating these uncertain times together.
And together we will become better equipped for a new normal.
We are resilient.
We will persevere.
And we will once again thrive.
Yes.
Thank you.
Nearly 1 in 5 U.S. adults currently lives with a diagnosable mental health condition. Yet the dominant treatment model is still one size fits all, focusing mostly on people's symptoms rather than their needs, goals, and dreams. We believe everyone deserves to participate in the community without stigma or fear, to have a safe place to live, hold steady employment, and to build lasting friendships. We're here to create a new narrative for mental health, to move away from treating mental health conditions as problems that need fixing and toward a model that embraces what you want out of life. We are New Narrative. Originally founded as Lukedorf, New Narrative has been serving the Portland metro area for over 40 years. Our first site opened with the guiding thought that hope, compassion, and community were the key to mental wellness. We have since grown from a single site to an agency made up of outpatient clinics, residential treatment, peer programs, a transitional age youth program, supportive, transitional, and independent housing, homeless outreach, and housing navigation. We still believe that hope, compassion, and community are the keys to mental wellness, but we also know there are many ways to get there. We believe achieving meaningful impact requires us to think differently, see differently, and work differently. We are intentionally working to change a system that identifies people by their diagnosis into a system that values the person. A system that understands a diagnosis is something a person experiences, but isn't who they are. We're here to change the narrative on mental health services, to retire the term mental illness and focus on mental wellness, to stop containing and start embracing, to ensure that people seeking services can find a safe place to live, hold steady employment, and build lasting relationships. We believe the health of a community comes from the visibility of its people. We all deserve to be heard, seen, and recognized. It's your story. Live it your way.
I'm Tim Birch, the Human Services Administrator for Clark County, Nevada. I'd like to thank the Oregon Housing Conference for hosting myself and my peers from the city of Las Vegas to be able to discuss how we've responded to this pandemic in the greater Las Vegas, Southern Nevada area. I suspect that my partners will talk quite a bit about the isolation quarantine, or ISO-Q complex, that we implemented jointly at Cashman Field. So I want to do something a little different and walk through what we've been drafting as we've gone through this process, and that is a pandemic playbook. It really is, for posterity's sake, to remember how we as a community responded and how we can implement these lessons learned for future emergencies. So let me go ahead and walk through that with you all. So a little background first. Clark County is located in Southern Nevada, so we're at the southernmost tip of the state. We encompass the largest urban area in the state and many rural areas as well. Clark County, as a jurisdiction, oversees the world-famous Las Vegas Strip, and an area covering about the size of New Jersey. We are the 13th largest county in the nation. We have about 2.3 million citizens, and we account for about 45.3 million visitors per year, including the nation's 9th busiest airport and the state's largest public hospital, University Medical Center. We also, not just regional services, but we provide direct municipal services to about 1 million residents in the unincorporated area. So if we were incorporated, we'd likewise be the state's largest city as well. So a very rich and diverse array of services. And the Department of Social Service, which is one of the departments that I oversee, is one of those regional service providers. So our staff are deemed essential and have been on the job since the beginning of this pandemic and continue to work through it all. So I want to stop at this time and just thank all the staff at the Department of Social Service for the incredible work that you do and have continued to do on a daily basis. So thank you. So the Department of Social Service is a small but mighty team in regard to the level of lift that it does. It is a staff of 120. We have 5 offices throughout the valley and provide an array of direct services as well as coordinated services. So in our direct service array, we provide financial assistance. It is directly to the client for the purposes of obtaining lodging and those types of services. Transportation assistance. We know that clients who are indigent do better with social connection. So if there's a family member who is willing to accept a client back and take them in and help support them, we will reconnect those individuals. And that's been extremely successful for us over the years. We have our Homemaker Home Health Aid program, which really is to keep people housed by providing them activities of daily life assistance. We also provide an array of senior services as well as long-term care. We provide that for the indigent throughout our community. We also provide cremation and burial services for all of our indigent clients. And we, as we began to pin together this human services array a few years ago, we took on the Aged Out Foster Youth program and picked that up from local nonprofits and began to adjudicate that and have had tremendously successful results. We've heard data that within 5 years of aging out of foster care, that upward of 20% will experience homelessness within a 5-year period. We've done our first 5-year longitudinal review and had less than 2% of our young people who have experienced homelessness because of the great array of services provided there. And so then we step back and we have this regional coordination role as well. So we provide our community resource management, that is our CDBG, ESG, affordable housing, building, coordinating all of those services. We also are the Continuum of Care, or COC, Regional Homelessness Collaborative Applicant, and have been since the 90s. And we also coordinate our Ryan White service providers and that service array in the community as well. So you see that this team that has taken on a large piece of this lived in partnership with local jurisdictions and partners has a wide variety of things that we do with a very small team responsible for taking all of that on. The continuum of care through which we've done a lot of the regional work, and we try to plug all of our new services through this kind of joint continuum to make sure that we're modeling the type of behavior that we want our nonprofits and other partners to emulate as well. Really has a rigid structure that we put in place through a charter via the Hearth Act. We came back around and re-examined what we were doing years ago, and we set up an ad hoc governance and membership group. They oversee several working groups, evaluation working group, data and systems, a youth working group, our monitoring group for all of the HUD contracts, our planning working group, community engagement, and coordinated entry systems. And you can see below those, there are also subgroups that are working underneath those. These are all manned and staffed with community partners who volunteer their time, regional and jurisdictional partners who come alongside and help anchor those groups as well. But it really is a joint effort, and our community has done a tremendous job of utilizing this system to overhaul our system, steer us, and provide some stability during very trying times. So here's a kind of a split of the structure. You'll see that we have our jurisdictional partners. Our jurisdictional partners make up a co-chair, a co-vice chair, and represent 6 partners. Our stakeholders likewise have equal voice at the table through a co-chair, a co-vice chair, and 25 partners represented at the table formally through our COC. And of course, we invite anyone who has even an inkling of interest in helping folks experiencing homelessness in Southern Nevada to come to the table and be present during our meetings and work groups. So our jurisdictional partners are Clark County, North Las Vegas, the City of Las Vegas, the City of Henderson, and the City of Boulder City. And we also have Clark County School District at the table because of so many of our families experiencing hardship. And they're there through Title I and their offices to help be a voice at the table during our conversations and planning as well. Which brings us to kind of why we're here, and that is to talk about how we walked through this pandemic. And so a very simple timeline on the screen here for you. You all remember in March that the president called out a state of emergency, and that our governor, Governor Sisolak, likewise called out a state of emergency in March. We began to see the effects of COVID in our community. We began to hear estimations that the homeless community would experience positivity rates from COVID-19 upwards of 50%, I believe was an article in the LA Times. So we had begun training and working with our health district and the CDC guidance to prepare our shelters. And of course, even with that preparation, the lack of personal protective equipment, or PPE, really was a major setback, as was the lack of access to testing. And those two things collided when we had our largest shelter provider, Catholic Charities, experience an exposure from a client to staff, which caused us to, in one night, have about 500 people on the streets. And it is no hidden secret as to the level of national coverage we got from our immediate response. Our partners and ourselves work very closely with our homeless population and listened to them very closely. And actually, the thing they were most concerned about was safety. They did not want to be dispersed throughout the community. They were scared I think we all were at that time not knowing the level of lethality of this disease to our homeless population. So they wanted somewhere safe they could be and protection from others as well. There had been some victimization in that community recently, and folks wanted a safe place to be. So in a matter of hours, we stood up what we could with partners from the community who would come out and help to be able to create a place where they could at least sleep safe for the night for a few days while we figured out what we could do. And CNN and some other folks came in, parachuted in, and covered that story with some headlines. And of course, I didn't stick around long enough to really get the fullness of the story. But that's one of the lessons learned that we'll share as we go through this. As we began to prepare a response, what we found very quickly was a lot of our vendors and partners and private businesses in the community upon which we would rely to stand a new process up were likewise scared and not available. We had our director of purchasing at the time go and drive in some porta potties from hours away. We literally could not find vendors that were willing to come out on 2 hours notice and drop tents, supplies, anything. People were scared and very telling. They were disproportionately scared of working with in and around our homeless population, which is one of the walkaways that we need to do by way of educating the larger community context, and that is that these are people, and so that was both a sad and pressing moment at the same time. So what we did was we began very quickly working with a partner with some that has exhibition tents. We had several party tent rental folks who dropped out when they found out what we wanted to do with the tents. We went to our partner at Vision Build, and Darcy and his team said, look, we can get this up. And we pressed and we pressed and we pressed, and we designed, implemented, and opened within 2.5 weeks a project that his team said would have normally been 3 months of planning and 3 months of building. And we'll have a video of that later on in this presentation. But our team responded very quickly to this pandemic and setback in ways that I think showed us what we could do in the future. So as we moved into April, we opened that isolation quarantine complex. We began to open other non-congregate shelter projects as well, which I'll talk a little bit more about. As we moved into May, we began to be able to take a breath and step back and look at how do we continue our coordinated entry process, how do we continue working through the COC, and the team developed a pandemic priority exception for our coordinated entry and began to route folks in that way. Again, looking on leveraging our success and being flexible and agile in the face of crisis. June, we stood down the isolation quarantine complex because we finally, as a community, had a full implementable and scalable plan for our surge hospital. That site was located in mid-April and had been planned out and was able to be able to fully be operationalized by that time, as well as the fact that we had non-congregate shelter that we've been exiting every one of the isolation quarantine clients to, and had enough capacity at this point to be able to isolate folks directly into hotel motel rooms. Which brings up the favorite question of all the media that came into town was, with all of the hotel rooms, why don't you put people in the Bellagio or the Mirage and just everybody gets a hotel room? Well, going back to my prior statement of partners being scared, no one wanted to be known as the COVID hotel, fearing they would not be able to recover financially after the crisis. And we won't call out names because that's not what we're here to do. But that was the overwhelming sentiment. We even had partners on the isolation quarantine complex project who we wanted to soft open and begin walking some folks into the far end of the complex, keeping distancing and all of the quarantine protocol in place, and just have some edges being buttoned up. And the vendors refused to be on the campus with anyone even 300 yards away sick. Again, a lot of fear and lack of understanding about their neighbors in the community who were homeless. As we moved in then to July, we began to stand up our CHAP program. I'll talk about that and our CHAP portal, which we opened in October. And as we moved into November, we began to stand up a specialized mediation process with the court and making sure that some of our CARES Act dollars, about $5 million, are carved out for that. And as we roll into December and begin to prepare to wrap up our CARES Act spending, we of course are all hoping for an additional CARES Act or some additional funding to come through. But we've begun to stand up a corporate landlord assistance program that we've modeled after some of the counties around the nation, and begin to and just continue to hope that we're able to get as many folks housed and keep them housed as possible through this time. So the pandemic, I talked a little bit about this, that the hotels, casinos, and nightclubs were closed down March 15th. That state of emergency went into effect, and we had to react very quickly. It meant that we had to plan for expansions of services to make sure that we could cover all of the needs of our 2.3 million citizens. The MAC was a major part of this. So our emergency management function, our what we call ESF 6, which is mass care, emergency assistance, temporary housing, and human services, of course, highly staffed by members of my team who took on the task of evaluating all the options on the table, finding the most cost-effective and logistically supportable alternatives that they could, and began to stand up congregate and semi-congregate sites so to make sure that individuals could be discharged from hospitals and more importantly, not needing to go into those hospital beds just for quarantine or isolation, but really trying to save those beds for surge for individuals who were the most sick. So our emergency response team, we really did a lot of planning out around how do we execute mass care, emergency assistance programs, temporary housing, and really just coordinate throughout the totality of the human services array in the community, including COAD, which is Community Organizations Active During Disaster, which is a local collaborative of all the nonprofits that step into this space, and they had voice at the table during this time. And then our recovery team, which is RSF 6, through that emergency management protocol, planning and standing up our housing and supportive services array. And again, using that joint command structure with all of the cities, with all of the health district representatives, and really just helps collect a lot of that. And we'll talk about that during lessons learned as well. And of course, using our COC and the coordinated entry response has been critical, I think, to the success that we've had. And our youth working group, we have a very high unsheltered teen population that are homeless, that are runaways, and making sure that someone was looking out for them during this process has been extremely valuable as well. So our non-congregate shelter approach, we really, with limited testing, and the social distancing protocols were extremely hampered during the early days of the pandemic. The drive, of course, was to keep people separated and healthy, knowing that our population on the streets is disproportionately experiencing comorbidities, which is the exact population you don't want being exposed to COVID-19. So we really had to look for ways to quarantine and isolate individuals and give them a way to be safe and heal. It's easy to issue stay-at-home orders for folks that look like all of us, that go home after work, have the resources to do that. But when you have no home to go to and you're experiencing wound care issues and diabetes and high blood pressure and things that now you can't hardly get seen for in an emergency room during the early days of the pandemic because of the overcrowding, it became very dangerous for our folks on the street. So we were cognizant of that every moment of the day. But we also had to think about our first responders, our hospital personnel, we deemed all of our social service staff, our social workers, our child protective services, our Department of Family Services staff, all these folks were deemed essential and were coming to work and doing their critical jobs every day alongside law enforcement as well. And so we had to make sure that we had a place for them to be. And then we still had as well some tourists coming into town and not heeding the CDC guidance or warnings or the science, and having to provide a place for them when they popped positive and could not go home. So we had this kind of three-legged stool of operations we had to think about in regard to our client base. And so we undertook that. We prioritized our high-risk groups first, and really took a deep look at initially trying to get the 47 beds that were being occupied by people experiencing housing crises, getting them out of those emergency rooms and into places that they could continue to heal. And working with partners to do that was a top priority. Again, creating hospital bed space for those that were most at need for that care during the time of ventilator shortage, and the things that feel like so long ago, but were just so hyper present during March, April, and May during the first wave of this pandemic. So that leads us to our isolation quarantine complex. It was our response to our congregate shelter standing down, and we'll just show you a little bit of a video here to give you an idea of the scale of this program. This young man you see on the screen, that was my pre-COVID look. I guess you're getting the COVID experience here in the smaller window. But this put together by our county television channel will give you an idea of the scale of this complex. So as you see through that process, the scale of that, and while it may look just like a emergency shelter operation, FEMA tent, as someone in the video comments had called it. It was much more than that. We have medical director staff on board. The staff tent was change in, change out. There was strict contamination protocol in place where medical personnel would be able to make sure nothing from the outside came in and nothing from the inside left out. It was an acute care observational facility for our homeless population. And that process was stood up again, as you heard, in just a few weeks. So I cannot brag enough on the teamwork, the staff, time and commitment that was put into this, as well as the interjurisdictional leadership between the City of Las Vegas Council and the Clark County Board of Commissioners, without whom the resources and the allocations that pulled this off in such a quick fashion that would not have happened. It moved with the speed and precision of some military operations. And so we were really fortunate to be able to have the level of support and team that we did on this project and continue to have in our community. No one left that facility to homelessness unless they just absolutely walked away during the screening process. Everyone who came in and was treated and observed was discharged to housing. That is a lesson we need to learn on daily operations at all of our hospital partners in town. Is something we strive to become the norm on. What you see on your screen here is the locations of sheltering beds that we have stood up during this process. So we have brought on, through our Crossroads partners, our hospital discharge, 33 beds, WellCare, another 14 beds. So these are direct hospital to home type programs on a scale larger than we had pre-pandemic. We have stood up several hundred, as you can see, hotel motel rooms with partners like the Rita Suites and the Four Points and the Super 8. Individuals who, after a few weeks, recognize their business models may not be returning anytime soon and were willing to take the risk to partner with us, provided the proper equipment, protocol, and training, and have been phenomenal partners for us. And we, of course, have also at a partnership with the Hilton, wherein our first responders, essential staff who have become exposed while attending to our seniors or our children have a place to be so they don't go home and expose their families. Again, we want to continue to mitigate this as much as possible. Our goal, of course, is to keep this almost 700 room capacity of what we've stood up during this time frame to date in play post-pandemic, and that will, of course, be a great charge and things we're hoping our partners will step up for. So coordinated entry, again, was something that we have done very well as a community. We did not want to lose steam on that, and the coordinated entry working group did a phenomenal job creating our pandemic priority exception, where they could use that in conjunction with our housing assessments and prioritize in and refer through the entry queue. The PPE was applied to make sure the individuals were over 65. Any of the CDC identified high risk factors were able to then jump into the front of the line and get the care that they so desperately needed to keep them safe. This was all about prevention, intervention, and mitigation. So you can see our priority response chart. This, of course, is in draft because we're still learning, and we will update this until this thing is all done. Buy-in, we have a flow for individuals coming directly out of the hospital. Those that are in shelter, those are coming through housing programs, or just unsheltered, and how they then flow through the system. If they are on the streets and unsheltered, and one of our 5 or 6 outreach teams that are funded through Clark County, City of Las Vegas, and in partnership with our Metropolitan Police Department and others, if they find someone that's unsheltered and they need immediate care, they then can be screened in if they need to be hospitalized. When they come out of that program, doing the ongoing monitoring, if yes, then we have programs that we can put them in if they're a little more self-sufficient and can handle their activities of daily life. we have programs for them, but they are limited in some ability need monitoring. We likewise have program beds designed specifically for them. And this is a process that was community designed and community supported. Our matchers at the Department of Social Service and nonprofit partners at Help of Southern Nevada have done a phenomenal job of keeping this new process, working and tweaking along the way. This is a kind of a pan back to the larger pandemic response chart that clients go through from beginning to end. It won't take too much time on the walkthrough, but really just giving you a glimpse of how even during the midst of the crisis, we've had to make sure that we are being very structured. It's the paradigm of being agile, yet creating structure around yourself as you go, literally building the airplane around you while you fly, but not forgetting to build the plane so you're not just flying by the seat of your pants. So it's been a testament to the ingenuity of our staff and our community. So how do we pull this off? Of course, you heard that was a rather expensive project. Most of this funding has come through the CARES Act. We have, as Clark County, earmarked, well, actually this slide is just a few days old. It says $58 million. Our board last week allocated additional dollars for up to over $80 million for housing and basic needs assistance from the CARES Act. That's in addition to money earmarked for our runaway and homeless youth who get $15,000 for products and technology, as well as in transitional living, getting a $50,000 earmark specifically for them. And then our seniors getting a $96,000 nutritional program. This does not account for the hundreds of thousands of dollars of food and delivery door to door from restaurant to shut-in that partners like Planet 13 and other distribution programs who popped up during this time frame from local restaurants have brought into play to make sure individuals stay fed and stayed healthy. Getting them to bed is one thing, but getting them the food and resources you need is another piece of that, and we want to thank our partners for that as well. So pre-COVID-19, this is what had been planned and implemented. This is our stair-step model, and it shows what our planning was from persons being on the street through prevention, diversion, shelter, bridge, transitional, permanent supportive, rental assistance, up to affordable housing, market rate, and then home ownership. We have that view for our clients. We have seen it happen. And so we want to be very intentional about making sure that we are creating a bridge to the next level for every client. So we had, coordinated outreach programs throughout the community. Those teams are all coordinated and overseen through the COC process and social service. We have rebuilding together to keep folks housed. We spend over $1 million every year repairing homes for elderly shut-ins so they can age in place with grace and dignity without having to go into a long-term care facility. We have diversion programs, low barrier shelter beds, youth shelter beds, crisis stabilization, rapid rehousing for families, hospital to home discharge programs, master leases. We had stood the master lease program up. We had a daily, weekly motel that caught on fire, the Alpine Motel, and we had to rapidly redeploy housing for those individuals. And those lessons were learned here in this process for the COVID-19 as well. So how do we take all that and what does it look like during COVID? Well, from March to June, again, we stood up a lot of non-congregate shelter. We developed COVID-19 housing, the Cashman ISO-Q process, the hundreds of non-congregate shelter beds that were brought online as well were in early responses. And as we moved then into recovery in May and June, we began to stand up more programming. And this is where a lot of the CARES Act dollars have really chipped in here. We have stood up our community-wide COVID Housing Assistance Program, or CHAP, and that is where the county commissioners have dedicated over $80 million to make sure that individuals who are behind on rent through no fault of their own because of some kind of COVID impact, hours being cut, being laid off, anything, can qualify in for assistance to get that. We'll have a little bit more on that. but we've not lost sight of what needs to be done post-pandemic. So we've continued to expand our affordable housing allotment. We have created work to home program wraps in addition to the other emergency service programs. So through a taxation rate of 1/8 of a cent on sales tax that was passed in the last legislative session, our county commissioners have allocated an additional $40 million into housing and support systems to make sure that individuals have what they need to move from the streets to long-term stability, whatever that means and looks like for them. Now, so what can be expedited or expanded? These are some of the things that we were looking for, utilizing those lessons learned during the pandemic to do things post-pandemic. And again, we will look forward to sharing those successes with you all as well at some future conference, we hope. So, but not everything was a success, and it would be disingenuous for us to sit here and act like it was. We learned from a lot of our partners over the years in the private sector about fail fast and iterate, that design thinking mentality. And so we had an opportunity to step in and pick up a shelter building at the Salvation Army. That had been, they lost funding for a particular project. It created opportunity for beds where we thought we could preemptively keep sick individuals with comorbidities off the streets as the ISOQ complex stood down. We had contract nurses. We had nurses who were worked for the school district who were not in the classroom or at that time. So came out, got the PPE, and we learned very quickly that the inability to isolate and keep folks from coming and going as they please was not conducive to decreasing the spread. We had staff, again, who traditionally worked with children, trying to work with adults, some of which had mental health issues as well. And it just was not a great mix. There were a lot of barriers. We still had lack of testing, lack of screening, lack of mental health services. We have a very Spartan mental health system in Nevada, even with expanded Medicaid. Because of our very low tax rate, there's very few dollars to invest in those human service continuums typically. And so that was a program that stood up and stood down within about 45 days. And we learned very quickly from that what not to do. And again, big things. Huge thanks to the Salvation Army, to the school district nurses, to the nurse corps, to folks who said, you know what, we're not sure if this will work, but we're willing to try to make it work. And a lot of lessons were learned from that project and applied to future projects as well. Which really brings us to our largest ongoing project, which is to make sure that individuals don't wind up on the streets because of the inability to pay rent. We anticipate as a community over 120,000 households are currently behind on rent because of the COVID impact. So our CHAP program really had 4 phases. We started off in July with our nonprofit, a very manual application process where individuals could download a PDF, fill the application out and take it to one of 14 nonprofit partners. We allocated over $30 million to that process, and in hopes that we could serve about 15,000 households. Those dollars are almost all completely expended at this point. We saw that the speed of getting those applications in was not as quick as we would have hoped it to be. A very labor-intensive process with a lot of nonprofit partners who are used to having a lot of rules and regulations, and you have to have a social security card and proof of this and proof of that, and the evidence, all the things we had drilled in their heads over the last 20 years of being a continuum partner. We're now standing in the way when we're trying to be super flexible and very rapid in our response mechanisms. So the Department of Social Service knew we had to stand up some way of not requiring individuals to come to our office, but being additive to the process. So we began working with IBM and IBM Watson and their intelligent health platforms to create a portal by which individuals could apply electronically. that would come right into our IBM Curium case management software and flow directly then through to our IBM SAP financial system. So it has created a mechanism by way, since October 15th, we've been able to ramp on over 10,000 applications and get over $7 million out the door in just under a month because of the fluidity of that process, while still allowing our nonprofit partners to continue working with the pool of individuals they have in their community, their queues as well. We began to work with the State Supreme Court several months ago and our partners at Legal Aid of Southern Nevada to be able to stand up an evictive mediation process, because we knew that we weren't going to catch every person in need before they got to eviction court. So the judges know that there's a program by which if either partner wants to mediate, they can route them through, and we've got millions of dollars allocated, as well as staff presence to be able to work individuals through that mediation process as well. And then we're looking at standing up a corporate landlord program. Buy-in, we have folks who have 30, 40, 50 properties around town with thousands of tenants. And right now we're in the pilot phase of working as I record this, where one landlord has 100 individuals that we're hoping we can adjudicate en masse and give one check out the door, and therefore be able to double up kind of the throughput of staff on a daily basis. So we are very hopeful around that process, and we're thankful to all of our partners and counties around the nation who were able to share some of their lessons learned with us. So we were able to be able to stand those programs up as well.
So I am Meredith Spriggs. I am the Chief Kindness Officer from Caridad, and I am currently located and operating in Southern Nevada, in Las Vegas specifically. I want to read you a quote. Actually, I'm going to go back. About homelessness. Most self-resolve or exit homelessness within a few days, weeks. In fact, only about 16% of homeless are chronically homeless. And while there are 190,000 visible homeless each night on the street in the United States, many more live in shelters that are otherwise hidden from public view, sleeping in cars, for example. Most often, popular perceptions of exactly why a person might be homeless are driven by those who are most visible and by their portrayals in the media. So I'm going to walk you through my little slideshow. This is me. This is me in front of Nazarene Theological Seminary. I graduated with a master's in divinity, and I took 90 semester credit hours and some hours in counseling, and I graduated from NTS, as we call it, in 2000. This is also me. This is me at my dream job at a university. I was in this photo working as an admin and as an adjunct professor, and sometimes on lunch breaks, students, faculty, staff, this is some of the maintenance guys, would stop by my office and we would have dance parties and they would dig into my costumes in my office. That's what's going on here. This is me, as you can tell in the end, and my best friend at her wedding. She is the one closest to me. She's a triplet. And I had just been laid off here from my university dream job. The market would crash. This is October. And the unemployment rates would skyrocket. And worst of all is my former employer, the university, my boss took me to court, took away my unemployment, so my wages ended up getting garnished because I had to pay them back. So this photo is really the last time I was happy, because after this, in a horrible economy, I ended up having to get 2 part-time jobs, and in San Diego, I couldn't afford to live. So I lived out of my car, was homeless, stayed at the beach, sometimes on couches, eventually lost everything, including my car because of unpaid parking tickets, and did not stay at a shelter because I was too scared, but would sleep outside, and again, made friends in homeless camps, would stay out in front of the library. If any of you are familiar with the old library in downtown San Diego, that's where I would sleep with my friends, and we'd sit there often and we'd play cards. And we'd sit out there and we would talk about things. And what I saw donations come and go, and I saw the waste that was created by that. I saw the food waste, I saw the clothing waste. And so I vowed to my friends, if I ever got on my feet, that I would create an agency that would show the real stories of homelessness, and it would be an advocacy organization, but more importantly, it would be socks and underwear, new socks and underwear to the homeless. This is my now husband. We were engaged in this photo. In 2010, when this picture was taken, I had gotten a job at the San Diego Rescue Mission. I was indoors, and my husband helped me start Caridad, my charity, and our first event was Undies Sunday. And so we partnered with local San Diego nonprofits, and we did a sock and underwear drive for them. We have our superhero, we call him Mighty Tidy, and he saves the world from bad sock and underwear donations. Today, we have our corporate partner of Hanes, and they help us on a massive scale as this event is still ongoing. This is me a few months ago with my now team. I moved to Las Vegas in 2013, and in 2014, moved Caridad over from San Diego to Las Vegas, and we are currently a job reintegration program. And so these are all formerly homeless veterans. They are housed through HUD-VASH vouchers, and they come to us. They have several options. We have the planter bins. So people that are disabled have a planter bin. We call them remote gardeners. They can work from home. They get a bin, and they grow plants and produce in their bin, and they get paid $50 a week stipend. If they're higher functioning, or they aren't still battling with addiction because we don't require sobriety, then we give them the option to maintain an alley. We call them porters in the alley, and they pick up the trash, do graffiti removal, and work with the downtown businesses. And then from there, if they show an interest, we have an indoor hydroponic farm that they can work in, and we grow for the bars and restaurants. And we also grow for our partner with Anthem Blue Cross. And so we give away free produce to Anthem members, and the rest we sell for a profit to support the veterans' wages. What does all this have to do with COVID? You're probably wondering. And I would say a lot. I would say my journey and what I've learned from the 2008 crash to today as an organization, a 10-year-old organization. I learned a lot, and it was solidified, or I should say magnified, during the shutdown. So although it wasn't technically an economic collapse, we know it's pretty close to it, and the joblessness and what we will see as homelessness is going to be on the rise. On March 18th, the governor of Nevada closed things down. These are my friends Jimmy and Sandy. These are their kids. They have a YouTube blog that's called Trying Something New. They track their adventures with their kids, tips, all sorts of fun stuff. So, as I said, I'm ADD, so I'm going to give you a video break.
Had to shut down at midnight due to the coronavirus.
I announce that all gaming machines, devices, table games, and any equipment-related gaming activity will be shut down effective midnight tonight.
So we are now going to drive down the strip and see what it looks like, because we've seen images on the news and whatnot.
The governor shut down every gaming machine, made them turn off the lights, shut it down.
Yeah.
Which we appreciate. Because if it keeps more people safe, that's what
we are definitely in the self-isolation mode right now. I know some people are like, screw it, I don't care, it's not a real thing. Well, you know what, we're going to do our part, because we know that it's spreading, and actually, no one has even really been tested yet. So people could be walking around with it and not even know it, and spreading it. So we're going to do our part. We know that the healthcare workers are risking their lives. Everybody that has to work, the supermarket workers, everybody that is keeping the food coming for everybody. Thank you to everybody that is doing that. So we're doing our part.
I gotta wait for better days. It's all starting now. It's not too late, we can be safe. If we make the time, it's gonna be alright. Had a clue, now I got a feeling. Just gotta hold on tight.
If your business brings groups of people together, it should not be open.
We're gonna be
Only essential services should remain open.
I wanna feel if this is real, it's easier to try. 'Cause every night and every day, I wanna run and die. It's gonna be alright. Had a clue, now I got a feeling. Just gotta hold on tight. Tonight, we're gonna be not too late. We can be saved.
Every social contact increases your risk of exposure. The bigger the group, the higher the risk.
We're gonna be stronger. This is our fight. We're gonna be stronger. We won't break out of this fight. Have no regrets. Just hold your breath and you'll be stronger. We're gonna be stronger. This is our fight. We're gonna be stronger. We won't break out of this fight. Have no regrets. Just hold your breath and you'll be stronger.
Although you might not be experiencing symptoms at this time, you may be contagious. Do not risk your health or the health of others.
My husband and I decided to go out on our walks. We live a few blocks from the Strip and about a mile from downtown, which is the Fremont Street Experience. This is downtown on the Fremont Street Experience. Literally everything was boarded up. It was eerie. It was a ghost town. It was cool and rainy in March when things shut down. And as my husband and I walked around, this is pretty much what it looked like. All the lights were off at the different Strip properties. Like I said, hardly anybody walking around. It was eerie. But something happened. We ran into, or we discovered, a dead homeless man. He was late 20s, and he had died of dehydration in front of the Flamingo. And I've seen that, unfortunately, in homeless services in Las Vegas, where people die in the summer sun, they pass out, they dehydrate because the sun hits them while they're asleep, and they aren't awake enough to get water. That's not uncommon. What was different was the day. The day was cool and it was rainy. This homeless man died because he literally didn't have access to basic life-saving resources. This is what we are seeing across the country. Homeless are unable to access basic necessities like food and water because of the shutdowns. As I spoke with homeless on that walk that day, they were explaining to me that normally they would be able to get their cups refilled in the Strip when they would walk into gas stations, but because of restrictions, they couldn't take in refillable cups to get them refilled. They didn't have masks because they just didn't have access to them. They didn't have the ability to panhandle because there were no people walking by, so they couldn't even panhandle to get the money to buy a mask. They were literally just stuck outside. And if you've never been to Las Vegas, the Strip is about 6 miles from all the shelters. So can you imagine walking with no food or water 6 miles when you maybe haven't had water for a day or more? And our buses, as is common in a lot of major cities right now, were running less frequently, if at all, on most major routes because there was no one to ride in them. And they didn't want to risk their drivers' safety. It was a perfect storm. And also, as some communities have been opening and shutting, I know in the San Francisco area this has been a thing, the agencies are allowing their staff to be on quarantine at home. So quite literally, no access to resources, no street outreach workers, was what was wreaking havoc, not COVID, to the homeless populations in Las Vegas. We realized this, and we realized we need to do something. I knew that people were fearful, but my husband and I don't have any kids. We don't have any immediate family in the area, so we decided to go out wearing the safety precautions, wearing the mask, wearing gloves. We started to go out. we created COVID care kits. Now, it's not uncommon. I'm going to scroll past some of these photos of just how eerie the shutdown in Las Vegas was. So this is my husband. These are our COVID care kits, and this is us just leaving the parking lot. But we took these out and we went to the different camps and we distributed them. And something that I noticed in my 10 years of doing homeless services, yes, I've been asked for food and water. But generally, people just told me, oh, it's because I want X, Y, and Z. For the first time in my 10 years of doing street outreach services, people truly needed food and water. When we would pass out these care kits, people, every single person we encountered immediately started drinking the water. Some of them, they said it was their first water in the day, and we weren't seeing them until 1 or 3 in the afternoon. Every single one of them then went to eat the food that we provided. So they chugged down the water and then they ate the food. So we realized people were really, really in trouble in the homeless community. From March the 22nd to May the 30th, we passed out 1,214 care kits. And I want to tell you what each kit contained. Each care kit had toilet paper, water, Hanes tall tube socks, that's important. Tube socks can be used for gloves. Unfortunately, it's disgusting, but they can also be used for toilet paper. So that's why the tube socks are really popular. Sanitizing hand wipes, masks, squeezed fruit packs, a chewy granola bar. We were really careful to get soft packaged foods that didn't require utensils because we know so many people don't have access to good dental care. So we wanted things that would pack a punch for them, but also easy to eat and wouldn't hurt their teeth if they had dental issues. A Lenny and Larry's cookie. Lenny and Larry's, if you've never heard of them, they're these protein cookies. They're great. We picked them because of the high protein, and again, because they were soft, but we also picked them because a lot of people were requesting sweets. So it has a sweet, it's not necessarily full of sugary bad stuff for you. So it's got the good protein, it's got nutrients. So Lenny and Larry's was our alternative for a soft protein. And then we also printed out an FAQ about COVID-19. Shout out to Clark County Health District. They made one. Here's some samples of what we had. Again, there's at Lenny and Larry's, the alcohol prep pads. We gave them a stack of those in each bag. There's the squeezed fruit packs. We put these napkins in towards the end in addition to the toilet paper. And then the chewy granola bars, we picked this Quaker brand because they are the softest of the granola bars that you can buy in the giant packages like that. This is what our COVID FAQ that our health district made up just so we could use this in our outreach. So shout out to them again. So this is what was in our kits. I want to share how this and what I learned in 2008 can help you. What I realized is that storytelling, especially with your donors, is so important. And as things in homeless services we're predicting it's going to get worse, I want to share some things that I learned and that hopefully you can take away from this experience as well. So what we learned. The first thing, social media content is king. As much as I hate to tell my homeless story and the journey, every time I do, people are really connected, they're engaged, they learn more, they end up donating. It's so important. I tell everyone, you are the expert in your area and doing what you do. No one can tell your story better than you. You as an agency are very unique, who you're servicing, who you're helping. It's not about exploiting the clients and always showing photos. It's about educating and connecting with your viewers. We used our social media platforms to share when we would pass out kits. We shared when we got the donations, we gave people shout outs on social media. We got photo releases, and if homeless were willing, we got photos of them with the kits so that the donors knew that their donations were going to where they'd said. So that 100% transparency and trust was built in this donation drive time. And during the month of April, it was our biggest month, and we raised money through social media for the care kits. We raised over $20,000 for the month of April just on social media alone for these care kits. Oops. Here's an example. This is one of our homeless clients. He signed a release, and this was actually a video that I screenshotted the picture of, and I'll share more about that later on in the presentation. But this is an example of someone receiving one of our care kits. The second thing that we learned, we needed a medic. We needed a medic. Did someone call a medic? We discovered the need for medical, not only education, but treatment. People were isolated in the camps. So they weren't, because of buses not running, or just their inability to get to the service providers. People in the camps were sick. They needed wound care. They needed a whole lot of things. So we had a volunteer medics that went out with us, that understood the risk, that signed a waiver, but went out with us. And this is Sarita. She's a volunteer medic, and she went out, she took temperatures, she did wound care. She, to the best of her ability, kind of tried to give some advice, but also more importantly, gave those referrals and called 911 when necessary in the field. So when people were unable to access telehealth or service providers, Sarita was a lifesaver, and the wound care and temperature checks were the biggest requests that she got. The third thing that we learned, calling all volunteers. Unlike 2008, the quarantine shutdown left people at home, but wanted something to do. They felt trapped in their houses. They felt helpless. They reached out. They wanted to volunteer, but didn't feel comfortable leaving. So we created kits for them. And so what we did is we bought all the supplies through donations, and then we had gallon tote bins that we assembled everything in. And what we would do is people and families would volunteer to get the donation bin dropped off at their house. It had all the supplies, it had the list of what went in each kit, and it had a couple sample kits for people to see. So we dropped them off at their front porch. They were encouraged to take photos assembling the kits, and then we shared them on social media. Super easy way for them to get involved, no touch, but also for us to give them shine and back to that transparency on social media. This helped the donors know that their money was really going to what we said it was. It was super easy, and we proved anyone could do it. And we had lots of host homes that were making our COVID care kits for us when we were at the peak of our shutdown. Here is a successful kit assembled by some of my favorite volunteers. What does this mean for your community and homelessness? Like I said, in 2008, massive economic crisis, massive homelessness. We will have something similar. It's a little bit different though this time. So what can you do? What I learned. Lesson 1. We created videos for our donors and our followers. Back to this 100% transparency. We had Hanes, Taproot is a local company that gave us hand sanitizers, and we even had Caesars Entertainment volunteer. So they helped us. We did a COVID care kit day. And so what we did is we created several videos, and I'm going to show you one that we created from Caesars and their COVID care kit day. Thank you to everyone that donated for the COVID care kit drive. I am actually in the back of the Paris Hotel We're assembling them. Thank you to Caesars, our partner, Haynes for the donations. You guys are amazing, and Taproot. We're gonna go do good things. So that little video, that video was shot or edited, I should say. That video was edited on an iPhone using iMovie. And the second lesson we learned was to engage a teenager. In our case, it was a 14-year-old, now 15. That's Naya. She is a teenager whose mother is a board member, and she is a talented artist. She's always doodling and drawing and doing things. So I suggested to her to revamp our logo, and that is what she did for our garden design. She revamped and created our logo. But she also made the flyer for our Care Kit drive. So that cute little flyer. Now, this is true to who we are as an agency. We're kind of silly. A lot of our things are cartoony. So this is true to who we are. You don't have to have a teenager design your things if you have a designer. What we have also used her for is for social media, for posting, to help us understand a little bit more. My husband works with social media influencers, so they've trained me up. But then things like TikTok and some of the little goofy video editing or tricks that you can use on some of the apps like Instagram, Naya and her younger sister have helped us with because we didn't quite understand. Lesson 3, get the right equipment. As I mentioned, I edited that presentation was all done on an iPhone on iMovie. So an iPhone, it doesn't have to be an iPhone. It can be an Android. Androids have wonderful cameras. You can do everything you need to do on a phone. But make sure, no matter what you do, that you turn your phone horizontally. Unless you're in the app specifically, when you're just taking that raw video footage, always, 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 always have it horizontally, not vertically, because what it'll do is it'll cut off the end of your video and it'll have those weird black, almost kind of bookends when you go to upload your videos. So always horizontal, so it'll be wide angle. This is a GoPro Hero 4. This is great for wide angle lenses. It also has great sound. I've used this before for meetings of our continuum of care. It has this little attachment, you can either, it comes with the stand, or they have a strap that you can put it on your head and you can run around with it. So I really, really like that for the nice wide angle shots. And then it has a super easy, right here, it has like a chip that you pop out and you just plug straight into your computer, and it uploads everything straight to your computer for you. So very also easy. You just press the button. There's a button on top here. Press it on to start, press it to stop. Super, super simple. This is the front row high resolution camera. So the photo that I had of the homeless man where I was handing him the COVID care kit, and you can see my yellow gloves, that was actually shot on this front row camera. Now what's great about this is you can do live stream, you can directly import into these different apps. As you can see, they've got YouTube, Twitter, and Facebook accessibility, but the camera feature, you can do real-time footage, you can do slow it down, or you can speed it up. One of the videos initially that we made for passing out the COVID care kits was a 40-minute video that we sped up to about 2 minutes, and we put music to share with our donors. So you have that capability. I like it because it's a little medallion you wear around your neck. Again, you're still getting photo releases from people, and I always tell people my little trick when I'm out on the streets, hey, it's not necessary. If you don't want it, turn your head or let me know. Or if you want to be on camera, raise your hand and we'll know. And a lot of times what I'll do, we have over by our homeless shelters, it's a street, it's called Four Master. And what I'll do is I'll run up and down the street and tell each and every person, hey, I'm gonna go through, I'm just doing a panning angle shot of the whole street. Turn your head. When we're done, I'll come back through, I'll tell you so you can look back up, unless you want to be on camera. And so just out of respect for everybody, let them know, and then I come back through with the photo releases. So always, 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 always tell people you're filming. You don't want to take them by surprise, because I have seen it before. When reporters show up and don't do it, it can turn into a hostile situation. So I always want to be respectful, and I'm sure all of you will be. But these little front row cameras are great. It's a little medallion you wear on your neck and you adjust. Again, it's got that wide angle lens. I love the quality of photos that it takes. And so what I ended up doing was taking these out on almost every outreach that we did for the COVID care kits. And then I would come home, I would upload it to my computer, and I would use print screen and to get those nice, high quality, high resolution photos that we ended up using, again, to share with donors, but also to share what we were doing. This is a vlogging kit. It's Manovo. And it's a Manovo smartphone video kit for video vlogging. And this whole kit costs $119. It literally comes with everything that you can see here. This is a light. This is a microphone that attaches to your phone. This right here, this little guy goes over the microphone in case you're outside and it's windy. And then it comes with this stand. And what I like is it has this level, so you can see if you're holding it level or not, and see how this is horizontal for filming. But they do have an attachment tripod that you can purchase, and we later did for when we stand up and do things. And also, if you are filming and using, again, this is the Manovo smartphone video kit. If you're going to use this, this works great. It plugs into an Android device, but if you're going to use it and you have an iPhone, you need an adapter, a little dongle to plug in, because even though it says it is, it's not iPhone compatible with all these little plugs. So just buy a little plug and you're good to go. But this is great. We shot a bunch of videos on this, and we use this all the time too when we've been doing video blogs. So super easy, super simple to use. Again, that's only $119. You just plug everything in that kit to your phone, and off you go. You have a high quality, it looks like a high quality production. The big thing too, I can tell all of you that you want to make sure that when you do these videos and you upload them to your different platforms, 2 minutes. 2 minutes max. Less is better. People on social media are not watching long form videos. So 2 minutes or less, get your message across. Don't forget the bumpers on the end. We have our logo at the end of each one of ours, and then every time we post, we ask to donate. So less than 4. Use live streams. Use live streams. You can do a live stream of yourself walking around passing donations. You could do a live stream tour of your agency walking through. Live streams are great. And if you mix up still shots, embedded video, and live streams, it actually helps you on the algorithm of social media to get pushed through and get more notices. So this is an example right here. YouTube, you can do a live stream. What I like, if you sign up for the business, YouTube, it makes you eligible to get donations. So this is Mark Horvath of Invisible People doing a live stream. This is what he can see. This is what the viewers can see. They can interact with you, have a chat, but they can also donate. So he can shout out and thank people as they donate in real time. This is myself and Alan Graham of Mobile Loaves and Fishes. We started a thing, it's called Friday Conversations, to create advocacy and awareness. You can feel free to steal that. And we interview formerly homeless, currently homeless, and advocates in the space. And so it's given us an ability to talk to people we might not normally have gotten to interact with that are around the country, that we can sit down for an hour, we chat it up. People on Instagram write in real time and ask us their questions. It's been a great tool, and it's been a good thing for us to allow our followers to access people they might not otherwise have access to. For example, Matthew Daugherty was just on last week, and he is the former head of usage. This is StreamYard. StreamYard is a streaming service that simplifies your life. This allows you to put in the different feeds. So Facebook, you can see up here, you can do Facebook, you can do YouTube. Basically, it's a central place. A lot of YouTubers will use this when they live stream. You can be on both apps at once, live streaming. It allows you to read what people are writing in the chat. You can still have the ability to take donations from people if you're on YouTube, but it just simplifies your life. For posting, I like Hootsuite. Hootsuite, like an owl. Hootsuite allows you to have multiple platforms login. So we use it for our LinkedIn, Facebook, Instagram, and Twitter feeds. And it's one login, and we can schedule things to post all through one. Now, that's a little different for videos, because even though Instagram and Facebook are owned by the same company, they really, really want you to go into their respective apps, because what they want is your analytics, and they want you clicking on things and seeing their ads in their respective apps. So when you are posting video content, it is beneficial, so you don't get buried in the algorithm, to go into each app separately and post the video. Post the video, make sure you don't forget to ask or add a donate button, but post the video in the separate platforms rather than go through something like a Hootsuite and schedule it across all the platforms through that one centralized app. It's better for video to go in individually and do them. The biggest thing that I see agencies do wrong, number one, number two would actually be that they create too long a post and too long of a video. The biggest thing that you do wrong, that I see all charities do, they forget to put a donate button. It's so easy. Facebook and Instagram have made it incredibly easy. LinkedIn, unfortunately, they still don't have that donate button. Same with Twitter. But still, don't forget to ask for money. Don't forget to ask for money on every single post. And you can see, and you can start to track what's drawing people to donate to you, and then you can tailor your posts accordingly. The best part about Facebook and Instagram is they give you those analytics. So you can see those analytics, like who's looking at your posts, where are they coming from, the demographics. It's great. So that way you can also, in the future, tailor your ads to those people that are coming to you. So here on Facebook, super simple, on your post, it'll give you the option to add a donate button. Just click it. It's great. Instagram and Facebook don't take a cut. The best part about that is 100% of what you raise goes back to you once you're established with them as a nonprofit. I love it. That's where we got our $20,000 from in April. When you are posting on Instagram, if you're in an Instagram story, there is this little donation button when you scroll down. So again, this is Instagram stories. If you need help with this, find a teenager. When you're posting to your stories, always add that donate button to your post. So you can add your picture, you add the donate button, and voila, there you go. On average, now we make $500 to $1,000 per week off of our social media postings, and that's just because we add that donate button. Again, I mentioned LinkedIn and Twitter because they don't have the ability yet to do the donations within the app, but I would say add the link for your donation page, add that in. Also, if you can come up with alternatives, not everybody likes a check. Not everybody's going to be on Facebook. Not everybody's going to click on your link. What you can also add on your flyers or your posters is if you have a PayPal, a Cash, or a Venmo app. So add those handles too. Add those handles on your newsletters. Add those handles on the bottom of all your emails. So people have alternative ways to give you money. You want to make it as easy as possible if someone wants to give you money for them to do it. And there's also another one, it's called Mighty Cause that we use. Mighty Cause makes it super simple for monthly donors. We have a campaign, it's called 10 by 12. People can simply click, they give it. We've set up an auto message so it automatically sends out a thank you when they donate, and then at the end of the year they get a donor letter, and then we on the back end can run the names and see everybody's data on the back end. So that is it. That's all I've got. I feel like the coming days are going to be tough and not easy in homeless services, but I hope you've learned a little bit and can glean off of what we found. We found that social media content and video are king, and that by being transparent and sharing what we're doing with our donors, it not only helps to raise awareness, but it helped us to raise money on social media platforms. This is my contact info. If you have any questions, if you need walked through it, if you want to have a conversation with the down and dirty of your analytics, a little more in depth than what I glossed over here, if you want to know more about some of the apps and services that I mentioned, reach out to me. I'm here, happy to be a resource. I am by no means the expert, but again, I have gotten it to where we at least raise $500 to $1,000 a week. So happy to be a resource to you in these coming days. I think social media is going to be our key to building the public will. So thank you. Thank you for your time, everyone.
Well, last night, Las Vegas had to shut down at midnight due to the coronavirus.
I announce that all gaming machines, devices, table games, and any equipment-related gaming activity will be shut down effective midnight tonight.
So we are now going to drive down the strip and see what it looks like, because we've seen images on the news and whatnot.
The governor shut down every gaming machine, made them turn off the lights, shut it down.
Yeah.
Which we appreciate, because if it keeps more people safe, that's what we
are definitely in the self-isolation mode right now. I know some people are like, screw it, I don't care, it's not a real thing. Well, you know what, we're gonna do our part, because we know that it's spreading, and actually no one has even really been tested yet. So people could be walking around with it and not even know it, and spreading it. So we're gonna do our part. We know that the healthcare workers are risking their lives. Everybody that has to work, the supermarket workers, everybody that is keeping the food coming for everybody. Thank you to everybody that is doing that. So we're doing our part.
I gotta wait for better days. It's all starting now. It's not too late, we can be saved. If we make the time, it's gonna be alright. Had a clue, now I got a feeling. Just gotta hold on tight.
If your business brings groups of people together, it should not be open.
We're gonna be
essential services should remain open.
I wanna feel if this is real, it's easier if we try. 'Cause every night and every day, I wanna run and down. It's gonna be alright. Had a clue, now I got a feeling. Just gotta hold on tight. Tonight, tonight, we're gonna be stronger. This is our fight. We're gonna be stronger. We won't back out of this fight. Have no regrets. Just hold your breath and then you'll be stronger. Gotta wait for better days. It's all starting now. It's not too late. We can be saved.
Every social contact increases your risk of exposure. The bigger the group, the higher the risk.
We're gonna be stronger. This is our fight. We're gonna be stronger. We won't back out of this fight. Have no regrets. Just hold your breath and then you'll be stronger. We're gonna be strong. We're gonna be strong. This is our fight. We're gonna be stronger. We won't back out of this fight. Have no regrets. Just hold your breath and then you'll be stronger.
Although you might not be experiencing symptoms at this time, you may be contagious. Do not risk your health or the health of others.
Thank you to everyone that donated for the COVID Care Kit drive. I am actually in the back of the Paris Hotel. We're assembling them. Thank you to Caesars, our partner, Hanes for the donations. You guys are amazing, and Taproot. We're gonna go do good things.
Greetings from fabulous Las Vegas. I'm Kathy Thomas Gibson with the City of Las Vegas Office of Community Services. I want to acknowledge that we are on the traditional lands of the Paiute people who have been indigenous to this area since the 1100s. Today, I've been invited to talk to you about the city of Las Vegas and their response to homelessness, and particularly what we've been doing as it relates to COVID-19. So I'm going to share my screen here with you. The city has been engaged in a continuum of interventions that exists inside of a larger continuum of care. We are a part of our regional continuum of care, working with all the jurisdictions in Southern Nevada. The preponderance of people experiencing homelessness are actually physically located within the city limits of Las Vegas, and that necessitated an additional response to provide services and connect people to them. And so we have this continuum of interventions inside of a larger context, running all the way from street-based outreach efforts up to permanent supportive housing. Today, I'm going to focus on the front half of this continuum and a little less time on the back end, because I do want to get to our COVID interventions. One of the very first things we did was create a street-based outreach team, multi-agency outreach and resource engagement, better known as the MORE team. We currently have 5 teams spread out across the city limits. We made the determination very early on to embed law enforcement into our street-based outreach, and that was met with some controversy. There was a lot of concern that people experiencing homelessness would avoid law enforcement and would prefer not to engage that way. We thought it was critical, though, as part of our effort to not have individuals cycling through jails, hospitals, back to the street, that if law enforcement was engaged on the service end rather than on the enforcement end, we could have a more comprehensive approach to addressing homelessness. So we do pair each team up with a duo from either the Las Vegas Metropolitan Police Department or our own city marshals. We also have a service enrich team where we bring in not-for-profit partners who are prepared to work with veterans or families with children, unaccompanied minors, the elderly, so that we can connect to that person experiencing homelessness right where they are and not have to have them sort of navigate what admittedly is a fragmented service delivery system. That first pilot year, we had over 4,300 contacts and only 20 arrests. And those numbers were very important to the community at large. They wanted to be sure that we weren't trying to arrest our way out of a homeless issue. And that's not the intention at all. In fact, the officers are very well known and perceived as conduits to information in homeless encampments. And so anyone who gets arrested is acting out violently. Anyone who gets a citation is breaking some other kind of law. We're not writing citations merely for being homeless, despite what some of you may have heard. That is not the case. And so we really wanted to track how many contacts, how many people were moving from the streets, and how many people were then getting either a citation or some kind of arrest. As we've evolved this fiscal year, we're actually looking at servicing or already having serviced 980 encampments and having made more than 8,000 contacts. And so contacts are going up, both because people see the MORE team as a trusted resource, and frankly, because homelessness is beginning to increase in Southern Nevada. And because of that, it was important for us to have an intervention that was a very low barrier opportunity and we call that the Courtyard Homeless Resource Center. And this is something we created to literally step in the gap from what our traditional service providers were doing. This is a map of an area in downtown Las Vegas called the Corridor of Hope. It's roughly 30 acres of service providers. And although we are geographically co-located, they traditionally have not worked as a system. Each entity has its own set of rules, its own standards, and different ways that people experiencing homelessness needed to navigate. There were several vacant parcels in this area, and you'll see those highlighted in green and blue on this map. And they were zoned commercial. Well, the city knew that no commercial or retail enterprise was going to co-locate in an area where all of the traditional shelter providers are located. So we purchased the lots. Some were empty, some had abandoned or really deteriorated buildings. And that is now the footprint for the Courtyard Homeless Resource Center. It's under construction. And we literally stepped in the gap. We did not want to replicate what our traditional shelter partners are doing. They're doing a great job, but the demand has expanded and the needs of people experiencing homelessness are shifting over time. And so we wanted the opportunity to have a very low barrier location, meaning you don't have to breathalyze like you do at a traditional partner. We're not going to make you leave all your bags of personal belongings. You don't have to separate from your pet. If you come with a group of people and you identify that as your family, we accept that, right? Unlike our traditional partners who oftentimes only want single adults who are not inebriated and don't have pets. And so we began operating in 2018. It is a demolition and active construction site. And because we knew people needed help now, we opted to continue services and construction at the same time. Lesson learned, very difficult to do effectively. We initially were open 12 hours a day from 6 a.m. to 6 p.m., serving about 250 people. We chose that 12-hour block because traditional shelters typically push their overnight clients out at 6 a.m. and then by 6 p.m. They have pretty much gone on shutdown and aren't admitting new people, and there weren't a lot of day centers. And so we opened up and provided porta potties and hand washing stations and mobile showers. And we started with 3 outreach teams so that individuals who wanted to come to the Courtyard could get transported there, and really ramped up to 24-hour services because everyone is not going to go into a traditional shelter. Everyone cannot go into a traditional shelter if they're under the influence and some other factors. As we expanded our services up to 500 individuals, as we currently are, we've added a number of things like a donation center, and we continue to have our mobile showers, etc. But we now have a pet kennel and shared classroom space so that providers can come in on a rotating basis and offer services to clients. At final build out, we'll be able to serve 800 clients, and all the buildings will be permanent. So permanent showers, permanent laundry facilities, permanent mail room, and medication dispensary. We will have a health clinic, federally qualified health center on site, and permanent space to co-locate service providers at this location to continue to do a broad array of services and really close the gap in a really fragmented service delivery system. This fiscal year, we've had about 8,400 unique clients, 5,500 of whom have stayed overnight at some point at the Courtyard, and we're averaging between 350 guests each night. We've helped 950 of those transition off the street and into housing Another 266 get connected permanently to a medical home and healthcare, and over 1,200 using us as an address of record so they can get mail, so they can register to vote, and storing their personal belongings, etc., on our site. The biggest use clearly has been as a low barrier day center where folks don't have to roam around, where they can access a toilet, where they can just relax and decompress a little bit. And when they get ready, connect to services. We do not require that guests at the courtyard access services. We have one rule: don't fight. And that's what we mean by low barrier, that there aren't a lot of expectations placed. There are opportunities offered. We do this because we have a vast array of partners who come on site, provide their services at no cost to the guest, and reduce the likelihood that someone won't follow up on a referral or cannot make the connection to a service provider. And that's been a really important element of the courtyard, is that people get connected to the services that they need. And sometimes the services that they need are what the average citizen takes for granted: an ID card, a birth certificate. And so we have ensured that we provide those supportive services as a frontline service so that people can then begin to utilize other aspects of the community's continuum of care. A lot of this is supported financially by the Mayor's Fund with the Nevada Community Foundation, and it allows donors to dedicate resources to go into those wraparound support services. Now, I really want to talk about our COVID response. In January, I began having conversations with our fire department chiefs because we all wanted to know who was taking the lead on addressing what we were hearing happening internationally at the start of this year. And by February, we knew that it was a pandemic and that we were not prepared as a community to protect people experiencing homelessness from contracting the disease. And so we looked at one of our convention centers that had primarily been mothballed. One of our softball leagues, or professional baseball actually, played in the stadium, but the convention center and its 3 parking lots were not being utilized. And so the Cashman Isolation Quarantine Complex was constructed and staffed to serve people experiencing homelessness. The CDC guidelines that came out in March and April said things like stay home if you feel sick, and wash your hands, and keep yourself distant from other folks. And those are middle class guidelines, right? We knew that very low income people and people experiencing homelessness were not going to be able to comply with those guidelines, and they needed some support so they would not spread COVID amongst themselves, that they would not have to choose to stay in a traditional congregate shelter. And also, because we didn't know what the pandemic would emerge, we wanted to support our hospitals so that they could serve the most critically ill, and there would be an alternative care site for those who were less ill. And so the Isolation Quarantine Complex, the ISOQ, was set up. We utilized an incident command structure. Both the governor and the mayor of Las Vegas had determined that it was a state of emergency. So we had a great city-county collaboration with an $8 million budget split between the 2 entities. And we built sprung tent structures in the parking lot of this convention center. And we prepared for 500 bed capacity because, again, we did not know what the pandemic was going to bring us. And we wanted to be able to operate 24 hours a day. And so most of the photos you're going to see are from the construction period. we didn't have a lot of folks traipsing through once we were operational. And as you can see, the tents were pretty cavernous. We set up dividers inside so that they were hospital-like cubicles, and ensured that we could accommodate people experiencing homelessness with some dignity and some privacy. We had 3 levels of care. Asymptomatic exposed persons that we would house while they awaited their test, symptomatic but unconfirmed, and then confirmed positive. And we needed these 3 levels of care because testing and contact tracing had not yet gotten to the point where one could get their test results back in a rapid fashion. And so folks might have to wait 10 days before knowing the results of their COVID tests. More critically, no one was testing in the homeless population. And so we had to create space and opportunity for people who are experiencing homelessness to get a COVID test. The ISOQ was staffed with a full medical team 24 hours a day. Additionally, we had navigators and discharge planners, recreation coordinators, and a 24-hour operations staff attending to sanitation and around-the-clock cleaning and meal service, everything self-contained like a small city. Here are some examples of the levels of care. Green was for the exposed individuals. Yellow was for symptomatic, unconfirmed, and red for folks who had a confirmed positive test. Not only did we separate their sleeping quarters, we also had separate laboratory and shower facilities so that no cross-contamination happened. In fact, we didn't even move food or linen across those lines. So you'll see this picture on the lower right with red stripes. That's for food and supplies and linen, both clean and dirty, that was supplying the positive confirmed to only move in that area. Similarly, for folks in the yellow area, we had yellow stripes painted, and then you'll see in the upper right hand where there are no stripes, that this is for staff to move through in order to get to the admin buildings. Lots of construction going on, and just to give you an idea of how busy the site typically was, this lower picture here is the PIO from the city, the PIO from the county, and the city council member and the county commissioner getting ready to take their tour of the site. As I noted, there was no testing for homeless during this time period. And so we had to set up facilities in order to perform those tests and give homeless people the opportunity to await their results. We were only operational about 100 days between April and June of 2020 during the very first wave of the pandemic. And that was really to give the rest of the system time to catch up and, frankly, time to recognize that there needed to be a plan for people experiencing homelessness that was a little bit different than the plan for the general population. At the time, the hospitals had not yet ramped up. Testing and contact tracing had not fully been established. And we actually had shelters who literally closed down when they found out that one of their clients was COVID positive, and that pushed hundreds of people out into the street. So this was a rapid response to that. This whole complex was built and staffed in about 12 days. We never got to our full 500 capacity, which I'm thankful for. We served about 245 patients in that 100 days, with 78% of them being discharged to housing and not back to the streets. And I'm very proud that we never had a workplace-based transmission of COVID or any cross-contamination. And so it was a very successful collaboration. We moved right from the ISOQ into setting up a medical respite, another gap that we needed to step into because it didn't exist for the larger population. And so we created this really based on the National Institute for Medical Respite and that framework for people who were too fragile or too ill, but not sick enough, acute enough to be hospitalized. And many of those homeless individuals were literally being discharged to the street or dropped off at the Courtyard Homeless Resource Center, which is not an ideal location. And what we're finding is that most of the patients using medical respite are coming for wound care, but we also have a shockingly sad number of elderly homeless and disabled individuals who someone just drops off at a shelter or someplace that is not able to accommodate their needs. And we're beginning to see homeless individuals who need operations coming in for pre and post-operative care. The medical respite or the recuperative care center is a 40-bed limit with enough distancing. We can rehab this old warehouse with COVID in mind. And we are the only public facility. There are 2 other respites in town, but again, you have to be insured or part of their member base because they are private insurers operating them. We brought a lot of our medical staff from the ISOQ over to the medical respite. So we have a doctor, advanced nurse practitioner, and a nursing staff that can expand or contract depending on the number of patients we have. We have our community paramedics team is based here now. And of course, intake, case management, and discharge planning. The medical respite opened August of this year, went straight to 24-hour operations. And typically our patients are in their 60s, more men than women. But every single one of them has an underlying disease, lots of chronic illness like diabetes and high blood pressure. And not surprisingly, quite a bit of our patients are dealing with mental health and substance use issues. We've pretty early on in the game, but the majority of our patients are not discharged back to the street. We are able to get some of our elderly folks into assisted living and other members into the flexible housing program that the city operates. We are a part of other regional efforts. We participate in a regional interlocal with other cities, but many of the traditional shelters are physically within the city limits. And we noted that we don't have a family shelter. All of them are requiring sobriety, and medical respite was lacking. And so that's why a lot of the things we teed up, we did so to step into the gap. But we're very active with our region and the continuum of care, not only for our point in time count, but Built for Zero, and this pretty complex chart about what our continuum of care looks like. And the city is very active at every level of this endeavor. Lastly, I did want to touch on some of the short and long-term housing programming, everything from bridge and transitional straight up to market rate. We do quite a bit of rapid rehousing, and I don't have to tell practitioners that it's much less expensive to rapidly rehouse an individual or provide bridge housing for up to 30 days than it is to allow them to spin into chronic homelessness. We can do permanent supportive housing for $21,000 to $25,000 per participant, or do a one-time rental assistance and help individuals stay housed. This challenge is going to be exacerbated as we work through our COVID challenge and the moratoriums on evictions ending soon. And so we're prepared to look at all of our federal dollars, private activity bonds, and RDA, HOPWA to support this work. Thank you. I know this was fast, but I hope you will shoot me an email and keep the conversation going. And I appreciate being allowed to participate in this Oregon Housing Conference.
Whether you are recovering from an injury or illness or looking for support and guidance to live a healthier life, Samaritan Health Services wants to be a part of your journey. Together, we can achieve wellness, strength, hope, and joy. Find inspiration to live your best life in stories of triumph, resilience, and determination at samhealth.org/together. Samaritan Health Services, building healthier communities together.
If you remember one thing today, remember this. You matter. And because you matter, the world is better when you're healthy. That's why Care Oregon helps our members get the care they need from the Oregon Health Plan. And lots of good things beyond health care. When you're stronger, you make everyone around you stronger too. That's the Care Oregon effect. Learn how to apply at careoregon.org/OHP.
It's very hard for people to take care of their mental health needs, physical needs, if all you're doing every day is trying to find a safe place to sleep. We're all in this together. And the struggles that some people have, that could be anybody. That could be, me in 2 years. I don't know.
The state of mental health in the country right now is very, very challenging. There's enormous need from many individuals, and oftentimes there's limited ability to access or receive those services.
Historically, whole health care has been, you've got your primary care provider, you've got your mental health provider, you've got maybe your addiction specialists. And they're all sort of doing their own thing independently with very little communication amongst them. But whole health care for us now at Cascadia is that we're bringing all these entities together under one roof. And that's really exciting because now I get to work for a team of diverse professionals with various skill sets, knowledge, experiences, and we get to all put our brains together to really work on finding the best solutions for patients and getting the best outcomes.
So if we can address health from the behavioral health perspective first and foremost, and then add on substance use treatment, physical health treatment, housing, employment, social factors, wellness, you put all of those together, and that really wraps around someone creating a sense of whole health. So we've followed 900 individuals who have received behavioral health services who also are enrolled in our primary care as well. We found that over 80% of those individuals had not seen a primary care doctor in over 2.5 years. Over a year and a half time, we found that we reduced their utilization of the emergency department by 18% and their inpatient medical admissions by 23%. I have never seen results like that in my career, and it is a testament to an approach that can work really well to improve people's lives. It would be ideal to have more centers like the Garlington Center, a space where people feel comfortable, both clients and our colleagues, a space that is respectful and safe, and a space that promotes this approach of providing whole health care where individuals can get a variety of services that they need to improve the quality of their lives. I could not be more excited for the creation of Garlington because it creates the first step towards a model of care that hopefully we can deliver here in Portland. We always must have support from our community in order to create these centers that really serve many important goals in our community. So we really rely on the generosity of our donors to achieve that, and we're so grateful that people believe in the work we're doing and stand with us in helping us move that forward and create places like Garlington.
For over 40 years, Central City Concern has helped thousands of people to find homes, to regain health and recovery, and to build economic stability and resilience. Every year, CCC works with over 13,000 people across several domains. We provide health care, inclusive of primary care, addictions care, mental health, that is really person-centered. We provide supportive employment, walking alongside people to help them get meaningful wage jobs. And we work with people to find housing that is safe and supportive and affordable.
I went from homelessness to homeowner in a matter of 10 years. I feel, my story does help others believe that they can do it too, because I did it and I didn't think I could do it. Some people have never had a job, or maybe it's been a very long time, and so we are able to offer more compassion in coaching, getting people ready to get into a more permanent full-time position.
Because of CCC, I was able to get my prison sentence suspended because they see me out here working and cleaning up the town. I'm 36 years old, been in recovery for 19 months and 9 days. Got 5 kids at home. CCC actually helped me change my life because I got a job that I'm able to work with the background that I have, and I'm able to feed my children, and got a nice place to live, roof over my head. The people here at CCC are like family to me, especially my bosses, and they help me out with my recovery.
CCC has all the resources, the tools to get your life back in order. My name is Ralph Fakoko Tase. I was born and raised in Samoa. I didn't really think about recovery because I try to get clean on my own. When you're talking to yourself, when you're trying to do it by yourself and you're trying to do it alone, it never works. I would be nowhere where I'm at without the support and the programs that CC has. I'm talking about from Hooper to the recovery program, treatment, the medical field as well. I FaceTime my son every Saturday now. For a very long time, that wasn't an option. I value things today. There's so much value in my life. If I can do this, anybody can.
The impact CCC has is outstanding. The patients and the clients we can reach to, the things we can help provide to them, I think they come in not knowing what we can really do for them, and then when we're able to show them that, I think they're just beyond grateful. Our care teams provide a lot. A patient can come in and just as simple as just have a checkup, but if a patient comes in that's homeless, they need more medications because theirs got stolen or their IDs have been stolen. We definitely go above and beyond and go out of our way to try to find them the resources that they need.
We're each a piece of this puzzle. We're all equal and we all have a place. When we're all in this together, we create one beautiful CCC picture.
Thank you, CCC, for all the advantages that you guys gave me and helped me out. I got integrity in my work just because of that.
Thank you, Central City Concern, and all the mentors that helped me along my way to become a better person.
Thank you to Central City Concern.
Faftai Lava CCC.
have an address, you done. It's a lot of people out there on the street right now because they don't have an address. They can't get the proper help they need. They need an address to get the help. Just being in the street, you know, they'll give you food stamps and stuff like that. But to actually get the help that you need without an address, you're in trouble.
The Law Center marshals the power of the law to end and prevent homelessness in the United States. That's our role. We're the only national organization that does that exclusively.
The Law Center has a view nationwide that few have because it has put together resources to help understand what's happening.
So we are a very small organization. We're here in Washington, but we work with local partners around the country. That's how we have an impact on the ground in communities all across the United States. What's also key is that we have a strong network of pro bono lawyers who volunteer their services with us and help support our work.
The cases that we bring in courts are naturally insular and focused on a small jurisdiction, one particular issue at a time. Those sorts of cases don't inform and address national issues well unless they are being directed by an institution like the Law Center that has a view as to what's needed.
So a big issue in many parts of the country right now is what we call the criminalization of homelessness. And by that we mean when cities pass laws that make it a crime to do things that homeless people must do in public, like sleep in public, sit down in public, eat in public.
When you look at it across the nation, where city after city after city is passing these types of ordinances, you land at a moment where there's nowhere to go. If you're down on your luck and you have nowhere else to go, you shouldn't be made into a criminal.
We are not arguing for a right to sleep on the street. We agree with cities that people should not be living in public places. Where we disagree is what do you do about that? We think the answer that makes sense, that solves the problem, is housing. So another big issue that we work on is access to education for homeless children.
We didn't have a stable place to live. We had to travel a lot. I've been to 12 different schools in 12 years. There are only about 2 grades that I completed fully. I didn't always get to go to school.
Access to school means not just access to the classroom, but also to meals, to health care, and to other basic resources that children need to grow.
What's so great about the work that this center does is that they are experts in homeless law, and because they have that expertise, they're able to advocate for students like me and homeless people in general who don't have a voice.
People are not homeless by choice. People are homeless because basically they cannot afford a place to live. Many people are vulnerable to homelessness. It could happen virtually to anybody.
If it wasn't for the Law Center, I don't know where I'd be.
Hi everyone, thanks so much to the organizers for inviting me to speak today. My name is Eric Tars, I'm the legal director at the National Homelessness Law Center, formerly the National Law Center on Homelessness and Poverty, where for more than a decade I've been working to end the criminalization of homelessness and promote housing as a human right. And I'll apologize a bit in advance. I normally would have prepared much more for this presentation, but as you all know, 2020 has been a bit of a dumpster fire of a year, so you'll get the best that I can do under the circumstances. I was asked to talk to you all today about the implications of the Martin versus Boise case, which I hope you all know about and which I'm happy to do because I know that using the law enforcement system to criminally punish homeless people for doing in public what we all do in the privacy of our own homes every day, sleep, eat, sit down, hang out and talk, stay out of the weather, and go to the bathroom, it hurts not only the individuals it directly affects, but it also hurts communities as a whole, because it puts resources towards hiding the symptoms of homelessness rather than solving the homelessness that causes the symptoms. And I know this conversation is incredibly critical today because we face the potential of 30 to 40 million Americans losing their homes in less than a month if the CDC eviction moratorium isn't extended and Congress continues its inexcusable inaction. Now, more than ever, we know that housing is healthcare and both are human rights. Whether you look at it from a moral, policy, public health, fiscal, or legal angle, housing, not handcuffs, is the best way to end homelessness and keep our communities safe and healthy. The good news is that we're turning the tide, and we have a lot to help communities with, including the Martin decision, which I'll come to in due course. But first, let me start off with a thought experiment. Imagine a person forced to sleep on a cold concrete slab, exposed to the elements, sleep deprived, denied adequate food and water, humiliated and degraded, threatened and harassed by law enforcement. Got that picture in your head? I've got a picture in my head too. And when it's these pictures, there's no doubt that it's torture or cruel, inhuman, and degrading treatment at least, right? But thanks to our work, when it's this one, it's now recognized as such, not only at the international level, but also at the domestic level. And vitally, thanks to our domestic advocacy in conjunction with this international standard setting, the human rights of homeless persons are now being protected and enforced by our federal agencies and, crucially, by our own courts as well. And this has been the breakthrough that we and the work that we are doing and others are doing from the domestic courts up to the human rights level has changed policies and made an impact on the lives of the most marginalized and vulnerable in our society. But let me come down from the international level to the personal and tell you a story about Amber Jackminski. Amber is experiencing homelessness in beautiful St. Petersburg, Florida, where tourists can sleep on the beach all day, but despite the lack of available shelter beds, they'll arrest you if you try to sleep on the streets at night. The city also has no public toilets available after 11 p.m. But as a human being, sometimes Amber just has to go. She tried not drinking anything after 6 p.m., but that led to a UTI. So one night, as she huddled behind a bush to pee, she was arrested and charged not only for public urination, but indecent exposure, a sex crime. So now Amber not only has the immediate penalties of jail time and fines and fees that she can't pay, but she also has to register as a sex offender for the rest of her life, making it almost impossible for her to find housing. That doesn't help her out of homelessness, and it doesn't help St. Petersburg solve either its homelessness or its public urination problems. Stories like Amber are far too common. And I know the folks at this conference today know just how common, so I won't dwell on this, but suffice it to say that on one cold night in January, our nation counted more than 500,000 people experiencing homelessness, a number which HUD itself acknowledges is a significant undercount. And when I say homeless persons, many people think of a scruffy, mentally ill, possibly addicted adult, and certainly those are some of the most visible in our communities and are a population who need attention. But who I think of, and who I want you and your communities to also think of, is the more than 1.5 million school students and their families who were counted as homeless last year, a number that has gone up every year since counts began and is more than double what it was when it was first counted in 2003. And why are they there? Because our communities have a dearth of deeply affordable housing. HUD lost half of its affordable housing budget in 1980, and it's never gotten it back, and states and localities haven't made up the difference. Instead, what the states and cities do control, zoning and development incentives, have gone to supporting high-end housing development. More than 90% of the new apartments built across the country last year were luxury units, not the low-income units that these communities desperately need. Fully 1/3 of California renters are paying more than 50% of their income on housing each month, putting them just one missed paycheck, one unexpected car repair away from homelessness. A Florida study found that more than half the homeless people surveyed named medical debt as the primary cause of their homelessness. It is a system's fault, not individual fault, that is driving homelessness. Emergency shelter is not a permanent solution to homelessness, though it can be a good harm-reducing step. But it is a pernicious and persistent lie that shelter is adequately available and people are choosing homelessness. Shelters across the country are at or over capacity, even in non-COVID times, and even where a bed may be open, shelter may not be truly available to a given individual based on gender, age, time, religious, or cost restrictions, and may not provide a healthy environment to a given individual. What I'm trying to say here is that people experiencing homelessness aren't deliberately choosing to sleep, live, and need to go to the bathroom in public. They are there because of the lack of other choices, and indeed because of the choices that we have all collectively made not to prioritize adequate affordable housing and healthcare, or even emergency shelter in our communities. People experiencing homelessness learn that while shelters may exist, they are not really accessible to them, so they no more choose to live in an encampment than a person in a wheelchair chooses not to go into a building that only has stairs to the front door. Yes, it might not be inaccessible to most people, but to them, it's not a real choice. And we'll get down to the specifics of the Martin versus Boise decision in a bit, but I just want to highlight this language from Martin here because it is so powerful, not just from the legal side, but for changing that false narrative of personal choice. We've all heard this idea that cities offer ample shelter and services, but some people are just service resistant. No, it is the services that are people resistant. And Martin calls this out. If communities put half the energy and resources into improving outreach and services that they put into coming up with new criminalizing ordinances and enforcing them, we could end homelessness and all of its negative impacts tomorrow. Los Angeles, for example, spends $100 million a year on homelessness, but $87 million of that is on law enforcement expenses, while only $13 million goes to services, shelters, and housing. And we know that every dollar spent on housing first saves multiple dollars elsewhere, so just imagine if that were reversed. Within a few years, all of the encampments that LA politicians get complaints about would disappear, and there would be no need for them to spend all this time and money coming up with new bulky item ordinances or no sleeping in your car ordinances. But unfortunately, that's not what happens. Without an ample supply of affordable housing, we've seen this mammoth growth of an unsheltered homelessness and a more than 1,300% growth of reported encampments over the past 10 years. And in that same time, bans on camping, on sleeping, on loitering, and living in vehicles increased by double or triple-digit percentages. In a vicious cycle, unsheltered homelessness puts pressure on elected officials to, quote, do something about homelessness, and what they do is pass ordinances to pretend they're solving the problem, even when they're making it worse. So why does this happen? Because when a constituent comes to their elected official and says, there's a homeless camper on my corner and I want them gone, the official has two choices. One is they can do the right thing, the smart thing, the cost-effective thing, and with COVID, the thing that will save the lives not just of homeless people, but of other community members as well. And that's to get people into housing. But even in COVID times, we see incredible resistance to affordable housing or even temporary sheltering in communities. So that elected official knows they're going to get huge blowback, probably face years of zoning battles before anything even gets built, and have to acknowledge all of the costs of developing the affordable housing up front, and quite possibly be voted out of office before the shelter or the housing is even has its ribbon cutting. Or they can choose to pass a quick ordinance, saying that it's illegal for that person to sleep on the corner, and they can hide the fiscal impact, as they almost always do in these ordinances where they check the box that says no fiscal impact. Nothing could be further from the truth. It's actually going to cost them 2 to 3 times more to put a person in jail as it would to simply house them. But that's politically much easier to do because they don't have to acknowledge that cost. And so that's what happens time after time. The criminalization approach is based on this false assumption that individuals are choosing to be homeless in a world with ample resources, and they are the ones who need to be held accountable. But as I said, they are not the ones making the choices that really matter, and it's not a choice to need to sleep or shelter yourself from the elements. So it's not people experiencing homelessness who should be held accountable for sleeping in parks, but our elected officials who aren't doing what it takes to reverse the facts that shelters are full every night and that rents have outpaced wage growth for decades. Every time someone proposes one of these ordinances, there should be a cry from the taxpayers. Why are you misspending my tax dollars to house people in jail rather than adequate housing? But this narrative of personal responsibility allows elected officials to circumvent that train of thought. And because homelessness disparately affects people of color, with disabilities, and the LGBTQ community, and these communities are already subject to over-policing, unsheltered homelessness and criminalization of homelessness hurts those who are already marginalized even more. And that disparate problem means that as we call on our elected officials to help solve the problem, we have to look for equitable solutions that will directly address those gaps. Because when we don't, the consequences can be literally life or death. Today, we have to say the name of Kurt Andres Reinhold, which isn't as widely known as George Floyd or Breonna Taylor, but who is yet another Black man killed unnecessarily by police this summer, just because he was out there experiencing homelessness and in crisis. But because people experiencing homelessness live their entire lives exposed to public view and to police scrutiny, and these laws on the books can literally make their very existence in public space a crime, when race and homelessness intersect, it makes Black, Indigenous, and people of color extremely vulnerable to police interaction and potentially police violence. And this is why we have to connect to the movements for racial equity and support them in their movements to decarcerate and defund the police and invest instead in community services. Much as I love our world of housing and homelessness advocates, we can't get to the world we need on our own. But by joining with the powerful movements being led by people with direct experience of poverty, homelessness, and racism, we can change the narrative and change the outcomes. And when I say defund the police, that's not because I'm against the police. Does the picture here look like a safe situation for these officers to be in? No, it puts them more at risk as well. And that's why the DOJ's COPS office dedicated their entire December 2015 newsletter to talking about alternatives to criminalization, so that they can get the police out of that role. And it's why dozens of current and former law enforcement officers have endorsed our Housing Not Handcuffs campaign. And here in Eugene, Oregon, you have one of the best models of alternatives out there. So you've got a lot to be proud of. It's much better to keep people in crisis away from law enforcement altogether, if possible, and that's what the Cahoots model does. But we know that people experiencing homelessness and other marginalized individuals don't have a lot of political clout, and often their voices aren't heard in the political process. So while we at the Law Center try to work as much as we can with communities to develop collective solutions, sometimes we need to leverage the power of the law. Our laws are very imperfect, and bringing lawsuits is not always the easiest or best approach. But in recent years, the courts have been largely on our side. I want to make clear that our goal in litigation is not to protect the right of people to sleep in parks or on sidewalks. That's not a win for me, for you all, or for the people sleeping in places they're not supposed to be. But we need to stop communities from using the criminal justice system to address the visible symptoms of homelessness and instead focus their efforts on getting people into housing, which will then address those symptoms in a much more permanent way and will be a win-win-win for all involved. When people are housed, they don't need to sleep or eat or go to the bathroom outside. Remember this false choice? Our hope is that our litigation can take option B off the table and give the good elected officials the political cover to make the hard but right choice. They can say, I hear that you want that person gone today, but the courts have told us we can't just sweep that person into jail, but work with me and we'll find a better place to house them, and then we can all come out better for it at a lower cost. We can circumvent that step that always gets them hung up and forced into these false choices that they don't want to be making. So now this brings me to the Martin versus Boise case and what it means for communities. And by the way, this fact sheet is available on our Housing Not Handcuffs website, where you should all go, endorse our campaign, and check out all of our resources. So way back in 2008, a legal attorney from Boise reached out to us saying he had a couple of folks, Janet Bell, Robert Martin, Lawrence Lee Smith, Robert Anderson, Basil Humphrey, and Pamela Hawks, who had been arrested for trying to sleep in Boise, despite the lack of available shelter beds on the nights they were arrested. And I named them because it took their courage to get this case started, which we did only after trying our best to negotiate with the city. The case wound its way through the courts, and until 2018, the Ninth Circuit, which has jurisdiction over the Pacific Coast and some mountain states, ruled in our case, Martin versus Boise, that it is cruel and unusual punishment to penalize people for undertaking life-sustaining activities like sleeping and sheltering themselves in the absence of practically accessible alternatives. That last part is key. It doesn't mean you can't have a law that says no camping in the park, but it does mean that you can't enforce that law until the community develops adequate alternatives. The court didn't say exactly what adequacy means, but it did give some guidelines. Indoor beds, not mats, not tents, accommodating disabilities, religious or other restrictions. And this is all based on a theory that punishing a person for their status, something that they cannot change about themselves, is cruel and unusual punishment under the Eighth Amendment. This leads to a need for an individualized assessment for people on the street. A shelter which forces a veteran with PTSD to sleep in a congregate bunker-like shelter is not an adequate alternative. A shelter that requires people to be in by 6 p.m. and out by 6 a.m. is not adequate for somebody who's working an evening shift. Adequate means adequate for that individual, and if that doesn't exist, the ordinance cannot be enforced against that individual, and if that isn't clear, that entire law can be struck down. The biggest message I want you to go back to your communities with, though, is that they should not be viewing these decisions as limitations on what they can do, but rather as opportunities to mobilize the community to finally do the right things, to stop using these ordinances as a crutch to avoid the hard, but ultimately more effective decisions to create more affordable and supportive housing. If they use the criminal justice system to sweep someone from one street corner, but don't give them an alternative, they'll just end up on another and still be their headache. But if they work to get that alternative through the Housing First, permanent supportive housing, rapid rehousing programs you all run and know are proven to work, they'll be off the streets permanently. And while this decision is binding in the Ninth Circuit, where you all are, you should also know that Boise appealed the decision, first to an en banc panel of the Ninth Circuit, which declined to overturn it, and then to the Supreme Court. The Supreme Court declined to hear the case, which means that the Ninth Circuit's decision stands as the law of the land binding in the Ninth Circuit. That's not an official ruling on the merits binding on the full country, but it is persuasive to the other circuits outside of the Ninth that the ruling at least didn't trouble the court enough to intervene. And this has had immediate impacts, because at the time, the Trump administration was developing plans for an executive order that was rumored to include directives to raise homeless encampments and forcibly relocate residents to essentially internment camps. But with the Supreme Court's letting the case stand, the administration realized it couldn't legally do what it wanted to do, and so reversed course publicly, though they kept pursuing similar approaches behind the scenes. And the courts haven't remained still since. In a case right here in Oregon, a district court judge clarified that Martin's ruling applies not just to ordinances with criminal penalties, but also to laws with civil fines, because those fines violate another clause of the Eighth Amendment, the excessive fines clause. He ruled that any fine for the involuntary need to sleep and shelter oneself is too much. And he further clarified that the ruling applies not just to anti-camping ordinances, but to all of the many ordinances which criminalize basic life-sustaining behaviors of people experiencing homelessness. The city has appealed this ruling to the Ninth Circuit, but the decision stands at the moment. Now, since then, we've been living in COVID times, and that has special implications under Martin. We know that people experiencing homelessness are more likely to get more sick under COVID. So right now, the worst thing cities could be doing would be to put people into congregate shelter facilities where COVID could spread quickly, right? This is why the CDC has issued clear guidance that congregate shelter spaces are not safe alternatives for people living unsheltered, and camps should only be cleared if individual housing units like hotel rooms are available. So our understanding is that under Martin, until there's a widely available vaccine, no congregate space is an adequate alternative. This saves not only the lives of people experiencing homelessness, but anyone in the community who might need a hospital bed that would be otherwise filled by an extremely susceptible homeless person who's instead being safely housed in a hotel room. The message to our elected officials needs to be, if you want that ventilator available for your grandmother tomorrow, you need to house people safely in individual units today. And, as you may know, as a result of this, California has started to do just that, using CARES Act funding to rent hotel rooms for tens of thousands of people experiencing homelessness. And here in Oregon and in other places, lawmakers are even going a step further, looking to buy hotels, which will help create safer, healthier environments for people getting off the street through the pandemic and beyond. And assuming that at some point things will return to normal, we can also see other steps that other cities have taken in the wake of Martin. Now, I know I said earlier that the ruling required indoor beds and that tents aren't indoors, but some communities are trying different forms of tiny homes or box tent temporary encampments as interim solutions while they build up more permanent housing and shelter. If you're looking for bright line rules to follow, this might seem wrong, but for a group like mine, if I see a community doing its best and heading in the right direction, that's a community I'm going to help get to that permanent solution, not one that I'm going to sue for doing this harm reduction step while they figure things out. So in terms of concrete guidance for you, we've developed 6 principles and accompanying practices through interviews with government officials, advocates, service providers, and people who actually live in encampments for how to address encampments. Everything I'm going to talk about today is in our Tent City USA report, so please download the report for the details, which also includes case studies and some of the places implementing some of these best practices. The most important of the principles is that as human beings, we all need a safe, accessible, legal place to be, both day and night, and to securely store belongings until permanent housing is found. We emphasize that we do not accept that homeless encampments should become permanent features of American cities, that we can and we must do better by our fellow citizens than to let them live in parks or shanty towns on the peripheries of our cities. So the first commitment has to be to finding permanent solutions. But that said, until those solutions are there, cities should find ways of ensuring that everyone has access to the basic elements they need to survive with dignity. Second, these approaches need to be guided by those directly affected by them. People living in encampments have been improvising their own solutions for decades. Rather than imposing top-down approaches that meet the needs of elected officials or those not living in encampments and forcing people to comply, communities should be looking to the expertise of those living in the encampments and working with them to develop solutions that will work for all, and that all is an inclusive all. Third, we know that encampments can't be permanent, but moving people without a plan only makes things worse and moves the problem elsewhere. Charleston, South Carolina, which has a case study in our report, removed a 100-person encampment without a single arrest and put many of its residents into permanent housing because they engaged the community and made a clear plan in consultation with them. Courts have required minimum 3 days notice and storage of swept property for up to 90 days, but our recommendation is at least a minimum of 30 days notice and more if possible to allow social service workers to develop relationships, understand people's needs and barriers, and match them with appropriate solutions. Clear procedures and ample timelines protect the interests of homeless persons, law enforcement, service providers, and other city residents alike. Fourth, again, we do not want encampments to become permanent, but we recognize that organized homelessness with resources to address sanitation and environmental issues are better for homeless persons and communities than unorganized ones. For cities considering legalizing encampments, like Modesto did, we set forth several considerations for ensuring it's as close to fully adequate housing as possible, including access to sanitation and transportation for those living there, and policies facilitating potential hosts' ability to provide resources. Fifth, again, alternatives to encampments must be real alternatives, allowing people to bring their pets, possessions, and partners to a safe, habitable, affordable, and accessible place, whether it is to temporary shelter or to permanent housing. Recent court settlements in Orange and Sonoma counties have fleshed some of this out, and I'm happy to go into some of those details in the Q&A if needed. And last, while we believe the existence of encampments is a social service issue, not a criminal justice one, law enforcement does have a role to play, but it should be one that supports the needs of all members, housed and unhoused, in the community. Unless you think that these principles are all pie in the sky, I'm happy to share that the Los Angeles Homeless Services Authority, dealing with the largest unsheltered homeless population in the country, has incorporated these principles into their own official guidance. So I've shared a lot of the best practices here with you, and the good news is that Martin helps reinforce them. But at the same time, we know that millions of people are at risk of eviction and millions more are hurting. And this guy continues to refuse to negotiate an ample relief package with housing assistance. I'm not making this political. Homelessness should be a bipartisan issue, but the Senate Majority Leader knows he holds the power to rent relief in his hands, and there's already blood on those hands for not passing it yet, and I'm not going to back down on holding him personally accountable. People most likely have already died because they lost their housing and got COVID. People are losing their homes already, and that leads to lifelong impacts on credit, wealth, education, and potentially health. And there's a very real chance that it will get much, much worse before it gets better, and we'll see a dramatic growth in unsheltered homelessness. And we know that at the local level, when communities see more people on the streets, there's more of a push to get them out of public view through criminalization. And we know that all of this is having and will continue disparate impacts on communities of color. And as with all forms of institutional racism, all it takes to perpetuate the unequal status quo is for people to do nothing. It takes active anti-racism to change the baseline, and that there's tremendous pro-racist forces pushing back. So there's no doubt that we have to be playing offense and defense at the same time, and we're already exhausted and traumatized from the past few years. But let me end on a hopeful note of why I'm hoping that 2021 will be the year for the human right to housing. In 2020, despite it being #2020, through our human rights advocacy, we got Senator Warren to directly call housing a human right. And we also got Senator Booker, Senator Harris, Senator Sanders, and Secretary Castro even led his platform with it. And now, for the first time since FDR, we have our president-elect, we have our president-elect calling housing a right. And I was just named to a transition team stakeholder group, and they actually told us there we don't even need to sell them on the idea that housing is a human right. It's what they're operating with as a base principle. We've also had Representative Omar and other members of the Progressive Caucus introduce the People's Housing Platform bills and are actively identifying housing as a human right at the federal level. And at the state level, we had a constitutional amendment introduced in California that would make housing an enforceable human right. And at the local level, we had folks like the Moms for Housing and others taking over housing for people experiencing homelessness in direct actions to claim their right to housing. So I do have a lot of hope. And we have a lot of other tools to help us along the way. Back in 2015, we got HUD to modify its funding application to incentivize continuums of care to advocate to stop criminalization, providing organizations that might otherwise be scared to take a public stance against criminalization with political cover. We'll lose funding if we don't speak up. And despite the efforts of the current administration, we've been able to keep this language in subsequent funding applications since. So please use this to tell your currently cash-strapped community that they could be missing out on federal dollars if they continue their counterproductive criminalization approach. So we know criminalization hurts individuals and whole communities, including by robbing resources from the groups in this virtual room who are trying to actually end homelessness. So what can you do about it? One, sign up at housing.handcuffs.org to join the more than 2,000 groups and individuals who have already endorsed our National Housing Not Handcuffs campaign. That'll get you on our listserv, where these folks are sharing the good, the bad, and the ugly of what's happening across the country. Two, you guys are already doing a lot, but we can help you stop more bad laws with the tools and talking points on our website. And three, you can replace those bad laws with good ones. Again, all there at housing.handcuffs.org. Go ahead, take a screenshot of the website and check it out. You can go there, click off right now, and I'll give you a second to make your endorsements. And it's also the giving season, so our development director requires me to invite you to also feel free to support our work in other ways. So last but not least, please be in touch if you have any questions. Follow me or our organization on Twitter so you can keep up with all the legal developments. Check out our website as well for more resources and join our email list. And I'll just end here with a quick story that actually brings me to the last time I was in Oregon. Back a few years ago when we could actually still travel, I was in Portland speaking with a group of advocates, including some people who are currently experiencing homelessness. After the meeting, a man I'll call Brian came up to me with a tattered folder in his hand. And out of that folder, he pulled a copy of one of our human rights reports and a copy of the DOJ filing that we got at an earlier stage in the Martin case that had actually caused Portland to place a moratorium on the enforcement of their anti-camping ordinance when it was filed. He didn't know that I was the attorney responsible for the report and the case, but he just said, I want you to know to let whoever was responsible for this know that this has changed everything for me. When I hear you talking about my human right to housing, it makes me feel human again, and that I'm not begging for charity, I'm demanding my right to housing. And when this case came down and Portland stopped enforcing their ordinance, I got my first good night's sleep in 5 years. Then I told him that I was the attorney responsible for it, and he gave me a giant bear hug, and he was crying and I was crying, and it was gave me all the feels. But this is why I do what I do, and we at the Law Center do what we do. We work the international system, we work the courts, we work Congress, we work local legislatures in order to make sure that folks like Brian and like Robert Martin can feel human, can enjoy a decent night's sleep, and we hope will ultimately enjoy their human right to housing. And now I hope you can all do the same. Thanks, and I'm happy to take any questions.
We do have a few questions here, Eric. The first one is, what cities in the West are doing their best and which are not doing their best in relation to addressing homelessness? Are there particular states that stand out as well?
It's a really hard question to answer because many communities have an almost multiple personality disorder approach where frequently you'll see the county doing a lot of good things, taking positive steps, implementing housing first policies, advocating against criminalization, and then you'll have the city, because the city officials are the ones getting pressure from people, as I explained before, they'll be at the same time, you've got one set of government trying to combat criminalization, the other set will be proposing new laws. So there's no one place that is doing everything right. Portland, for example, like I said, they are using their CARES Act dollars to potentially buy hotels that will serve permanently as affordable housing and get us out of this congregate shelter model of care that hasn't worked. So that's great. But, they are continuing to sweep encampments despite the pandemic against the CDC guidance. We see San Diego is also currently in the midst of trying to purchase a hotel and create 300 or 400 new units of permanently supportive housing. But we're in litigation against them right now because they are continuing to enforce an oversized vehicle ordinance that criminalizes people living in RVs. In an expensive city like San Diego is often kind of the last resort for people, particularly people with disabilities who, for whatever reason, can't go into a regular shelter environment. And California as a whole, the state, on the one hand, took the great step through Project Room Key, which then turned into Project Home Key, to try to use the CARES Act dollars in order to create new, to get people immediately off the streets and then to get them into permanent housing. But it was at a scale that was still insufficient, and they still continue, this past year, the voters turned down rent control legislation once again. So it's a real mix. There's no one place doing it all right, and there's no place doing it all wrong. But we on our website, nlchp.org, there's a whole page devoted to coronavirus actions, and there's a tracker there where you can see the responses that communities have taken all across the country. We don't endorse them all because, again, they're likely even the good things are still insufficient, but it's a good place to go and be able to say, look, this is what another community has tried. Why don't we try this here? So, that's as good as I can get on that question.
Thank you. Our next question is, what's the working definition of alternative space? What is an adequate amount of alternative space whereby you would not oppose sweeps?
Like I said, the alternative has to be accessible to each given individual. And we can set a lot of those things up in advance. You can create more, permanent supportive housing units, individual housing units that'll be accessible for people with various forms of mental disabilities, family units that will allow families, however defined, to stay together. Again, those kind of 4 Ps, pets, partners, possessions, and parking are really important to enable people to, not be forced to break up their family however they define it, and to be able to bring their belongings with them into shelter. So it's, low barrier shelters with lots of different alternatives that actually meet the needs of the individuals who are being impacted. And that's how the the communities within the 100,000 Homes campaign were able to house 100,000 of the supposedly most service-resistant individuals. They sent outreach teams out to talk to them, meet with them repeatedly. It took a little bit longer to get them off the streets, but they figured out what the barriers were to the people getting off the streets. So, Joe is a veteran, and he needs a non-congregate space so his PTSD isn't triggered. But Jane, might just be, she lost her job and was evicted. She doesn't mind sleeping in a congregate space. So when that congregate bed opens up, you give it to Jane and don't try to force Joe into it. And then when the individual room opens up, you give that one to Joe. You need to do these, by name lists. This is all stuff that we know, has been proven to work, evidence-based approach. And the good thing about it is when you take this approach, rather than cycling somebody from the streets into a shelter situation that doesn't actually work for them, and then they go back out to the streets, you're actually creating a permanent, a lasting solution. So that investment of resources pays off in the long run. And as I said, the average shelter situation, even for a year, costs a couple $1,000s, whereas putting somebody into jail for a year can cost tens of thousands of dollars. The average jail, just an overnight in jail, costs about $100 to $120 a week, or a night. And so a week in jail could pay for a month of a person's rent. And so those are the choices that we're making. Again, the choices that we need to bring out and we need to bring into the light to say, this is it's much more efficient for us to put people into housing, into situations that are appropriate for them, that will enable them to, stabilize, get on their feet, and move out of homelessness, rather than putting somebody into a jail cell, incurring more costs for the community, and giving that person a criminal record and fines and fees that are going to be a barrier to them ever getting out of homelessness. So, there is a greater investment to figure out what the adequate solution is for each individual, but ultimately it's the one that's going to be much more effective and more cost effective.
Thank you. Our next question is, how can race equity be implemented in our homeless service system? Whenever our community has tried to prioritize a certain group, fair housing is cited and people quit working on the issue. Data has shown for years that our brown and black communities are underserved and experience homelessness at higher rates. If we can't prioritize or only offer services to a group based on race or ethnicity, then how do we achieve race equity?
Good question. I've one of the best things I've heard recently was on an interview with one of the folks at the CDC who was talking about how they were going to prioritize the distribution of vaccines when we know that Black and brown communities are being hit harder. And so how are they going to prioritize those groups if not by race? And the person there said that they wouldn't be prioritizing by race, but by racism, by the incidence of racism, which are all of the kind of economic factors, the fact that they are in low-wage jobs, that they often lack childcare and have to go out, all of those things that make them more vulnerable. So if you look for the social determinants of health, the indicia of racism, you can focus on those things without necessarily needing to explicitly focus on race per se. And I just heard this last week, so I don't know exactly how to implement that at the service provider level, but it sounded really good to me. And I think as you are doing that, we at the policy level, groups need to be speaking out and affirmatively identifying racism as a problem, including emphasizing institutional and structural racism, not just interpersonal racism, and the fact that if we don't call it out, if we don't affirmatively address it, then, as I said before, all it takes for institutional racism to continue is for us to continue doing nothing about it, for not calling it out, and then the status quo allows it to persist. So we need to be actively taking an anti-racist stance in our external policy advocacy, even if we can't, the fair housing type arguments are used. And I think there is actually more wiggle room than people might assume there is there. We're actually doing some legal research right now to see what we can, if we can give better guidance on exactly what people are and aren't allowed to do, more specifically with race itself as a criteria. But I think using racism and its social indicators as kind of your proxy gets you to the same place in a legally acceptable way.
Thank you. This next question comes from our friends at Best Care in Central Oregon. In the post-Martin v. Boise world, have there been any police abuse or pretext arrests of homeless public property campers? For example, campers arrested for disorder conduct or disturbing the peace.
Oh, yes. One of the challenges with, the lawsuits that we bring against criminalization ordinances is that every time we bring a case to knock down one ordinance, they pass another slightly differently worded one, or they use other ordinances of more general applicability, like trespass or disorderly conduct, in order to accomplish the same ends. That's always been a challenge. That's why cases like the Grants Pass case are important, because they say it's not just it's not just criminal ordinances, it's also the civil fines and infractions. It's not just the anti-camping itself, but it's also anything that kind of makes it impossible for people to undertake their basic life-sustaining activities. So at the end of the day, you look at the enforcement, not just what's on the books itself, but how is that law being enforced. And that's, unfortunately, it's much more time intensive. It's much more difficult to bring those as applied challenges as opposed to a facial challenge. You need to build up, a very good set of facts. You need to be able to verify that there wasn't, in fact, shelter available on the night in question. So it's not easy, but I think what on the policy side, you keep with the same argument that, like, using our resources in this way is a really poor use of our resources. It's not going to get us to the end that we all want to get to. And I think reframing the conversation around shared goals is the way to get around that. You say, we all want to see a Portland or, wherever it is, without people who need to live on the streets. That's the goal we all share. And if we share that goal, shouldn't we also share the desire to get there using the most effective, most cost-effective means possible? And if you can get people to that point, then you can point them to the evidence that criminalization doesn't work and in fact hurts, and housing does work. But it's often not easy to get to that point. But yeah, I mean, we not only do we see communities using these other alternative laws, like I said, Los Angeles passed a bulky items ordinance, to criminalize not the people themselves, but the fact that they are storing belongings on the sidewalk, as a way of avoiding saying that we're criminalizing them for sleeping. We're just criminalizing them for having a tent around them while they sleep. But we're not criminalizing the camping. We're not, so they find all different ways of doing it. And they're even trying to pass new ordinances that continue to criminalize camping, but carve out exceptions for different time, manner, and place exceptions to it, to try to make it, consistent with what they interpret as Martin's restrictions. And, for, again, why they are spending taxpayer dollars to try to thread this legal loophole and create a new ordinance that isn't going to solve homelessness is, rather than actually investing time and resources into creating solutions that are actually going to work, it's really frustrating.
Thank you. Our next question is, the moratorium is going to end on 12/31/20. Our next president is not inaugurated until 1/20/2021. What do you foresee happening during that lapse? What can we do to mitigate these issues and concerns?
Yeah, this is the problem that keeps me up at night and makes me want to cry every day, because, like I said, we've seen this problem coming a mile away. We saw it coming back in August when the CARES Act moratorium expired, and rather than providing the rent relief then that was desperately needed, the Senate Majority Leader punted, and we ended up with the CDC moratorium, which is not as good as rent relief. And now we're going to lose even that already inadequate protection. And it's not clear at all that even the bills that have been introduced by the majority leader haven't addressed the rent problem, and haven't suggested that there's going to be a new institution of a moratorium. So I'm really concerned. I'm hoping that the CDC will act to extend the moratorium, at least, through the end of December or through the end of January, so that then the new administration can take action. But it's not clear that that's going to happen. So I think what we can be doing is, calling our elected officials, demanding rent relief now, tweeting #rent relief now. There's a sign-on letter going around right now from the National Low-Income Housing Coalition for folks to sign on to address specifically this gap problem and demand more permanent solutions in the long term. So people should sign on to that and go to the Low-Income Housing Coalition's website to learn more about it. And in communities, in the absence of the federal action, you should be also looking to the state, county, or city level to try to create solutions. There's so much possibility here. There are so many, they could create moratoria on evictions at the local level. They could create, rental assistance programs, repurposing some of the CARES Act dollars that may not have been spent yet. And if people are going to be evicted into homelessness, they could be making arrangements with hotels right now. Like, we know that the entire travel industry is desperate. There are no people staying in hotels and motels right now. So, they could even be offering tax breaks or things like that to these places in exchange for letting people stay there if they do become homeless, and give them a place to immediately go to, rather than having to wander the streets, wander around looking for new apartments, spreading COVID the whole time. There are other vacant properties that could be used. Even school buildings right now, they're largely empty in communities that are doing virtual teaching. People could be staying in those rooms. None of that is ideal. The best thing is to get federal relief, get dollars directly into the hands of renters so that they can pay their landlords and avoid eviction, avoid late payments and all of that. But, I think communities should be looking at these creative solutions that they can be implementing in the meantime.
Thank you. We heard in Portland yesterday that 52% of people arrested pre-pandemic are homeless. How much of this problem is created by a hungry criminal justice system, which is far larger than just police?
As I said, I think it's the real culprit is the elected officials who are taking, what they see as the easy way out when they're confronted with homelessness, and they don't want to have to make the hard decisions about acknowledging costs up front and actually fighting the zoning battles and everything they need to get the affordable housing situated that we actually need. And so their easy way out is to pass these ordinances and hide all the costs. In that way, they appear to be responsive to their constituents' demands, even though they are making it worse. Because it's a real, political incentive problem, and that's why, we hope that using litigation we can remove some of those incentives and change the playing field. But once those laws are in place, the law enforcement system is able to, and in some cases encouraged to, enforce them. And then you do get this vicious cycle. People, who are criminalized for being in public spaces, arrested, given tickets that prevent them from getting out of homelessness, so they're actually out there longer, more visible, more separated from resources that could get them out of homelessness, and then there's more call for harsher enforcement of those laws, and we get back to square one. I think there are a lot of law enforcement officers who I said, do endorse the Housing Not Handcuffs campaign because they don't want to be in this role. They don't want to be sent out to deal with a person in crisis that they don't have adequate training for, because they know that's just the next viral video incident waiting to happen. They would rather have trained social workers going out there giving people help, and ideally those social workers backed with actual housing and resources that they could offer people to get them into a better place. But there are certainly other law enforcement leaders who do take a very, those who adhere to the discredited broken windows approach to policing. Certainly plenty of them still out there who are, hungry and looking for more people to lock up to show that they are, harshly enforcing these laws. I don't think that we shouldn't view the law enforcement system as a monolith, just the way we wouldn't view other communities as a monolith, and we should look for those allies within it. There's an organization called Law Enforcement Action Partnership, LEAP. I think it's lawenforcementactionpartnership.org or something like that. They have a network of progressive law enforcement all across the country who are available to give speeches, write op-eds, give testimony that can help bring that message that law enforcement actually is in favor of decriminalization and investing in better community alternatives as law enforcement, as well as other members of the community.
Thank you. I think that's actually our last question for the afternoon. We appreciate your involvement today and sharing with all of us and answering these questions. And we're going to take a little break here before our next session begins. Thank you again, Eric.
Thank you. Have a good night.
Whether you are recovering from an injury or illness or looking for support and guidance to live a healthier life, Samaritan Health Services wants to be a part of your journey. Together, we can achieve wellness, strength, hope, and joy. Find inspiration to live your best life in stories of triumph, resilience, and determination at samhealth.org/together. Samaritan Health Services, building healthier communities together.
If you remember one thing today, remember this. You matter. And because you matter, the world is better when you're healthy. That's why Care Oregon helps our members get the care they need from the Oregon Health Plan. And lots of good things beyond health care. When you're stronger, you make everyone around you stronger too. That's the Care Oregon effect. Learn how to apply at careoregon.org/OHP.
It's very hard for people to take care of their mental health needs, physical needs, if all you're doing every day is trying to find a safe place to sleep. We're all in this together. And the struggles that some people have, that could be anybody. That could be, me in 2 years. I don't know.
The state of mental health in the country right now is very, very challenging. There's enormous need from many individuals, and oftentimes there's limited ability to access or receive those services.
Historically, whole health care has been, you've got your primary care provider, you've got your mental health provider, you've got maybe your addiction specialist, and they're all sort of doing their own thing independently with very little communication amongst them. But whole health care for us now at Cascadia is that we're bringing all these entities together under one roof. And that's really exciting because now I get to work for a team of diverse professionals with various skill sets, knowledge, experiences, and we get to all put our brains together to really work on finding the best solutions for patients and getting the best outcomes.
So if we can address health from the behavioral health perspective first and foremost, and then add on substance use treatment, physical health treatment, housing, employment, social factors, wellness, you put all of those together, and that really wraps around someone creating a sense of whole health. So we've followed 900 individuals who have received behavioral health services who also are enrolled in our primary care as well. We found that over 80% of those individuals had not seen a primary care doctor in over 2.5 years. Over a year and a half time, we found that we reduced their utilization of the emergency department by 18% and their inpatient medical admissions by 23%. I have never seen results like that in my career, and it is a testament to an approach that can work really well to improve people's lives. It would be ideal to have more centers like the Garlington Center, a space where people feel comfortable, both clients and our colleagues, a space that is respectful and safe, and a space that promotes this approach of providing whole health care where individuals can get a variety of services that they need to improve the quality of their lives. I could not be more excited for the creation of Garlington because it creates the first step towards a model of care that hopefully we can deliver here in Portland. We always must have support from our community in order to create these centers that really serve many important goals in our community. So we really rely on the generosity of our donors to achieve that, and we're so grateful that people believe in the work we're doing and stand with us in helping us move that forward and create places like Garlington.
Hello, I'm Congressmember Judy Chu from Pasadena, California, and I'm so pleased to be joining you today for the 2020 Oregon Housing Conference. Housing has never been more significant than during this pandemic. Our homes are doubling as our offices, schools, and daycares, sometimes all three at once. And the need to be secure in one's home has never mattered more as we work to stay home and socially distance in order to stop the spread of the coronavirus. But with the enormous strains this pandemic has placed on family budgets, some families may find themselves on the cusp of homelessness for the first time in their lives. And for the most vulnerable, those already experiencing homelessness, this pandemic is especially cruel. How can one wash their hands, maintain social distancing, and stay at home without an actual home to turn to? That is why we cannot wait. We must take urgent actions to keep people in their homes, help keep homes affordable, and ensure housing for those who need it. Already this is happening in my home state of California, where our counties and our homeless service agencies have collaborated on Project Room Key, a coordinated effort to use empty hotel rooms as shelter for seniors and other high-risk individuals that are experiencing homelessness during this pandemic. Their work is helping keep not just the clients they serve healthy, but whole communities healthy. But preventing and ending homelessness can't just be up to cities and community organizations, especially not this year when the coronavirus pandemic has put such a strain on our state and local governments, and more families than ever are at risk of homelessness. That is why House Democrats acted quickly to pass historic amounts of relief to get our country through this once-in-a-century crisis. In total, Congress has passed 4 COVID relief bills. The largest one, the Coronavirus Aid, Relief, and Economic Security, or CARES Act, was signed into law in March. This massive $2 trillion relief package was the largest stimulus bill passed by Congress in history. It not only expanded unemployment benefits to help families deal with lost jobs and wages so families could pay their rent. We also included protections specifically for homeowners and renters to help them stay in their homes. Under the CARES Act, homeowners with mortgages from the Federal Housing Administration, the Department of Veterans Affairs, or other federal agencies can request a no questions asked forbearance on mortgage payments for up to 12 months with no fees, penalties, or extra interest. The CARES Act also includes a 60-day moratorium on foreclosures and evictions for those same homeowners, which has fortunately now been extended until the end of this year through executive action. The CARES Act also protects millions of renters from eviction, while also providing supports for landlords who are also struggling to make payments on properties where their tenants are experiencing hardship. For instance, if a landlord owns a multifamily rental property thanks to a federally backed loan, they are eligible to receive a 90-day forbearance on those loans. But during those 90 days, they cannot evict tenants or charge late fees or other penalties to tenants who can't pay rent. That way, neither renters nor property owners are paying the price for a pandemic that was not their fault. The CARES Act also provided funding for vulnerable populations that already receive government assistance for housing. That includes $4 billion in community development block grant funding, which LA County used for additional rental assistance, and $10 million to ensure that elderly households living in HUD-assisted housing have access to service coordinators. We also have to make sure that this money is going to the people it was meant to help and not being used to discriminate against minorities and other protected classes of people. So, the CARES Act included $2.5 million for fair housing enforcement and education as well. But the CARES Act was always a first step, not the final one. The pandemic is outlasting many of the measures in the CARES Act, and it's getting worse. After months of cases dropping, we are seeing a national spike in COVID-19 cases, and with the holidays coming up, these numbers are expected to keep climbing. Even though we have positive news with a vaccine on the horizon, it's clear the pandemic is not ending, and so neither can Congress's response. There is more we must be doing for homeowners and renters to ensure that everyone can make it through this pandemic. And that is why, way back in May, House Democrats once again voted to provide historic levels of COVID relief in a second aid package called the HEROES Act. And like the CARES Act, the HEROES Act helps address the immediate needs of renters and homeowners. First, for those homeowners that took advantage of mortgage forbearances, we have to ensure the repayment terms are financially feasible on the other side of the crisis. Otherwise, we're just setting up another cliff for them to fall off. The HEROES Act takes care of this by ensuring that homeowners are not required to pay back their forbearance as a lump sum payment that they cannot afford, and instead lets the repayment be spread out over time. Second, while approximately 70% of mortgages in the country are federally related loans protected by the provisions in the CARES Act, that still leaves about 30% of homeowners with mortgages without those protections. We can't let those families risk losing their homes either, and so the HEROES Act protects those mortgages as well. The HEROES Act also provides $75 billion to state housing agencies to help homeowners pay any missed mortgage payments, homeowner insurance premiums, and property taxes that are due. And it would provide $100 billion to help renters pay back rent and any late fees that are due. Finally, it includes $4 billion in housing vouchers, $5 billion in homeless assistance grants, and more funding for public housing and other rental assistance programs that have long served the most vulnerable households. And as the pandemic continues, Democrats know we need the HEROES Act to shore up the economy and keep families in their homes. If we need to stay home and socially distance to contain this virus, it is Congress's responsibility to provide relief to those sacrificing so much so we can keep our communities healthy. But for 6 months now, Republicans have refused to act, instead letting the CARES Act protections for homeowners and renters expire, just as the additional unemployment assistance also expired, putting so many families at the brink of homelessness. Inaction cannot be an option when so many Americans need help. And so the House tried again in September, passing a pared-down version of the HEROES Act as a compromise in order to bring Republicans to the table. But they still have refused to even consider it. Still, I am hopeful that we can see a coronavirus deal by the end of this year because I know how necessary it is. And it is clear that we have to do more to help prevent homelessness as we enter the winter wave of this pandemic. Then we can start with putting our focus where it should be, keeping families housed, not evicting them. A new report last week from the National Low Income Housing Coalition and the Innovation for Justice program at the University of Arizona estimates that the public cost of evicting renters over the next several months will be between $62 billion and $129 billion. That's a significant sum of money which should be spent helping families pay rent, not spent on evicting them in court. And so House Democrats are continuing to make relief for renters a priority in any action we take this year. Finally, as we look ahead to next year, we need to start looking at how we rebuild the economy. And that is why one of the House Democrats' top priorities for the next Congress is passing a long-promised infrastructure package to put people back to work, spur more construction, and invest in affordable housing to end the homelessness that existed before the pandemic. We have already taken a significant step this summer to set the table when House Democrats passed H.R. 2, the Moving Forward Act, back in July. Crucially, in addition to other infrastructure spending, that $1.5 trillion package provides a great roadmap forward for investments in housing, including major investments into public housing and long-needed changes to the low-income housing tax credit to help develop more affordable housing across the country. I'm hopeful that the incoming Biden administration will be able to help us move this bill forward next year. Nobody should lose their home because of this virus. I'm fighting to ensure that nobody is at risk of losing their home and that we continue to create more housing opportunities. And I'm so grateful for all that you are doing as well. So thank you again for all that you are doing to make affordable and safe housing a reality for every person, and I hope you enjoy the rest of the conference.
Hi, good morning. My name is Meredith Berkson, and I'm the Director of Policy and Systems for the Los Angeles Homeless Services Authority. I'm here today to talk about the LAHSA, or the Los Angeles Homeless Services Authority, also known as LAHSA. That's our acronym. And I'm here to talk about our COVID-19 recovery plan, and specifically both how we responded to the pandemic as a homeless service delivery system here in Los Angeles and as the COC lead, really leading that effort. And then talk about how we are planning to recover from, to continue to provide life-saving services during this ongoing pandemic, but also to talk about how we hope to recover, both financially and from a public health standpoint, for our most vulnerable neighbors experiencing homelessness here in Los Angeles County. So I will go ahead and share my screen to begin my presentation. And apologies. So today I will be talking about, and let me do this. Today I'll be giving you an executive summary of our COVID-19 recovery plan. I'll talk a little bit about our guiding principles, talk about CES refinements or coordinated entry system refinements we've done in Los Angeles to be able to implement the COVID-19 recovery plan. And then finally, I'll talk about our Project Room Key transition. So the COVID-19 recovery plan is a comprehensive plan to rehouse 15,000 of the most vulnerable people experiencing homelessness in LA into housing. This 15,000 number really came from our estimation of how many people experiencing homelessness in Los Angeles County are COVID vulnerable, according to Center for Disease Control or CDC guidance. That's people who are over 65 or who have an underlying chronic health condition that make them susceptible to severe consequence or even death from COVID-19. Obviously, we're still in a global pandemic, and rehousing our at-risk population both helps break the curve of COVID-19 and can save the lives of thousands of people. The recovery plan builds on the success of sheltering over 7,000 people during our coordinated city-county response to the pandemic by providing sustainable housing solutions for people experiencing homelessness who are the most vulnerable to severe complications. So in our Project Room Key, this 7,000 number represents both our Project Room Key effort, where we stood up over 4,000 hotel rooms throughout LA to address the pandemic in just a very short time. And then also our isolation and quarantine sites that we partnered with the city and county to be able to stand up. So our guiding principles for this recovery plan essentially are to ensure that no one sheltered through our COVID-19 efforts should return to the street. We really saw amazing collaboration and the very rapid sort of standing up of interim housing options, specifically non-congregate sort of COVID-safe interim housing options during our pandemic response. And we need to ensure that no one returns to the streets. We want to quickly house 15,000 of the most vulnerable people in Los Angeles, as I mentioned. We want to curb inflow into homelessness, both by working with our mainstream partners and also identifying and providing resources to people most at risk of becoming homeless. We want to prepare the system for future crises. We really felt the capacity challenge of both standing up Project Room Key and then transitioning into our COVID recovery plan, and the sort of capacity challenges and disaster response has been very difficult on our provider network and on our system. So ensuring that any future crises, we are sort of as prepared as possible. And then we also want to ensure a racial equity lens in all of our efforts. We know that both in Los Angeles, 9% of the population in Los Angeles County are African American, and African Americans represent over 40 or approximately 40% of people experiencing homelessness in Los Angeles. So people of color are already disproportionately represented in our homeless population. And we also know that people of color have worse health outcomes from contracting COVID-19 and have had higher rates of mortality. So we really need to ensure that as we recover from both this economic and public health crisis, that we don't exacerbate things that push specifically people of color into homelessness and into severe sort of health outcomes. Our COVID-19 recovery plan is moving in two phases. So we're leveraging at this point funds from the Treasury, the Corona Relief Funds, ESG CV funds from the CARES Act, as well as our local Measure H revenue source, which is a quarter-cent sales tax that generates revenue specifically to address homelessness. We're using all of these funds to essentially do a massive one-year lease-up effort or housing surge, where we put everybody into housing, into permanent housing, or as many people into permanent housing as possible. And then essentially use a progressive engagement model to identify what exit pathway is most appropriate for those individuals. So participants with the highest acuity will need to be transferred to supportive housing and will be transferred from their permanent housing unit into a PSH subsidy or PSH unit if it's project-based as these become available. Others will be transferred to a long-term shallow subsidy program. So essentially an ongoing $300 to $500 subsidy that can help people cope with the lack of affordable housing in Los Angeles. We also intend to have people with lower acuity needs exit through the sort of typical rapid rehousing tapered rental subsidy, where they continue to increase the amount of rent that they're covering themselves up until they exit the program and assume full rent. And then some participants we anticipate will go directly into a shallow subsidy. With the funding received from the county and the city of Los Angeles, LAHSA will house approximately 4,700 people. We still aim to house the 15,000 people experiencing homelessness we identified and who are most vulnerable to COVID-19, but this will require additional funding, which we're continuing to advocate to our government partners to provide. We look forward to working with the city and county, as well as the state and federal government to secure these funds as we move forward. So next, I'm just going to talk a little bit about our CES refinement. So as I mentioned, one of our core guiding principles in this effort has been to move people into permanent housing as quickly as possible. And in order to do that, we really determined that there were several refinements our system needed to make to move at the pace that a pandemic and frankly, the crisis of homelessness requires. Prior to the pandemic, Los Angeles or LAHSA and our partner, we hosted a series of coordinated entry system refinements with both our single adult, youth, and family lead agencies. Oops, sorry, technical difficulties. But we met with our providers to hear about how the system is currently functioning in Los Angeles and how we can improve the system. Many of the things that were raised in those refinement workshops, we intended to roll out in February of this year, basically right when the stay-at-home order was released, late February, early March, right when the stay-at-home order was released. So we put a lot of those efforts on hold while we stood up Project Roomkey. As we pivoted to this recovery plan, which again really works to ensure that no one in Project Roomkey or other COVID specific housing exits to the streets, and that people are able to quickly access permanent housing, we really saw this as an opportunity to implement these refinements in this expedited context. So several refinements are in the process of being made to, again, assure success in our recovery plan and in our effort to get people safely permanently housed as quickly as possible. One is active inventory management and matching to recovery rehousing slots. So in our coordinated entry system, recovery or rapid rehousing is not currently matched through the coordinated entry system. We have contracts with individual providers. Those individual providers are tasked with serving the region and not just their own clients. But essentially, we don't match to these resources in coordinated entry. And part of that is because we are our recovery, our rapid rehousing contracts aren't like typical slots like you see in PSH, where it's a resource that you match to an individual. Our contracts are cost reimbursement based, and so the number of individuals served can vary depending on things like how much the rent is and how much a provider actually spends per client. We are in an attempt especially to fully leverage the Corona relief funds provided by the Treasury that expire December 30th. We're actively looking at our contracts, identifying underspend in real time, and matching additional people to those slots of permanent housing freed up through underspend. This is, again, to maximize contracts and to surge housing placements, but I think represents a very exciting opportunity for Los Angeles to look at how we might be able to match more resources through our coordinated entry system to those most vulnerable. Number two is dedicated and matched housing navigation and use of outreach for navigation. So just to be clear, because I know housing navigation can mean different things to different communities, we're really talking about here the people who are essentially tasked with assisting the most vulnerable people experiencing homelessness, who are most likely to be matched to permanent housing and specifically permanent supportive housing, helping those people both obtain documentation, connect to benefits, but also just to know, to have someone as a point of contact in HMIS so that when we match this very vulnerable individual to housing, we can call their housing navigator and say, hey, it's finally time for Jane to be matched to housing, and that housing navigator will know where they are, will ideally have that person have that person's IDs secured, social security card secured, and uploaded into our homeless management information system, and that person is ready to move into permanent housing. This housing navigation also assists with housing location and housing applications, so unit viewings, which obviously are more complicated in the COVID environment. But this is really an essential function to ensure that people can move into housing as quickly as possible, and that we can serve the most vulnerable folks. So we added 38 housing navigators to our system throughout our county, and these housing navigators are matched to people essentially who are next to be matched to recovery rehousing. Number three is more robust regional coordination and case conferencing. So we're really leveraging in each of our service planning areas. So Los Angeles is broken up into 8 service planning areas, and each service planning area has a coordinated entry lead for single adults, youth, and family. And we are working specifically with the single adult regional coordinators in each SPA to really work to ensure that these minimal resources are targeting the most vulnerable people, and that we're looking at a host of vulnerability factors, including the BI-SPDAT, but also COVID vulnerability factors in partnership with our Department of Health Services, sort of tiering out the level of COVID vulnerability people have, as well as the use of the 5x5 tool and some of the questions from that specifically get at people's functional impairment, either because of substance use, mental health, or a primary care or physical issue. Number 4 is that we needed to create a mechanism to move people to different service pathways. So as I mentioned, this massive sort of phase 1 effort to move people into housing with a time-limited subsidy, and then to identify their ultimate exit pathway, is a really critical thing in Los Angeles, and I'm sure in other regions too, to be able to determine not at the front end necessarily, but once someone is in housing and has stabilized somewhat, whether they ultimately need permanent supportive housing, maybe they even need a higher level of care, or whether someone you might have assumed that who needed permanent supportive housing actually is able to sustain housing through their own sort of means once they get into housing and begin to stabilize. So this mechanism to be able to both upstream and downstream people into the appropriate level of care once in housing is a really critical component of the recovery plan, and again, one that we hope to scale to our entire system. We also have really engaged mainstream systems. This is number 5. So our Department of Public Social Services, which is our welfare administering entity, has been co-located at our Project Roomkey sites. They've been critical in being able to establish people's benefits, including our general relief, our welfare, CalFresh, and Medi-Cal. We've also partnered with Department of Health Services to build out a very robust testing strategy. We've worked closely with Department of Mental Health and our Substance Abuse Prevention and Control, as well as Department of Public Health, to ensure that all of people's sort of immediate needs are able to be met in Project Roomkey, but also as people transition to housing. Number 6 is scaled and centralized unit identification and acquisition strategy. So Los Angeles, I'm sure, like many other continuums and folks out there listening, is an incredibly tight rental market. It's very costly here. Our vacancy rate is approximately 2%. And what we saw when Measure H really rolled out is that sort of an influx of housing subsidies in our market can actually drive the cost of living up, or the cost of rent up, because we're essentially competing against, every other person. People experiencing homelessness are competing against each other in a very tight market, but we're also competing against other people, and that need just drives up the cost of living. So we really wanted to be intentional about how we centralized unit acquisition. And so our negotiation with landlords could really be, again, centralized, and that we didn't inadvertently drive up the cost of living, especially in this financially challenging moment. We also are piloting more of a similar to a master leasing strategy, but instead of master leasing, it's a master rental assistance agreement that mitigates both the liability for the provider as well as for the landlord or property owner, to ensure that we can secure more units at a cost-effective rate. And then last, we really, as I mentioned, want to ensure that we're using an equity framework to actively monitor enrollment and outcomes. Again, we want, in applying an equity framework, to be able to ensure that we are not exacerbating any of the inequities that we've already seen in the homeless service delivery system, in the disproportionate representation of Black people experiencing homelessness in Los Angeles, but also in the extremely, disparate health impacts of COVID for people of color. So we want to ensure that we're not exacerbating those, and we are doing our best to actually mitigate those factors. So lastly, just to talk briefly for those of you who also have Project Roomkeys and are transitioning those Project Roomkeys or demobilizing them, taking those sites offline. We have begun transitioning our Project Roomkey participants. Actually, at this point, over 800 rooms have come offline. We have a 3% exit to unsheltered destinations, which is really an amazing sort of testament to the intensive work that's been happening through case conferencing as sites come offline. We've seen a steady increase in the number of people who are exiting from a Project Roomkey site that's coming offline directly to permanent housing, and are currently at 37% of people exiting to permanent housing, with the remainder exiting to another interim housing site, whether a motel voucher, another Project Roomkey, or another interim housing site, while they continue to work on permanent housing resources. We're taking approximately 400 to 1,000 rooms offline a month, trying to be as sensitive as we can to sort of regional intensity of these efforts and the ability to absorb the number of placements that we need to make in order to have no one exit to the street. Again, you've heard me say it many times in this presentation, but we do not want any participant in Project Roomkey to return to the street. We're working with each person individually and with providers at a more sort of macro level to ensure that every person has a successful service pathway and an exit to permanent housing. So just one thing about our ramp down model, and this is my last slide. So I mentioned this robust case conferencing effort that's happening to really ensure that everybody is assessed, that we are determining the most appropriate permanent housing placement for them. Initially with the intention to be able to help people exit to the most appropriate exit pathway. We're supporting people to obtain necessary documentation and to link them to appropriate permanent housing. Stage 2 is really right at the 6-week mark before our Project Room Key end date. And during this period, the hotel stops accepting participants, so no new participants enter at that point. LAHSA, Department of Mental Health, Department of Health Services, the site provider, and the coordinated entry system lead begin a cross-system, cross-agency effort to match participants to an exit location, again with the goal to have no participant return to the streets. And LAHSA will ensure the transition of PRK exit sites, phased with exits taking place at least 6 weeks prior to the end date, and will have moved every client out at least 1 week before the lease end date. So this has been a really massive effort, but has, again, yielded very positive results. Just one last slide on next steps. We are continuing to ramp up our new recovery rehousing subsidies and services to cover all Project Room Key residents. We're actually in the process currently of amending our Corona relief contracts that expire December 30th due to the expenditure deadline to include ESG CV funds to continue subsidies for folks who have moved in and to enable additional people to move into permanent housing. We're establishing a full PRK, Project Room Key demobilization schedule with the city and county that enables success and ensures participant safety. We're making refinements to our ramp down model, and we're tracking and responding to performance with an equity lens. This is, again, an extremely critical approach as we move forward. So with that, I would normally open to questions, but since we're in a weird virtual environment, I will say if you have any questions, I would be happy to answer them, and I'll ensure that the conference organizers have my email, but it's Meredith, or rather M. Berkson, at lahsa.org, and I look forward to connecting. Thank you, be safe, and take care.
For over 40 years, Central City Concern has helped thousands of people to find homes, to regain health and recovery, and to build economic stability and resilience. Every year, CCC works with over 13,000 people across several domains. We provide health care, inclusive of primary care, addictions care, mental health, that is really person-centered. We provide supportive employment, walking alongside people to help them get meaningful wage jobs. And we work with people to find housing that is safe and supportive and affordable.
I went from homelessness to homeowner in a matter of 10 years. I feel, my story does help others believe that they can do it too, because I did it and I didn't think I could do it. Some people have never had a job, or maybe it's been a very long time, and so we are able to offer more compassion and coaching, getting people ready to get into a more permanent full-time position.
Because of CCC, I was able to get my prison sentence suspended because they see me out here working and cleaning up the town. I'm 36 years old, been in recovery for 19 months and 9 days. Got 5 kids at home. CCC actually helped me change my life because I got a job that I'm able to work with the background that I have, and I'm able to feed my children, and got a nice place to live, roof over my head. The people here at CCC are like family to me, especially my bosses. And yeah, they help me out with my recovery.
CCC has all the resources, the tools to get your life back in order. My name is Ralph Fakoko Tase. I was born and raised in Samoa. I didn't really think about recovery because I try to get clean on my own. When you're talking to yourself, when you're trying to do it by yourself and you're trying to do it alone, it never works. I would be nowhere where I'm at without the support and the programs that CC has. I'm talking about from Hooper to the recovery program, treatment, the medical field as well. I FaceTime my son every Saturday now. For a very long time, that wasn't an option. I value things today. There's so much value in my life. If I can do this, anybody can.
The impact CCC has is outstanding. The patients and the clients we can reach to, the things we can help provide to them, I think they come in not knowing what we can really do for them, and then when we're able to show them that, I think they're just beyond grateful. Our care teams provide a lot. A patient can come in and just as simple as just have a checkup, but if a patient comes in that's homeless, they need more medications because theirs got stolen or their IDs have been stolen. We definitely go above and beyond and go out of our way to try to find them the resources that they need.
We're each a piece of this puzzle. We're all equal and we all have a place. When we're all in this together, we create one beautiful CCC picture.
Thank you, CCC, for all the advantages that you guys gave me and helped me out. I got integrity in my work just because of that.
Thank you, Central City Concern, and all the mentors that helped me along my way to become a better person.
Thank you to Central City Concern.
Fatai Lava CCC.
Hi, I'm Jason Renaud with the Oregon Housing Conference, and now we're speaking with Gail Holland, reporter with the Los Angeles Times. How are you doing today, Gail?
Very good, thank you.
Thanks for coming and speaking with us about what you've seen on the streets of Los Angeles. So COVID gets started in China in February, and when do you see the first signs of it in Los Angeles?
Well, we had one of the first cases in February. Not among the homeless people, of course, a traveler.
And consciousness about homelessness starts to get into the public health system and to people who advocate for the homeless fairly soon?
Yes.
What did you see as the first steps that were taken?
One of the first steps that was taken was trailers were brought in for isolation and quarantine. And this I think would be step 2. There was street testing, and it began in Skid Row and Venice, which are two of the largest homeless populations in Los Angeles, but they're also relatively centralized. So the testing people would come for the testing theoretically. But actually in Venice, I understood that the homeless people were not interested in being tested. In Skid Row, they were more interested, but not necessarily with the initial city effort to test because there was a police presence.
I see. So the people felt that they might have some jeopardy if they got tested.
Well, I think they didn't want to be arrested. And, many people in those two, the homeless people who are live in those two parts of Los Angeles tend to have had brushes with the police because there's been very aggressive police action over time.
Gail, you're speaking to people who are all over the country. Could you just spend a moment telling us about the scale of homelessness in Los Angeles? We've all heard a little bit, but tell us from your perspective.
Right. Well, there's 66,000 homeless people in LA County, and 70% of them or more, it vacillates every count, live outside. So it's a very visible problem as opposed to, there's 10 million people in LA County. So 66,000 is terrible, awful, obviously, but proportionately, it may not be, I know it's not per capita the largest population, but it's probably the most visible. And there are concentrations in different parts of LA that are pretty well known, i.e. Skid Row, Hollywood, and Venice Beach. And of course, Venice Beach is the #1 tourist draw in Los Angeles. So a lot of people have seen the homeless people there. And Hollywood, same thing. So the consternation has always been the visibility of the homeless as opposed to the numbers, I'd say, really. And the other problem being that the living outdoors is very bad for people's health in general. And I wanted to throw this in there because a lot of people don't know this. Every year, people die of the cold and the heat in Los Angeles who are living on the street. Because I think a lot of people, you hear in the general public, well, the reason LA has so many homeless people is because there is no threat from weather. Well, there's a double threat from the weather. So the fear, of course, was that it was going to be a tremendous problem with all the people outside. But at least to date, the belief is that that is not the case. And there's been a lot of interesting studies that pertain to it and exploration by public health experts as to why that has not happened, which I could go into if you're interested.
Yeah, well, it's in general that there's a better social distancing when people are away from each other.
Yeah, and just outdoors, just the ventilation. And I think that's been, everybody agrees on that. Something that was originally thought to be very speculative, but they're now leaning towards, or at least they're looking into it, is the idea that people who have had a lot of other coronaviruses may have retained some kind of resistance. And they're thinking that's why daycare centers are not having outbreaks, because the kids, and that was something that was brought up to me early on when I did a story about are the homeless people actually going to dodge the heavy hit that had been anticipated? And then, of course, there's all kinds of, as I'm sure everybody at this conference knows, there's all kinds of problems with really relying on the data. And the excess mortality rates are way up. But the latest thing I saw is that they don't think that's COVID related. They think it's probably more related to just an overall lack of people seeking or receiving healthcare. But certainly in Los Angeles, probably, at least compared to other people, I don't know if it's ideal, there's a lot of street medicine and street emergency teams out there with testing, with PPE, with food. So
it sounds like resources got to the street pretty quickly.
Yes, I think they did. And because they already, I mean, the Los Angeles homeless situation was already considered such a crisis. There was already extra money for homelessness that hadn't been available coming in from the state because we got a new governor who made it more of a priority. Gavin Newsom, the former mayor of San Francisco. So his closeness to the issue was greater. He'd been dealing with it for a long time as mayor. So, and then Los Angeles has innovated. And one of the programs, Housing for Health, is they redirected health dollars directly to housing for homeless people. And they also had a system of shelter inspectors. So they already had that going. So they were able to go in, and I think decompression is a word that's used nationally, correct, for shelters? Okay, anyway, so go into the shelters. They already knew who was in there and what the conditions were, and they were able to very quickly institute the social distancing, cleaning, hygiene checks, temperature checks, and all this, some of which, of course, have now proven to be, I don't know if you'd call them overkill, but I think temperature checks are not seen as valuable as they were at one point. And even the deep cleaning is not seen as valuable. And I know that one of the things that impressed me at a shelter I went to recently was that they had the plexiglass dividing all the dining tables. And then I read that after the plexiglass went up for I believe it was the vice presidential or presidential debate, that they've now decided the plexiglass is pointless. So there's a lot of wheel spinning, but as we all know, we're all doing that.
Sure.
None of us really know.
Every grocery store in America is sold out of bleach and antiseptic hand cleaner for a few.
Right.
Yeah. And now we're seeing that I'm trying to get rid of all the bleach that I acquired. So it sounds like there was a process of addressing homelessness in a serious way in Los Angeles in multiple communities long before this pandemic hit you.
Yes. I mean, there was an effort. I don't think anybody is happy with the results. I mean, the 66,000 was a 13% rise from the year before. And the efforts, these more innovative efforts they're very celebrated in Washington, have been going on for years. They're also, I mean, the voters, approved a relatively massive more than $1 billion of supportive housing construction, and that largely has not come online. But the point is, there have been a lot of efforts, and the results are not what had been hoped.
Let me ask about people who are homeless who have untreated mental illness and untreated addiction. How are those really difficult to serve communities faring at this point?
Well, as far as, LA also later, not in the beginning, did a program, which I'm sure other people did too, called Project Room Key, that was a hotel program. And in the beginning, the city and county are pretty much on a housing first, harm reduction footing. So in the beginning, they had no segregation, but they quickly realized that they did have to come up with something. So in some cases, though, they have already existing shelters that have 24-hour mental health staff. They have mental health housing that they were able to place some people. And it wasn't just mental health and substance abuse. There was all kinds of quote unquote high acuity medical problems for the people they were bringing inside. So they just set aside beds in some of the hotels. And in one case, they set up an entire hotel. And as far as in isolation, again, because the numbers were not that great, they never actually filled all the quarantine and isolation spaces that they originally had set aside, which were in trailers and hotels. And so
off the top of your head, do you know some of the numbers of Project Room Key, the number of rooms that were leased?
Well, there were over 4,000, and they believe that 5,780 people, because I just looked at this, went through the program. And they're making they haven't closed all of them. They are slowly closing them. I know that they want to put them in housing, obviously, and they have a plan in California. They have more funding for something called Project Home Key. There was a tremendous rapid rehousing effort. I don't have the numbers on it though. But so that's part of it. But they are also putting people in shelters. And I know one of the biggest shelters opened a warehouse just for some of the people from Project Room Key.
Did you see mental health or addiction health services close or shutter their doors for some duration of time?
No.
They were able to stay open throughout?
Not that I know of.
Okay, great. Let me ask.
But I want to add that that's not something I particularly covered. I know they also set up one hotel just for domestic violence, and that was 100 rooms. So also at the same time that the homeless efforts were going on, Los Angeles has correspondingly in pretty much in startup mode, diversion and reentry programs. And those continued. So some of those were obviously had capacity for and are handling substance abuse and mental illness, because that's a large part of our prison population, or our jail population anyway, but our prison population as well. So
complicated by the criminality as well as the mental illness and addiction. Tell me a little bit, you use this word billions, which is unique to Los Angeles in American cities' approach to homelessness. Tell me a little bit about the money that's involved here.
Well, I don't really have a handle on the money. We're still trying to figure it out. But we got hundreds of millions all these different programs had different funding sources. We had hundreds of millions of dollars before it happened, in addition to what we had originally had, which was about $200 million a year. And that's for the LA. LA has this weird thing of one of their continuums of care is called LA City and County. But then there are other continuums of care within the county that are separate for others. So the CARES money, they say that they dedicated more CARES money to homeless than most people did. But that, I think, is really unclear what they actually spent and what they spent it on. But just to go back to the hotels for a second, they graduated from Project Room Key to Project Home Key. And they have done one very specific thing they did is the city of Los Angeles is buying, now I'm forgetting the exact numbers, I wrote it down here. They're buying like 100. I'm sorry, I'm not going to be able to pull it right out here, but they're spending up to 100. It's around 100 million that they're spending to buy 10 motels that are going to house 536 people. And they're going to buy the motels and convert them into efficiencies. So that's one thing they're doing. They're also talking about pallet huts or whatever. And I believe you have those in Oregon, correct? And I don't know they haven't opened them yet. So that's something coming from, well, just politically, the city council president, who's very important in Los Angeles, was more of a supporter of the whole permanent housing, and he had a majority. And the new city council president is a lot more has more interest than he had anyway in more temporary housing solutions and getting people off faster. And the feeling is they had their chance because we've had this bond money that was the voters approved that was $1 billion for 4 years. And people are getting very impatient about that. And of course, exacerbating that is that there was a moratorium on outdoor camp sweeps. So the visibility has only gone up during COVID. Yeah. Whether the numbers have gone up or not, we don't know.
Were you able to maintain that moratorium on sweeps?
Yeah, but they're lifting it. They actually partially lifted it earlier. The county is largely not doing sweeps, but there was formation of mega camps. There was one camp right on the border. Excuse me, I'm going to have to cough. There was one camp right on the border of Santa Monica that was along a golf course that was more than 100 people. And there were fires, and the neighbors felt extremely impinged upon by the camp. Mm-hmm. And so they broke that up. There was another 100-person camp in Pacoima, which is a poor, historically Black, but now Latino neighborhood. And they actually got all of them into rapid rehousing. They actually did an experiment of housing them together because they were a displaced Black community that had ended up being pushed around this town of this suburb of Pacoima, but were staying together. So, excuse me, they're experimenting on that with how successful it is if you're able to keep a street community together, which is not something that LA has done too much. So they did break up some massive camps that had problems. They moved camps with the fires that California has experienced. They've moved camps that were out of the hillsides, of which there are many. Because Los Angeles County, most people probably know this, is really vast and has a huge canyon system. Like there are canyons everywhere that, leading out of the central city, there are many, many canyons and many old camps, 30-year camps. Obviously, it's not the same people.
But the camps have sort of a culture and a way of dealing with neighbors?
To move into the canyons?
Well, I'm just asking that if you break these up, you're also breaking up a community.
Yeah, in some cases. But again, they've made an effort to move them all to similar places, or in the case of Pacoima, they literally moved them to the same hotel. And that one has, I don't believe, the outcome of those people where they were able to place them. But basically, permanent housing placement has not really gotten that much better. Obviously, they're placing people all the time, but.
Let me ask some questions about reporting on homelessness. That's your beat. And also the politics of homelessness in Los Angeles, because this is super complicated and difficult for us to understand. the Los Angeles Times, you have a full-time homelessness reporter, you, and how did you get here and did you select this beat?
No, I didn't. I had been writing a column, and I proposed writing about the 1%. And my editor said he had noticed, because he was a biker, a bike rider, a cyclist, not a motorcyclist. And he had noticed the buildup along the bike paths and the canyons and everything. And so he said, why don't you do this? But I have really, really liked it. And I think it's really important. But one problem I had, if you're asking about me as a reporter, is I do have both the age and the health condition vulnerability. So I largely quit going out and discovered that that's the part I like about it. I like meeting the people, and I also really prefer getting my ideas from the ground up and not the city or county down.
And now that it's all telephone, and how are you doing in collecting your story?
Well, that's the whole problem. I haven't been doing street reporting, but we have other reporters doing it. Mm-hmm. So I've been editing. I mean, a lot of us our organization has been over backwards to help those who are vulnerable, and just everyone, because if you're not medically vulnerable, you have kids in your home, or you have parents that you're helping to take care of. So they've been over backwards to try to help us not be at risk.
That's great.
But I actually now regret, I wish that when our numbers were down, because the homeless people, I just don't feel they're a big risk.
So talk to me a little bit about the politics of homelessness in Los Angeles. This is a big issue every day down at City Hall.
And in the county. This is the number one issue, partly because we have probably the most liberal city council and county board of supervisors that LA has ever had. Mm-hmm. There's the representation by conservatives is pretty low. So, but it's also the magnitude of the problem has pushed it to the front. And I think for at least 2 years running, everybody's agreed it's the number one issue. And it went from being not an issue at all, like in polling, like not even on the top 10, to being number one. So that explains partly why the state started giving us money and everybody decided the status quo was not adequate. We had propositions that passed overwhelmingly to fund, one is a sales tax, one is a bond measure, to fund $1.2 billion of supportive housing, with the services being funded by the sales tax. There was a strong push towards housing first and harm reduction, which had been resisted. And at least officially, there was a turning away from a law enforcement approach, but that seems to yo-yo back and forth. Mm-hmm. And so, as I mentioned earlier, the politics are complicated because there's also a tremendous problem of people living in substandard, overcrowded conditions. And there is a racial element to the politics because I believe that the Black proportion, the proportion of people experiencing homelessness in LA City anyway, and county, I think, who are Black is usually between 30 and 35%. And the Latino portion is growing, but a lot of the overcrowded substandard housing falls on Latino people. And there is a move now to help those people. And so they're not officially the homeless people that HUD counts. They're the people in garages and other substandard things. So the city council is moving some of the money that under the old regime might have gone to the HUD defined homeless people, to those people, and to the children who the school district, of course, defines as homeless. So that's part of the politics. And I think that another unique thing that's going on here is, I think we all know here on the West Coast about the Ninth Circuit decision that says you can't remove people, or you shouldn't remove people from camps unless you have a shelter to put them into, which obviously the COVID gave another reason to follow that precept, because the outbreaks that we have had have been in shelters, the largest shelters. But then there was separately a downtown business group filed suit about the street homeless problem, basically. They had various causes of action. And the judge has become very activist on this. And one of his edicts is to remove everybody who is all the camps that are near or under freeway overpasses. And I'd say status quo homeless service community thinks this is a big mistake, among other things, because they struggled for a long time to prioritize and have invested lots of money. And this, of course, came from the federal government in identifying the most vulnerable and prioritizing them for homelessness. And the people under the freeways tend not to be those people. And there's also the question of, like I said, there's a handful of hypo and hyper. So in other words, dying from the cold and the heat every year now. And the freeway overpasses are the only protection from that in Los Angeles. And it does rain here, and it does get cold at night, and it does get very, very hot in the summer. So there's a real push-pull going on, and people are trying, the status quo homeless service industry is trying to come up with plans to accommodate both the judge's desires and their own priorities. And that's a big part of the politics, because in this fight in court, the city and county fell out with each other. And before, they had been pretty unified in what they wanted to do.
So with all these money and all this political willpower and all this interest on the part of the people, do you see the numbers going down for people who are unsheltered and homeless in Los Angeles anytime soon?
No, because the housing is not coming online. I mean, but every year they tell us this is the year where you're going to see the impact of the housing. I think there's been a lot of false starts. I mean, this buying of the motels, they first brought that up years ago. Safe parking years ago. Everything was introduced 4 to 5 years ago. And again, it's not been done in any scale. And for example, safe camping, the only person doing safe camping is the Veteran Administration. And they have a really lovely 487-acre campus.
That's about the right size.
Excuse me, that has been fought over for decades. And because they had buildings on there, it was dedicated as a soldier's home, but they let the buildings go to pot and nobody really lived there anymore, very small programs. And there was a lawsuit, and now they have a plan, but again, it's moving at a glacial to build 1,500, like a 1,500 unit village with all kinds of state of the art, like job programs and recreation and all of this. And so that's underway. But meantime, the VA got, again, a change of leadership, and they opened a 50-person safe camping site. And apparently it's incredibly successful. But there's in moving people through, because the city has opened a lot of shelters, but they're not moving people anywhere with them. They're either staying there or they're back in the street. But the city and county looked into the VA program and found that the services that they feel are creating that success are services that only the VA can fund, because they've got them right there on campus, all the clinical services. And for the city or county to replicate this would be too expensive.
Yeah, I have not actually heard a new idea about solving homelessness in a dozen years. So we do hear the idea of recycling problem, and it does seem that the people who are winning this are the property developers. So,
the property developers?
As they're building all this housing.
Oh, you mean they're the ones who are profiting?
No.
It's not. Well, yeah, I mean, the sad thing, and I don't know if everybody says this, but I don't know how many times privately those of us who care about, not service providers, they're too careful, but reporters have said, well, maybe we could get another recession and the rents would go down. While there's still money, huh?
Or an earthquake.
Right.
Well, Gail, it's been very nice talking to you. Congratulations on all your reportage. I hope you're able to get back out there on the streets real soon.
Thank you so much. I hope I can too.
Hi, I'm Dan Field, Executive Director of Community Health and External Affairs at Kaiser Permanente Northwest.
Hola, I'm Rocio Acosta, and I'm a bilingual engagement specialist with Kaiser Permanente.
Hello, I'm Tracy Dan Grace, Director of Community Health at Kaiser Permanente.
Hi, I'm Aaron Waters, and I'm an Equity, Inclusion, and Diversity Consultant for Kaiser Permanente.
Hello there, I'm Ron Scholes, and I manage the Northwest Employee Community Engagement Initiatives.
We're sorry we can't be together in person.
But we applaud you in your efforts in working in innovative ways to serve our community members in need of vital services.
Congratulations on your accomplishments.
And thank you for all you're doing to support our most vulnerable community members in this unprecedented time.
We miss being able to gather together
and celebrate the great work you're doing in the communities where we live, work, learn, and play.
But we are navigating these uncertain times together.
And together we will become better equipped for a new normal.
We are resilient.
We will persevere.
And we will once again thrive.
Yes.
Nearly 1 in 5 U.S. adults currently lives with a diagnosable mental health condition. Yet the dominant treatment model is still one size fits all, focusing mostly on people's symptoms rather than their needs, goals, and dreams. We believe everyone deserves to participate in the community without stigma or fear, to have a safe place to live, hold steady employment, and to build lasting friendships. We're here to create a new narrative for mental health, to move away from treating mental health conditions as problems that need fixing and toward a model that embraces what you want out of life. We are New Narrative. Originally founded as Lukedorf, New Narrative has been serving the Portland metro area for over 40 years. Our first site opened with the guiding thought that hope, compassion, and community were the key to mental wellness. We have since grown from a single site to an agency made up of outpatient clinics, residential treatment, peer programs, a transitional age youth program, supportive, transitional, and independent housing, homeless outreach, and housing navigation. We still believe that hope, compassion, and community are the keys to mental wellness, but we also know there are many ways to get there. We believe achieving meaningful impact requires us to think differently, see differently, and work differently. We are intentionally working to change a system that identifies people by their diagnosis into a system that values the person. A system that understands a diagnosis is something a person experiences, but isn't who they are. We're here to change the narrative on mental health services, to retire the term mental illness and focus on mental wellness, to stop containing and start embracing, to ensure that people seeking services can find a safe place to live, hold steady employment, and build lasting relationships. We believe the health of a community comes from the visibility of its people. We all deserve to be heard, seen, and recognized. It's your story. Live it your way.
Imagine being homeless with children. Tragically, this is reality for thousands of families. Over 47,000 men, women, and children are homeless in Los Angeles County on any given night. The Midnight Missions Homelight Family Living Program has been providing a safe place for homeless families in crisis since it opened in 1994. Homelight's 11 apartment units are fully furnished with everything a family may need as they recover from the trauma of domestic violence, human trafficking, addiction, and other unthinkable circumstances. In the safe and secure environment we provide, families can work through their pain, gain employment, save money, and rebuild their lives.
You know, when you come into Homelight, you actually know there's people here who care about your well-being. And so that's like a relief. If you're not just another check or another number, you're an actual person, an actual family.
And I remember walking into that door and they're telling me, this is going to be your place. We thought we were going to have to share. No, this is going to be your place.
Homelight Family Living offers job training and placement, education and tutoring, counseling, child care assistance, life skills classes, as well as social and recreational activities to break the cycle of abuse and poverty and create a foundation for independent, successful living.
It taught me to save money. It taught me how to budget. I mean, I've learned so much from being here that I still carry with me and probably will for the rest of my life.
Very thankful, and especially to give me back my family that I thought I was gonna have to give up.
All the women, we all participate. So we're all united in this group.
Homelight Family Living needs your help to continue providing hope to those who need it more now than ever. Please get involved today. Visit midnightmission.org or text STOP-DV to 41444 to give. This is the day to change a life.
Hi, everybody. I'm Mike Arnold, President and CEO of the Midnight Mission, coming to you from the epicenter of homelessness in America, Skid Row, Los Angeles, California. Today, I want to talk a little bit about homelessness, COVID-19 in the city of Los Angeles, because I think we have unique problems, unique scale, and maybe not so unique a political environment that makes it extremely challenging from a variety of different fronts. But I want to share with you how we got going, what happened, what we experienced, and hopefully we'll leave on a good note, and our experiences here can help all of you going forward. So let me talk a little bit about me. My background is I was in public accounting, worked for large firms, the Big 8, now the Big 4, for a long time before I went into private industry, worked for nonprofits, universities, academic medical centers, hospitals, and research institutes providing strategic, financial, and general management services. I was also a CFO, a COO, and a CEO. So I got a lot of experience before I got involved as a consultant with the Los Angeles Homeless Services Authority here in Los Angeles. And it opened my eyes. It helped me to understand how complicated, how complex, and how challenging homelessness is as a problem to try and solve virtually anywhere in the United States, not to mention a large, sprawling, bureaucratic place like Los Angeles. So that's a little bit about me. I'm going to share my screen, and we are going to talk a little bit about my organization, and then we're going to go on a little tour. So again, my talk today, Homelessness, COVID in Los Angeles, a provider's perspective. I want to share a little bit about my organization, and I'll let someone, a good friend of our organizations, do that for me.
Hello, I'm Tim Allen, and this is the Midnight Mission, an organization that for 100 years has led the way in helping people change their lives. Tom Littlecote, father of the poor, opened the doors of the Midnight Mission in 1914. It was a refuge for the men of Skid Row. Today, it continues its tradition by providing food, clothing, and shelter to the homeless community of Los Angeles. The Midnight Mission and its volunteers not only helps support the community, but also offers a way out of poverty, drug addiction, and alcohol dependency by creating a path back to a life of self-sufficiency. The Midnight Mission operates without reliance on government funding, providing all their needed services with private donations. It offers a compassionate bridge to productive lives by providing job training, education, work programs, and most of all, family housing for the neediest among us, the women and children of LA. This is the day to write down the number and website address on your screen and do your part to make life better for our neighbors. Thanks.
So just a quick little editorial. So that was created back in 2014 for our 100th year anniversary. And since that date, we have actually built very strong public-private partnerships on public funding for particularly crisis and bridge shelter beds. And it's allowed us to expand our capacity to serve more people. And it also has allowed us to really create a public-private partnership that creates a really rich service environment for people who are in our programs. As most of you know, emergency shelter and bridge housing funding doesn't support things like a school, a teacher, a computer academy, career counseling and training, job work, search, and so on. And our public-private partnership allows us to use our philanthropy to do all the things that government won't pay for, and provide people with an incredibly rich program to get their lives back together. So I'm Mike Arnold, and I approve that message. Ha, just kidding. We're all sick of that, right? So let's talk a little bit about the scope and the scale. The scope of homelessness in Los Angeles is mind-boggling. So with the results of the 2020 Los Angeles County homeless count, we had 66,436. And, you know, I know for an estimate, it looks pretty precise. You know, if you're an accountant, you kind of joke about that. The reality is that Los Angeles takes homeless counting extremely seriously. And every year, a count is overseen by the Los Angeles Homeless Services Authority. And anywhere between 7,500 and 8,500 volunteers go out and literally canvass every census tract in Los Angeles County. It is a visual enumeration consistent with HUD guidelines, but that means you've got to be out there to see it. So we do a great job here. Kudos to the Los Angeles Homeless Services Authority and the hard work that goes into that. And it's a huge, huge number. Just to put it into perspective, if we look at Dodger Stadium, you woohoo, Dodgers, World Series leaders or World Series winners, had to throw that in there. But anyway, Dodger Stadium, 56,000 people fit in it. We would have another 10,500 people standing in the field of the stadium after filling it with the number of people experiencing homelessness. To put it into perspective for you guys up in Oregon, we could take Springfield, and if we added 4,000 more people, we would have our homeless count. Corvallis plus 5,000, Tigard plus 10,000, and Albany plus 11,000. In fact, the Los Angeles homeless population would be the 9th largest city in the state of Oregon. How's that for perspective? So with large numbers comes big problems. Needless to say, we have concentrations that are not seen anywhere else in the country. Now, I'm sure some of you have areas where you've got a little bit of space where your sidewalks might look like this, and it might look like this for a short period of time. Here in Los Angeles, we have large swaths of ground that look like this for a long time. So we've got a problem that is becoming increasingly visible, and along with the visibility, the good news is that it's getting attention. Homelessness here in Los Angeles City and County is the number one item that the residents of the county and the city want addressed. So there's tremendous pressure on our policymakers to do something, and people are willing to put their pocketbook where their mouth is. We've had 2 ballot initiatives that have brought significant funding to trying to solve the problem of homelessness. Now, the best way to sort of see what goes on here is to take you on a little drive around the block. So I'm going to take you on a drive in my neighborhood. If I can get this to work, there we go. So I'm pulling up to the Midnight Mission. We're actually on the other side of the street, but this is what Skid Row looks like on a typical morning. You'll see the tents, you'll see people packed up, lined up in front of service providers. But I think the important thing is to see just the concentration and how close people are to each other, living to each other here on these streets. I'm going to give you some, before I forget, the good news that you'll see in some of this is that there is a lot of permanent supportive housing in the community. There's lots of permanent supportive housing being built in the community, but we are so far behind in those resources that while it's good news, it's not good enough. We still are going to have a huge problem for a long period of time until we can get housing to scale. So I'm going to give you some statistics on homelessness, sort of homelessness at a glance, while you take a look at this community we call Skid Row. And I should point out that this is kind of Skid Row light, because a lot of the folks, this is the first 15 days of the month. This was filmed on the 7th. And what you see, and you probably see it in your neighborhood, is that when people get their welfare checks, they get their Social Security checks, they get their pension checks, while not enough to afford a place to live, it does afford people a chance to get off the streets for a couple of days. So the tents will go down, it'll lighten up a little bit, and then they'll come back once their money runs out in 7, 10, 12 days. So homelessness at a glance in Los Angeles. So our homeless count increased 12.7% overall from 2019 to 2020. We went from 58.9 to 66.4 thousand people. Family homelessness arose an astounding 45.7% from 8.8 thousand family members to 12.8 thousand family members. Youth not wanting to be left out rose 19% from 2019 to 2020, from 3.9 thousand youth on our streets to 4.7 thousand youth on our streets. And as you all know, youth are particularly difficult to count because they are very, very good at hiding. They also have different hours than you typically would have within an adult population. But what is probably most astounding and most alarming is that our chronic homeless population rose 54%. It rose from 16,528 people to 25,460 people. So literally 1 out of every 3 people experiencing homelessness in Los Angeles is now chronic. And as you all know, when people become chronically homeless, they become incredibly difficult to house, to service, and to keep housed. They become our most expensive solution. What you're seeing in Skid Row, and I mean, look at these streets. I mean, this is a major east-west thoroughfare there that is just lined with tents. I fondly refer to our tents as Los Angeles affordable housing because it's about the only thing that folks on low income can afford. Sad but true. But what you're looking at is an historical policy on containment. LA City and County many years ago decided that the best way to deal with homelessness was to create a little section in a industrial area, set up services. It was around where the missions were, so there'd be shelter beds, and then everybody in the county was dropped off in Skid Row. And we all know what happens when you sever connections. So it's a failed policy, and it's incredibly difficult to ever undo this terrible policy. It's also the sign of decades of ignoring the problem and underfunding solutions. When I started at LAHSA, it had an annual budget of about $70 million. For roughly the same amount of homeless people as New York had with a $1.5 billion budget. It's also, I think, these current numbers are a sign of the shiny new thing syndrome where we chase quick fixes. And what I really mean by that is we lost focus on every component a continuum needs to make sure that people, wherever they are in that continuum, are able to access services. Because we focused, and I think we're like many of you, and that there's nothing wrong with a focus, but it has to be balanced on permanent supportive housing. And in doing so, I think the unintended consequences is that services that could help people quickly get back on their feet and back into housing were cut back or not funded. And those people were allowed to become damaged and develop into chronically homeless over time, which just accelerates the cost and accelerates the magnitude of problems of getting out of it. So that's kind of my soapbox aspect of this, but I think it really does point out we need to make sure that our approach to homelessness is balanced. We need to make sure that our approach to housing is balanced. And since this is a housing conference, I do need to say that the other thing that that little tour just showed you is how unhealthy a neighborhood is when you concentrate poverty. Now, this should be nothing new to any of us. But having said that, building housing, building healthy neighborhoods means we have mixed income housing everywhere. We should not concentrate poverty because you end up with a situation like we have here in Los Angeles. So I encourage all of you, if you're working with your cities, your counties, your states on developing housing policy, really focus on mixed income, mixed use properties and housing opportunities so that we build healthy neighborhoods throughout our respective cities. So where were we back in February when all of this sort of started rolling toward us? So as I mentioned, Skid Row is high concentration. We've got at least 4 rescue missions. You know, these are organizations that we know of and they pop up and pop down quite a bit. We all have congregate living programs, which is cause for particular alarm when you're talking about respiratory virus. We've got a multitude of other providers here that include social service, mental health, physical health, permanent supportive housing, and a lot of single room occupancy hotels that have been converted to permanent housing that have shared bathrooms, shared community rooms, and shared kitchens. So just a lot of exposure relative to contagion when you're dealing with a respiratory virus. In addition to that, we've got around 3,500 people who are living on the streets, and you saw the compression. And when you have people living that close who are particularly vulnerable, you get very concerned. Many of us also have large feeding programs where people come inside, they sit elbow to elbow in large dining rooms and eat. We serve over 1 million meals a year here at the Midnight Mission for our residents and for the community at large. And that includes low-income folks, it includes seniors, it includes a lot of the folks you saw on the street. They come to us to eat in these kinds of spaces. As you also noticed, there's limited hygiene capacity. Now, you may have noticed there's some porta potties, there's some portable stations. All those came after this became a big issue, and I'll talk about the real catalyst for that when we get toward the ending. But there's just a lack of hygiene facilities overall, and in fact, the Midnight Mission was the only facility that provided 24-hour access to bathrooms, including showers, 24/7 here in Skid Row up until July 1st of this year, 2020. The other issue that we have affecting us is this concept of community involvement. With this kind of concentration, people are always coming down and they're unloading van loads of food items, clothing, and oftentimes a lot of that just ends up being left on the streets. One thing we can say about Skid Row, no one goes hungry. So when people come down here, there are lots of places in LA County that have food insecurity. Skid Row is not one of them. But oftentimes people will come down, good hearts, good intentions, but it ends up contributing to the health hazard that Skid Row has become. Now, when COVID started rearing its head and we were all watching with some degree of anxiety as COVID was being identified in Italy, we started seeing New York experience cases. It sort of felt like, to me, we were watching a slow motion train wreck. We did not see a lot of activity at the federal level, at the state level, at the local level. We just did not see a response. And then when the responses started coming, they seemed kind of uneven. There was contradictory messages that was going on. And I think that all points to just, we were not prepared at all levels. I mean, just not prepared. And I hope a big lesson that comes out of this horrible, horrible time that we're living through is we need to all be prepared and take it from the macro level at the federal level to the micro level here within our own individual organizations. We all know enough to prepare for something like an earthquake. But having said that, none of us at any level was prepared for what has hit us and caused this amount of chaos and turmoil. So there was a lack of personal protective equipment, there was inconsistent messaging, and we didn't know really who was doing what. There was confusion over who was doing what and how it was getting done. And there was really slow adoption of any kind of public safety measures. So it was chaotic and it was disorganized, and there was not a consistent message. We sort of got here in Skid Row, we have a providers collaborative that shares information, and we had a new CEO that was just selected for one of our agencies, Amy Turk. She's the new CEO at the Downtown Women's Center, a wonderful organization that has focused on homelessness and women for a long time. And she sent out a memo that she was sending out to her staff that talked about, if we go into a lockdown, here's what to expect. And it was a huge wake-up call for all of us, because it talked about not being able to drive. It talked about being locked down in our facility. It talked about things that frankly, I hadn't considered. And it was it just rolled over you like a cold wave. But it was that catalyst that I think accelerated all of us to do the old proverbial OMG moment. We need to wake up, and we all kicked into motion. Now, the unfortunate thing is we all kind of had to kick into motion in our own organizations and figure out what was going on. But here are the things that we did, and I think they really helped us, and I'll talk about our outcomes in a minute. So the first thing that we did here, and this may be because I've got a healthcare background, I understand infection control, we immediately set up a daily meeting. We call it the wellness team. We meet every morning. We still do. We started this back in March. We still meet every morning, and we know about COVID and about risk that we see in our organizations, and use it as a tool to roll out policies, to develop policies, to talk through issues. And it's been incredibly valuable for my team and myself to get organized. So first thing we did is we started on the ground floor of our building and said, all right, so we have a viral agent out there. It appears to be respiratory. How is it going to get in? How is it going to infect people in our organization, be they participants, be they staff? So we rolled out strong, literally clinical infection control mechanisms. The janitorial staff was beefed up, and they started disinfecting hard surfaces every 2 hours, whether it needed it or not. We started people wearing masks early on. We closed down a huge volunteer program. We have a volunteer program where about 18,000 volunteer encounters happen here every day. And again, it was part of our meal service program. And a lot of the kitchen work was done by volunteers who'd come in and spend breakfast, lunch, or dinner and help us both prepare and serve food. All of that got shut down. We immediately transitioned our indoor feeding program to an outdoor to-go program. We literally adopted healthcare standards for infection control. We identified all workers who could work off-site and from home. We equipped them and we sent them home to work. And again, our philosophy was, if COVID comes to our facility, it's probably not going to come from the people we serve. It's going to come from people who are coming from somewhere. Certainly none of our folks had been to the Swiss Alps skiing, or to Italy, or to any of these hot spots in the near term. So we knew that the goal was to keep it out. So we focus all of our activities around creating a safe and sane and sanitary environment, and also restricting internal access. Visitors could not come visit anymore. Anybody who was an outside worker had to come in and be screened. We restricted access out of the facility for essential needs, which meant that we created all of these residential enrichment programs for the folks that were stuck in the building. We turned our gymnasium into a movie theater. We got a big popcorn popper, and from about 1 o'clock in the afternoon till 5 o'clock at night, it is a movie theater that's designed to show as many movies and keep people as occupied as we can, to keep them in the facility and not out, potentially exposing themselves and then bringing it back to our organization. As most of you have done, we've instituted daily health checks. We were an early adapter of masks, and we put up a lot of signage, education, videos on infection control, washing your hands, covering your mouth, and we enforce it. And I think that's really the key thing. I mean, I think a lot of organizations put up rules, but they're not very good at enforcing it. We have a zero tolerance policy, and people know when they see me coming down the hall that they better not have their masks off. And it's very, very seldom that I do have a conversation about the importance of keeping your mask up. The other thing, we were very fortunate. We've got a robust gift in kind program. So we had a lot of personal protective equipment on hand. We had N95 masks that were donated. We had gallons and gallons and gallons of hand sanitizers that had been donated. I had a warehouse half full of toilet paper. So the things that were critical issues elsewhere weren't really critical issues for us. And in fact, we became a supplier for a number of PPE items to street outreach workers and our collaborators in the community because they just didn't have it in sight. So all of those were things that we were just lucky. We didn't plan for it, but we were just lucky. We also changed our intake protocols so that we could isolate people before they come in the building, put them into a isolation quarantine for a period of time until we could verify that they weren't infected before we would put them in our congregate care beds. And we've got 3 dormitories, one of 49 beds, one of 150 beds, and one of 91 beds. And we also reconfigured any sleeping in those dormitories to ensure that there was at least 6 feet distancing and reduce whatever occupancy we needed to reduce to make sure that we supported that distancing. So while we were looking at how we create a safe environment, we were also looking at how we could reduce risk with specific clients. Because we know dealing with a homeless population, we are dealing with people who have a variety of conditions that make them potentially more susceptible to a serious, if not fatal outcome if infected. So we started going through HMIS and sitting down with our case managers to identify anyone who seemed to have risk factors that would make them susceptible to a serious or fatal outcome if they got the disease. And we actually started isolating internally. We had some available rooms that we turned into bedrooms. And when we identified people who had particularly vulnerable conditions, we moved them into those rooms. Now, they weren't ideal, obviously, but we did recognize that if it did get in, we wanted to make sure that its impact on our residents was minimized, especially to those who were most vulnerable. So we implemented a protective isolation policy from within. And then we reached out and worked with our medical provider in public health to see if we couldn't get testing on a more frequent basis. And I think we all struggled with this notion of testing policy based on supply. Crazy. We nationally were unprepared. As a result, there weren't enough tests out there. And as a result, the testing messaging was based on the supply of tests, not on best practices relative to infection control and disease management. But we were pushing at public health and at our healthcare provider. We have an on-site clinic that provides on-site healthcare and mental health as well as dental health. So we were pushing on that because we thought we needed to get everybody, including staff, tested every 14 days. And I have to be honest, our public health and others in the community, like most jurisdictions that you guys are coming from, we're just not prepared for the scale or scope. And as I mentioned, our scale and scope here is jaw-dropping to begin with. What we saw from a provider perspective looking out is they were really hobbled by the lack of adequate PPE. So things didn't happen very quickly because they were very concerned about protecting their staff and employees at a point in time in which we needed people on the streets. We needed people out there doing tests. We needed people screening for symptoms. And it was really challenging because they didn't have the equipment that they needed to do that. We also struggled again with that testing capacity. And as you all know, unless you had a symptom, you couldn't get tested for a while. And that's just nuts. We know that now, but it was supply-based policy. And hopefully we will have learned from that going forward. Our city and our county really didn't have that much of an infrastructure to support a pandemic of this magnitude either. They had to build up quickly. People got diverted off of one thing and had to do other things. We actually didn't see a lot of contact tracing. What I can report to you is that we were very, very fortunate. We've had 2 clients in our residential programs that tested positive, but we identified it early and they were isolated early so that there was no spread within our facility. And we had 3 staff members who contracted it outside of work, but our screening protocols caught them soon enough so that there was, again, it was caught before it came to the facility. So we are incredibly lucky. Our colleagues in the community have not been nearly so lucky. We've had one provider that has had over 150 case outbreak that included deaths within the facility. Another one has had several reasonably large outbreaks. And again, when you are in a congregate facility, you are particularly susceptible. So it's really critical. And if you run SROs, if you build SROs that have community space, that have shared bathrooms, implementing and encouraging compliance with safety protocols is absolutely critical. And then obviously, there really wasn't a very clear coordinated approach to testing equipment. And as agencies serving a particularly vulnerable population, it seemed to take a long time for our support agencies to get their act together and provide much guidance. The good news is we were pretty much ahead. I didn't suffer. I don't feel like our organization suffered much, but we had skills here that I think many organizations didn't. So, but I suspect that was not very different from what you saw within your own jurisdictions as it relates to this. How we're organized here in the Los Angeles City and County is the county is typically responsible for doing a lot of the service stuff. When it comes to homelessness, county does service theoretically, the city does housing theoretically. So the city doesn't have much services that relate to things like mental health, public health, community health, healthcare, and had to really rely on the county, and the county wasn't very prepared. So the city, to its credit, did step up and implement its own strategies. They went out and tried to procure and distribute PPE. So the city, I think we got somewhere in the neighborhood of 10,000 masks that we then used to distribute to the folks that we were serving and handing out meals to try to get folks on the street to mask up. They also rallied the fire department. So one of the things that I really applaud our city for doing is they created mobile free testing sites with the fire department, so that these mobile testing sites are kind of pop-up sites. They appear throughout Skid Row and encourage people who are living on the streets to get tested. And the testing is free. And frankly, the results that come back from the fire department testing is pretty darn quick. We get results back, although initially it took 3 or 4 days. We're now at a point where if you get tested today, you'll have your result back by lunch tomorrow. So there are some really good things that I think have happened in terms of response rates that did involve various jurisdictions that didn't have a lot of responsibility to do it. If you look at how they've traditionally been organized, that really have stepped up. The other thing that the city did, although this was compelled to do by the court system, was put out porta potties and sanitation stations where hand sanitizer and hand washing capacity was available literally throughout the county, throughout the city, wherever there was a encampment, which is pretty much everywhere at this point in time. So a lot of, you saw in the drive around Skid Row, a number of porta potties, a couple of hygiene stations, and that was really an impetus from the court system. But I think the biggest observation is the lack and undersupply of testing continues to impact our ability to have quick access to quickly identify and quickly protect our organization from folks who may be walking around with COVID. The other thing that I think is really significant to talk about is funding. So as part of the federal actions, a lot of money came to jurisdictions to address vulnerable populations. And LAHSA, who is the continuum lead, used that funding to create a program called Project Roomkey. And the goal of Project Roomkey was consistent with what we were doing, which is identify people who are most likely to have a severe or adverse outcome if they contract COVID, and get them into some form of protective isolation, get them to a safe space. And since nobody was staying in hotels, we all thought, gosh, it should be easy. We'll go rent 15,000 hotel rooms and we'll get people off the streets and into these hotel rooms so that they can be safe. Well, we achieved about 4,300 rooms that got rented. And I know Amy Perkins is talking to you all, and I think she'll share with you some of the challenges that LAHSA ran into. They are things that we see every day. Not in my hotel, not in my hotel room, kind of mentality that got in the way. But those 4,300 rooms did have about 6,000 people that came off the streets or out of congregate environments that were less safe and got them into a more safe environment. One of the things we struggled with that process was that originally the most vulnerable criteria also had an age criteria. Now, we had people who were below the age criteria who were undergoing cancer treatments and were immune system comprised. We had folks suffering from AIDS who had no immune system and were compromised. We had younger folks who had severe asthma as well as emphysema, and none of them were considered vulnerable. So we worked with our policymakers to expand that criteria so that we could have a broader segment that would be eligible for a safer space while we learned more about this disease and dealt with particularly dangerous environments in congregate facilities. The other thing that was obvious is we're a big city, we're a big bureaucracy, so things rolled out slow. It was slow to get the rooms. It was slow to get people into the rooms, and it was slow to get services to the rooms. And the service aspect, I think, is particularly challenging because as an agency, if we got someone into Project Roomkey, we had to continue to provide remote case management for that individual. So we turned into a lot of our case managers into telephone case managers so that we could give people the touches and the counseling and the coaching that they needed to stay safe and stay isolated. Where we found it most difficult, and for those of you who provide substance use disorder services, this was incredibly challenging to keep people who were new to sobriety sober when they were isolated off-site and didn't have that human contact, that personal touch that is so important when people are learning how to master tools of sobriety. So it was particularly challenging. And I think if there's something to learn about this kind of a concept is that we need to recognize, we say we do, we don't always implement that way, but different segments of our population have very, very different needs, and we need to be sensitive to those needs. And obviously the obvious one, which is there's far more need, as you saw from our streets, than we had capacity, and we continue to have that. So now Project Roomkey, as that funding sunsets, is morphed into Project Homekey. And the goal of Project Homekey is to make sure everybody who was part of Project Roomkey, including Roomkey eligible, i.e. those folks we all identified as particularly vulnerable to an adverse outcome under COVID, but didn't have a room for them to go into Roomkey, could be eligible for being triaged quickly into alternative permanent housing, which is a great goal. But we then bump up against that, 30-foot, 5-foot wide wall called insufficient housing stock. So now we've got again, to some extent, I think this might be the shiny new object issue, where now we've got people in Project Roomkey, and we've made the commitment that we're not going to send them back to a shelter or interim housing. We're going to get them into permanent housing in an environment where we don't have a lot of housing. So we've got our coordinated entry system, which has been working with chronically homeless, including vulnerable people who've been waiting for a long time for their ticket to get to the top of the heap so they can get into permanent supportive housing, being displaced by the Project Homekey program. So it's confusing. We're not quite sure how it all works. And it seems like our priorities are changing, based on, once again, the direction the wind is blowing. And we don't seem to stay focused on the long run versus the short run. But there's lots of pressures out there. I know I've been in that situation. So we'll navigate our way through it. But I do have to say that from a provider perspective, there is a lot of confusion about where people who are currently in the queue for permanent supportive housing are falling, where people who didn't get into Project Roomkey but were Project Roomkey eligible are falling, and specifically how we're going to find all of these housing opportunities for people that we know to be particularly vulnerable. So bottom line, there's a lot going on, and it will unfold, I guess, as it unfolds. So I want to overlay over this complex environment yet another dynamic, and that is the court systems. And it seems like Los Angeles is never in a situation where either the county or the city isn't in one court case or another dealing with homelessness. They're currently in one that is actually having a fairly significant impact. It was actually a group of the business community got together and said, look, the city and the county are not doing enough to deal with people experiencing homelessness, and they sued them. And they were lucky enough to get a judge who happens to have a particular interest in homelessness. Judge David Carter, he dealt with a similar lawsuit in Orange County, and he basically strong-armed the cities and county of Orange to add probably 150 to 200% more interim housing beds than they had planned on doing. And he did that in like 4 months. So he just came off of that case, and he's trying to do the same thing here in Los Angeles. But what he is finding is that dealing with 5,000 people experiencing homelessness is very different than dealing with 67,000 people experiencing homelessness. And then you've got two 800-pound gorillas. You've got the county of Los Angeles and you've got the city of Los Angeles. And they have historically challenged collaborative working relationships. That's about as politically correct as I can get. They used to hate each other. Now they don't hate each other, but they don't exactly go out to dinner together, if you know what I mean. So it makes any kind of agreement incredibly complex. The shortfalls in general funds at both the city and the county level that have been a part of the impact of COVID on our communities, it is also driving them to take positions that are not terribly attractive to the judge as he pushes. And then the other thing that I think is an overlay is that the court is now placing requirements on the city and the county that are contrary to both the coordinated entry system perspectives on housing as well as Project Home Keys perspective on housing. He's basically demanding that the city and the county find housing, shelter, or any kind of housing, but either create it or find it for anyone who is living under or near an overpass. His perspective on it seems to be that they're in particular danger, they're inhaling fumes, they're around motor vehicles, they're at risk, we need to take care of them. So there's all of these moving parts that creates a complicated, complex, and extremely challenging environment. So we will keep you informed as that moves forward. And as the judge said about the agreement, and I'll paraphrase, he said, working with the city and county of Los Angeles is like watching two billionaires having lunch at McDonald's, arguing over who was going to pay for the burgers, while the parking lot was full of starving people experiencing homelessness. So if he says that, that gives you an indication as to what the rest of us deal with a lot of the time. But there's a lot of good things going on in Los Angeles. There's a lot more money. I don't have time to talk about it. There's a big focus on housing, but also to add to the conversation about scale and the degree to which we struggle. We project that we need over 525,000 units of affordable housing now. 525,000 units of low-income and affordable housing. And that includes permanent supportive housing. So we've got a huge need. We need housing. We need better models for housing. We need lower construction costs for housing. But at the end of the day, our biggest and single most challenging obstacle to get over is we just do not have housing that people can afford and be sustainable in who are coming off our streets. So anyway, I'm sure you all have similar kinds of problems. Wish you the very, very best. Stay safe. wear your mask, and hopefully we will be able to see each other in person next year. Thanks a lot. Have a great one.
Welcome back to the Oregon Housing Conference. I'm Jason Renaud, the conference coordinator, and right now I'm with Matt Tinoco, reporter and writer in Los Angeles, and has been covering homeless issues for a few years. Matt, welcome.
Hi, Jason. Thanks for having me.
Tell us what you've been doing.
Well, I am a reporter in Los Angeles. I grew up locally. I, until very recently, worked for one of the NPR affiliate stations, Southern California Public Radio, KPCC, where I was full-time as the staff homelessness reporter, homelessness and housing, but it was largely the crisis outside. And prior to that, I've also worked as a reporter at other local and national publications, both as a staffer and as a freelancer. So I've always, for the amount of time that I've been a professional reporter, about 6 years or so, I've one of the very first stories I wrote in maybe 6 or 7 years ago were also on homelessness. So it's been a consistent thing that I've been reporting on locally.
Great. And thanks for bringing your expertise to us. We've heard a little bit about homelessness already in Los Angeles. It's so complex, it's so large, and there's so much money involved. It's really out of scale for the rest of us. How do you go about reporting on these huge geographical area? How can you possibly know what's going on?
I think the scale is actually what makes it very difficult. Just the scale of the sort of Los Angeles metropolitan region, which I'm not like, you have LA County, which is a 10 million person county, but you have Orange County, San Bernardino County, Riverside County, Ventura, and then you could maybe even throw San Diego into we're all on the same water and electric grid, right? It's the same sort of thing, which is too big comprehensively for any one individual or any one government to sort of get at, which I think the point would be is that as large as it is, though, the sort of same thing happens at a local scale. So usually what I do is I focus on a couple specific neighborhoods that I know well, and that's the best as any individual person I can do. And yeah.
And so let's dive in. COVID starts in China in January, gets to Los Angeles by the end of February. And when do you start seeing the homeless operators, shelter operators, public health officials start to talk about COVID?
It was on the sort of same timeline as, I don't want to say everybody else, because I know there's a lot of people watching this call from a lot of different places. But it was early to mid-March, the sort of second and third weeks of March, which was where the state and the county issued their stay-at-home orders earlier than I know a number of other places across the country. And that was sort of when it happened. There was, up until then, there's this new novel coronavirus, and it's quite something. Maybe we should watch out for it. But it wasn't really until the stay-at-home orders issued that I think things really changed. And by change, I mean, it basically shut off. So with regards to you had these sort of two parallel things happening at once. You had the homeless services system, and then you had the lived experience for people outside. The services system basically just slammed on its brakes. There was no more direct outreach. You had to figure out how to decompress the shelter system, because our congregate shelters, as I'm sure everybody at this point realizes, you can't social distance in a big room with 80 or 90 cots in it. One of my first pieces of reporting was actually on a winter shelter that they shut down. The winter shelters usually, there's not that many of them, but in Los Angeles County, they usually run until about mid-March. And this was one, some of them were extended because at the time that our shutdown happened, it was a very rainy March. It was an uncharacteristically rainy March. And well, the shelters are shut down because I don't think they wanted to keep open with the coronavirus pandemic occurring. But the effect was that the services system basically stopped. Like I said, there was no direct outreach. There's very few people going out to actually serve people outside. The housing placement system the brakes were applied there too, because, well, we can't even see people to place it. And it gradually sort of came back slowly in the course of the the month or two into April and May, then you began to have some housing placements. But even then, it hasn't recovered because there's still, my understanding is that there's a number of permanent supportive housing projects that like they penciled out before and were going to happen, but now they're not, it no longer pencils. So there's still sort of like some fallout even today from that initial shutdown. But then you also have the situation for people who are outside where, again, it's a rainy March. So now the work of survival living outside became that much harder because you lost access to infrastructure that you could normally rely on. Hard as it is, you can find a bathroom, like a fast food restaurant dining room. You can use a bathroom in there, and maybe it's a 24-hour restaurant, so you could shelter in place inside, which now those all of that infrastructure you can't go into the dining room at all. Another big one was we have an enormous population of people who live in their vehicles in Southern California, orders of magnitude higher than the official estimate, which is only, I believe it's like 7,000 or 8,000 for LA County, but no gyms. That was my point. The gym shut down. There's a huge number of people who
showers
rely. Yeah. And yeah, exactly. Like for that population, they rely on the gyms for showers and cleaning, and like, well, there's no gyms anymore. So you have to figure something out. Like I spoke to a fellow who was just using water bottles and showering out in back of his car that way.
Mm-hmm.
But I think that was the initial sort of shock.
So did you also see, say, ancillary services like mental health treatment or addiction health treatment withdraw?
It would be consistent. I would have to, like, each individual provider operated independently. So there would undoubtedly be some, and I know of some that continue to provide a bare minimum of like, we'll drop off a charged cell phone so we can talk over the phone this way. But there was no cohesive centralized strategy, even within LA County, its own one county. I can't speak for counties outside of LA County with regards to how their continuum of care is sort of immediately reacted. Mm-hmm. But I can't imagine it's that different. There was an overall immediate reduction of services, whatever services is defined out of in that initial sort of shutdown.
So as you're seeing the likelihood of COVID to arrive in California, was there a move to create some additional housing?
Not immediately. There was a sort of, the fear consistently was that the virus would sweep through the unsheltered population more quickly than everybody else. That did not manifest, and it actually seems that the unsheltered population, there's by proxy of being outside, have almost a lower transmission rate. I don't know if that's settled science, though, so take that with a grain of salt. But that is a theory that has been circulated. But in that immediate initial time, everybody was worried about that, and more specifically, I don't, just to jump ahead a little bit, but as Project Roomkey, at least that's the California branding of the FEMA federal, what is it called, non-congregate shelter FEMA reimbursables, where a county can reimburse the federal government for putting people up in a hotel. Mm-hmm. An explicit worry on the part of the state government was that the virus would go through the unsheltered population so quickly and send a huge number of people into the hospital, potentially overwhelming the state hospital system just with the people outside. That was a very tangible worry on the part of California state government in sort of March, April, which was one of their drivers for reacting. Like, there was no proactive, we should create shelter seeing this coming. Like in February and even early March, that was not on the discussion. Once the virus was here, and especially once we had the sort of images of New York City and everybody's holding on, is this going to happen here? Then there was a bit of urgency. And so the first immediate thing that the city of Los Angeles, distinct from the county of Los Angeles, was they started opening up the city's recreation and parks departments has a bunch of recreation centers in the parks. And the city's first immediate move was to promise opening 6,000. They were going to produce 6,000 beds in 40-something city recreation centers. unfortunately, that number, that 6,000 beds number, was it didn't happen because basically of the need to physically distance people inside. These were congregate shelters. It was cots in a room, very, very bare bones, very set up immediately. And so the result was, I don't think 40 of them ever opened. I don't know if more than 20 or so of them ever opened. But on whole, there was fewer than 1,000 beds that we were able to get out of that. And in the city of LA, and bear in mind that the city of Los Angeles's total, at least its point in time count population, is about 44,000 this year.
And what do you think that is as far as estimation, conservative, liberal? What do you think the real number is?
That's a hard one. For the county of Los Angeles, I mean, I've had just on that, like, vehicular, like, there's like define homelessness, right? Mm-hmm. So the LA County Office of Education, using a federal definition set by the Federal Education Department, the McKinney-Vento definition, estimates that there are somewhere between 60 and 70,000 homeless K through 12 students. Now, that definition, it's a massive number. Like, that's like 60, and that's so I think it was 68,000 in the last year. That definition includes people who are couch surfing or living in a motel, which the federal HUD definition, the usual like homeless count number, does not include that. So that's a differentiation. So LA County's point in time number for the entire county, of which LA City is one city in, this past year was over 66,000 people.
But once someone gets out of the homeless system, that means there's many people vying to get into that homeless system.
Yeah, and that number includes people who aren't, like, it's supposed to include people who aren't even in the system. Mm-hmm. But I do think the actual reality number is much higher than that. Especially if you include people who are in motels or like you have families that are doubled up in studio apartments. On the vehicular habitation number, I've had people in, like, nobody will say it explicitly or nobody will ever say it on the record, but like candidly, people will estimate that there are probably, like, I've heard it in several places, that there are maybe 100,000 people living in vehicles in Los Angeles County, which is like in the sort of cascade down of housing insecurity. The people who are outside on the street in the tents are the very, very bottom of like an enormous sort of funnel. So if we estimate there's 30,000 people outside on the street, you have, like, add a zero to that, that's the number of people who are like right about to be there. The number, and that's the hard thing though with all this, is that the numbers are just very, like, in any jurisdiction, the point in time count is not going to be a very reliable metric. I would advise everybody to check with your schools on the McKinney-Vento number, because I think that's a better number with regards to family, just in terms of the scale of housing insecurity. Like, the HUD point in time count follows a very strict definition. The McKinney-Vento education, whatever your county's Office of Education or whoever is the responsible agency for determining that sort, like asking each school how many students, because the schools have to keep track of this, that will give you a different number that I think is to some extent more reflective.
But to stand up a public health response such as adequate testing would take almost a military presence.
Yes, and one of the things that I think we've seen, even in because that was like the non-government response, the basically like the mutual aid volunteer response, which in the very beginning, you also had the city and county made an effort to roll out hand washing stations to their largest encampments, because the government, at least here, knows where everybody outside is for the most part. There's very detailed. I mean, there's a very proactive surveillance mechanism that keeps track of where people are outside. And so when it comes to distributing resources like a hand washing station, the government here at least knows where the largest camps are and like what needs to be done. So there were hand washing stations rolled out. They replaced hundreds of hand washing stations around the city and county. But then the immediate challenge came that they weren't even being refilled because the contractor, like, they ran out of time. There were too many of them. There were a bunch of like other issues like that. So eventually a bunch of those hand wash stations were just removed because I can't remember. I don't remember the exact reason actually on why they were removed, but they were. But the point what I was saying about like the mutual aid is that then you had other basically advocate organizations, not even like NGOs who contract with the government for the direct provision of homeless services, but the homeless advocates, coming in and stepping, like this happened at least in LA Skid Row. You had the LA Community Action Network and the Catholic workers step in and produce their own hand wash stations to serve that population there, because what the government provided was not adequate.
Toilets, tents, what other resources were made available to people who were unsheltered?
A big one was food, because you had that sort of, as dining rooms shut down, you're losing a key way that, like the McDonald's dining room is I haven't ever done this as a story, speaking it just as like a reporter, but there's a very like, or I mean, a social scientist could do this too, but in terms of understanding the role of a like fast food dining room in a poor neighborhood as like a node of social services, loosely defined social services, but like bare life services. You get food and water and you can clean yourself. And it's also some sort of shelter. But those, like I said earlier, were not present. So people, like in that first month, there was a very tangible, like people are really hungry. And food distribution was one of the immediate concerns on behalf of advocates, as well as the city, because you also had to stand up this infrastructure to do the hotel, like where we got to the hotels, you have to provide meal infrastructure there, as well as at the recreation center shelters. You had to, okay, well, how do we feed people? We're promising people food, but we need to actually figure out practically how to do that. There was the whole, like the phrase that got repeated to me everywhere was that we're building the airplane while flying it. But like very much so. And yeah, I guess now we're several months past that, but like in that immediate early time, it was one of the big problems was food. And it was quite dire for many people for like that in that initial period, in that first lockdown, everything's silent period.
Did you find anybody in the county or city who had done any disaster planning with the homeless community in mind?
That's a good question. I don't know. I know that the County Office of Emergency Management stepped in as a sort of coordinator, but I don't think there was a plan, honestly. I don't think there was certainly no like, okay, in the event of a viral pandemic, we will do X, Y, and Z to meet the needs of the people outside. That did not exist. Mm-hmm. I do know that the Office of Emergency Management did step in relatively early as a sort of coordinating agency.
So back to politics for a sec. You mentioned the county and the city. How do they get along and communicate about what to do about homelessness in Los Angeles? They have a joint office.
Oh, say again?
They have a joint office that they've created.
Yeah, that joint, it's a joint powers authority, the Los Angeles Homeless Services Los Angeles Homeless Services Authority, LHSA vernacularly, it's a JPA that was created in 1994, I believe. I think it was early 1994 or late 1993, largely as a result of litigation that had kicked off in the late 80s. Over precisely this, is whose responsibility is it to take care of people who are outside? Lots of litigation about that in the late 80s and early 90s that resulted with LHSA, which is both the city and county of Los Angeles. Those are the two government authority or government bodies that like basically fund LHSA. Although LHSA is also in charge of our local continuum of care, which means that they also are the receiver of federal block grants from HUD. There's always historically, like what I just said, you had litigation in the 1980s where the county and city are squabbling over who's going to pick up the check. Mm-hmm. I think at this point where we are, the city will say we're going to pick up the tab for like capital development and building of hard infrastructure. and the county will say, we're going to pick up the check for the direct provision of services, whatever, like the mental health, the substance abuse, the everything. And that still holds true. The local context for money, which I don't know if we mentioned it before on the recording or off, but like there is a presence of a relatively large amount of local money, which the county, what was it? It was LA County voters in early 2017 passed, it was called Measure H, which is a 1/4-cent sales tax with a 10-year sunset to fund the provision of services. That's a countywide tax. That is to provide services for everybody who's experiencing homelessness in the county of Los Angeles. A couple months before that, November of 2016, the city of Los Angeles voters passed a $1.2 billion general obligation bond to build permanent supportive housing, basically the type of housing that, like steeply subsidized housing with supportive services for those most in need. And that was that has held true kind of since, whereas the city will. But also the city, when I say the city, I'm referring to the city of Los Angeles, which is one of 88 cities in Los Angeles County. It's the biggest, like the LA city is 4 million people. It's the largest individual city, but it's also not, I hesitate to say the city, like I live and work in the city of LA and that's usually where I am. But it's one of 88 cities. So then you have all these other municipalities that like, for the most part, are more reliant on the county to provide money for both capital development and provision of services. Although those individual cities sometimes, like it varies for each individual one. For LA City though, it is they rely heavily on the county to provide service money and the $1.2 billion bond will be paid with property taxes over the next number of years for the development of permanent housing.
So,
sorry, that was a rambling answer, so go ahead.
But Los Angeles has solved one of the big problems that other cities has not, which is money to do these things.
I would hesitate to say it's solved because I think just working as a reporter, so Measure H, the countywide sales tax, is supposed to bring in about $350 million a year, which is that is a big pile of money. LA County's overall budget is like 36 billion, 33. It's in the mid $30 billion a year. So like as much money as $350 million is to you and me, it is a drop in the bucket with regard to the scale and need of the like population it is. And I think this holds true everywhere, is that unsheltered homelessness in particular, like housing insecurity is massively expensive to start with for a lot of different ways that you can demonstrate with a social science background. But in terms of like managing unsheltered homelessness, the most like visible sort of aspect, that is also it's just tremendously expensive. And it goes much more beyond just what that like homeless budget is, or that $350 million is. Like, I think the county in 2015 or so, it's now relatively out of date, but the county estimated that they spent almost $1 billion on the sort of the frequent flyers, a small subset of the basically sickest people living outside. The county estimated it was just under $1 billion. It was like $980 something million each year on just these very small subset of the population that were the most expensive. And if you're spending $1 billion on the sickest like 3,000 people outside, $350 million for a overall population that is officially 66,000 is probably more than that easily. It's just it's like something. But when local officials hold up the ballot measures that voters have passed, it is in a sense monumental to try and like that you had voters pass a tax increase on themselves to deal with the problem. But also, it's just not that much money. Like I'm sorry to say, like relative to the scale of the problem, which is where I come to, like, you need the federal government to come in and just pour billions of dollars in it, because anything short of that, like a local city, especially now, like one of those smaller 88 cities like they just, their bank accounts are already stressed, and they do not have the cash to pay for not like services, the development of any capital infrastructure, or even to just pay their like contract EMS agency to take people to the hospital at this point. Which is, I mean, that just goes back to what I said a second ago. I think you need the federal government to step in, but that's a digression. So there is, the presence of local money is a big difference from many other jurisdictions. It is not, it's nowhere near enough though. And I don't think you'll find anybody locally who works in that sort of space. Like, there is a lot of money and it could be used better, yes, but like at a zero. And I think maybe then you're getting to a better spot.
So talk a little bit about the litigation that's going on now that is trying to wrangle these issues a little bit better.
There's always been a lot of litigation about homelessness in Los Angeles City and County. What happened earlier this year is you had it's a group of property owners for the most part in downtown Los Angeles, in the Skid Row area, that filed a lawsuit against both the city and county of Los Angeles, alleging, there's a long list, there's many causes of action, but the effect is they filed the lawsuit alleging gross negligence on the part of handling mass homelessness, and asked for a federal court to intervene. They want a consent decree. They want a judicial oversight handling this. And we're not to exactly explicitly to a consent decree yet, but there is a federal court overseeing now largely how the city and county are sort of producing beds, I'll say, at this point. And even like the case was filed basically early March. It was, and it's played out very much on the similar timeline as the pandemic. Like, the first hearing was like, I believe the very first hearing was on a Thursday that I attended, but it was also the same day that our stay-at-home stay-at-home order was issued, and it was sort of like, well, you could not separate the two, the pandemic response from this court case, and we still can't. Like, it's kind of, I mean, it's gone from there, but yeah. So, and that's basically, how do I distill this? Court case, the case is entered into the jurisdiction of one in the Central District of California, and it's under the oversight of a judge, David Carter, who is very active in this space, because even in previous years, there has, like, in the past couple of years in Orange County, there was, stemming from the breakup of a large Riverside homeless encampment, there was subsequent litigation that was basically saying, sort of in context of the Boise case, I mean, not sort of, but in context of Boise, the argument was that you cannot break up this camp without providing alternative shelter for people to go to. And long story short, now, Carter is the sort of responsible judge. He is the provider of oversight for more than 24 cities and not just Orange County. I think Riverside's also in there, but largely Orange County cities that are trying to broker that like balance that is loosely articulated in the Boise decision. In that, we have a responsibility to provide beds, but we also want to enforce our anti-camping laws. And basically what's happened in about 24 cities around Southern California is that Carter has brokered over an agreement. It's a little dog. Carter's the judge overseeing an agreement between plaintiffs and advocates for the home, between the cities and advocates for the homeless, sort of like getting something down on paper that if you build a shelter in your jurisdiction for X number, like it's 60, the number here locally is 60% of the point in time count.
Okay.
For whatever reason, Carter has a reason, but that is where we are, because everybody's just throwing at the wall whatever they want to see will stick. Yeah. So, and then the LA Alliance case was filed with the intention of having that replicated in the city and county of Los Angeles.
Okay.
Admittedly, though, the city and county of LA are much, much larger than any of those individual cities. So the situation's a little bit different.
And that outcome is going to play out over maybe several years.
Yeah, where we are right now is that the city and county have agreed to provide 6,700 beds by, I think it's 6,000 by next April, and then 6 months after that, they have to do another 700. That is the initial sort of get.
So in the midst of this human crisis of homelessness, top it off with a pandemic, and now you have a consent decree. It's quite a bit of work to confines to work within.
It's a lot, and yeah, there's a lot going on. It's very hard for individuals to keep track of. Things change very quickly, just for even those working within the system. Meanwhile, you still have people who are trying to provide direct provision of services, and also you have everybody outside, which again, like if the goal is we're going to produce 6,700 beds by mid next year, bear in mind that there are 66,000 people who are literally homeless in LA County. So it's still like the line that I would always use on air for KPCC was just that the judge is basically the judge and plaintiffs are trying to get the city and county to do something. We'll see.
Is that's not a good litmus test for success? What for lot? And this is big,
yeah,
this is another 30-minute conversation. But what does success look like at this point?
It depends who you ask, and every person's going to have a different measure of success. So, as a part of Measure H. As a part of Measure H, the sales tax measure, the county has created a ton of different metrics by which they measure success.
Okay.
That are largely like X number of persons provided services, X numbers of persons who we diverted from other outcomes. Like there are a lot of outcomes out there, but the gold standard is somebody permanently housed. Mm-hmm. But I think that one of the key problems the system suffers locally is that you have this sort of results simulation happening where it's you're counting things and you're just counting beans, and the actual experience for the end user is not it's not actually like there's an article out in the LA Times this morning about people, and I've also reported on this before, but on the outcomes from the sort of LA City's signature program, which was it's called a bridge home. It's basically the city of LA it has invested by now several $100 million in standing up more interim shelters, or interim housing, a bridge home, or bridge housing is the specific term for this particular type. Mm-hmm. And sure, fine, you're providing more shelter. We need more shelter. There's not enough shelter beds for everybody who's there, and shelter is ostensibly a good thing because it means somebody's not outside. The intended outcome for those things, for those structures, was that we were going to have people in and out every 60 days. That was the initial goal. So somebody comes in, 60 days later, they get a permanent housing placement. That's not at all happening. That's not remotely happening. There's people who stay there for, like the Times reporting earlier today basically was like 15% of the people who exit those shelters exit for permanent housing, where the remainder exit for a huge portion of them is just an unknown outcome. They didn't show up for 3 days and that bed became vacant again, or they went back outside, or they went to some other interim sort of transitional thing. So I think in terms of how our system measures success right now, it measures outcomes that for the person who's that outcome, it doesn't really change anything about their situation. Like shuffling somebody from one interim housing facility to another interim housing facility, the system checks that as like avoided homelessness and like move somebody into a shelter. But like the experience for that user is not good at all. And then the gold metric of like success is the placements into permanent housing, like the procurement of a subsidized housing unit where you have a steep government subsidy that person can actually afford that. There's very little of that just because the actual housing stock does not exist or cannot be procured. And I think that's the key measure of success, and that I think is the permanent housing placement. But like there's just not that many. And then you have like locally, there's the strategy of rapid rehousing, where the county is going to provide a shallow subsidy. It depends, just a temporary rental subsidy for somewhere between 6 to 18 months. And this is the strategy that LA is relying on very strongly to transition out of the Project Roomkey, the hotels, because again, we have a bunch of people in hotels right now, and they were put in the hotels, and that's great. People, like, the hotel room is a great, like, piece of individual infrastructure for like managing an individual's like experience of homelessness. Now they're in a hotel, they have a place to like go to the bathroom and wash up. But like, there was never a great, it's still unknown where people are going to go. Like, there's still 3,000 people in LA County inside the motel rooms, and everybody's just really hoping the feds at FEMA don't turn off that tap of money, because if they did, well, something that we don't exactly, then we have to pay everything, and that will become very expensive very fast. Rapid rehousing, the problem is that it's predicated on the assumption that people are going to build income during the like 12-month period where they have a rental subsidy that eventually expires. Mm-hmm. But some people will, but a lot of people aren't able to, for the same reason they fell into homelessness in the first point, which is just that it's very expensive. It's a very expensive local housing market, and the incomes are not there. You cannot earn enough money, especially now in pandemic times, where maybe like, and also at a certain point, like, you cannot expect somebody who's like 58 years old to like go, or I mean, you like 58 years old and disabled, like they have their like $600 a month from SSI, but they can't work. Like, what are they going to do? Like, you can provide them an $800 subsidy, and between that $600 and $800, you could probably find a studio somewhere. But like, once that $800 rapid rehousing subsidy expires, well, they're good luck. But then when I mean by result simulation is that even in like our current metric of success is that rapid rehousing placement is going to get counted as a permanent housing placement. They're fine for right now, but like 12 or 15 months down the line, there's a very real possibility that they're going to fall back out. Yeah. And it would be great if they could have a permanent Section 8 voucher, I guess. That's usually where local authorities, like there's always the appeal to the federal government, which, I mean, we'll see what happens in coming weeks and months, I guess. But like, short of a ton, like, but then this comes back to just like, the county and city do not have the money to subsidize everybody's rent. They have a lot of money, and they could use the money more, like, locally, when you'll have advocates arguing for, like, we're going to defund the police, it's like, take $1 billion from the Los Angeles Police Department, which has a $3 billion budget, and like sink that into local housing subsidies. Right. And like, not going to happen, but like, that is the argument made, and that is a pile of money that the city is in custody of, that like they could presume. And like $1 billion on housing subsidies would go a long way. You would be able to, especially if you turn them into permanent subsidies. Like, I don't know if the local government is interested in creating a permanent evergreen subsidy program, but like, that's like something that like a lot of people argue should happen. And because of the direness of the situation and the apparent abdication of the federal government at this point, it's something that a lot of people are arguing very strongly for, like at least locally in the city of LA.
Well, Mike, it's been thrilling. I'm very interested in your work. I'm very glad that you're able to do this. What a complicated story to follow.
Very, very, very complicated.
Well, thanks for joining us. Thanks for getting us up to speed just a little bit. We've got some great links that we'll be sending out to folks of Matt's writing. Thank you, Matt.
Thank you. I appreciate it.